Good morning, everyone. This meeting is now called to order at 9 o'clock. Now have a moment of silence, silent reflection, or silent prayer. Thank you. Supervisor Villaputo, will you lead us in the Pledge of Allegiance?
Absolutely. Please stand, please.
Thank you. For the record, this is the board meeting of August 18th, 2020. Will the clerk please call the roll?
Supervisor Villaputo.
Present.
Supervisor Patty.
Yes.
Supervisor Nguyen.
Here.
Supervisor Elliott.
Here.
And Chair Miller.
Here. Thank you. Now is the time for public comment on matters within the jurisdiction of the Board of Supervisors that are not listed on the agenda, and any matters listed on the consent agenda. Public comments are being taken via email at sjcpubliccomments@sjgov.org. We're asking that they be limited to 250 words or less. The law strictly limits the ability of board members to discuss matters not on the agenda, so this is not an appropriate time to have a discussion with the board. However, we will definitely follow up on questions and concerns. I'm going to ask the clerk at this time to read any public comments which have been received and to let any member of the public who's listening know if you submit a comment during the course of the meeting to that address, again, sjcpubliccomments@sjgov.org, we will make every effort to read them during the meeting, and they will all be entered into the public record. Clerk, did we receive any public comment?
Thank you, Madam Chair. Yes, we have. The first one is from Barbara Barragan-Perea, who writes, Dear San Joaquin County Board of Supervisors, please find attached a comprehensive letter from San Joaquin County Together regarding San Joaquin County responses to COVID-19 and HABs, as well as equity issues. We are requesting this letter to be included in the board packet for the next regularly scheduled meeting. And this letter, Madam Chair, has already been routed to the Board of Supervisors and will be included in the board business file. The next comment is from an anonymous writer who writes, Dear Board, I'm sure you have been hearing loud and clear that distance learning is not working for elementary grades. Despite valiant efforts by teachers to teach their classes, they are losing their audiences. This is supposed to be a country where we have freedoms and the right to choose. Statistics are coming out that ages 24 and below are not majorly impacted by this disease. If people want to learn from a distance, fine. If teachers want to teach from a distance, fine. However, there must be an option for kids to go back to school. More people die from the flu, TB, alcoholism, obesity, etc. Give us the option to go back to the classroom. The mental health of this county is in your hands. When this country thought segregation was okay, it took extremely brave people to stand up and push back on the masses. I encourage you to take a stand. You have the opportunity to be a champion for our children. The next email is also anonymous and writes, I just wanted to say that I appreciate that Lodi Unified School District has decided to keep our children on distance learning. I know a lot of people will email in complaining about it, but my 8th grader at Millswood has had a positive experience all week. Millswood staff is doing great. I feel good knowing that COVID-19 has been taken seriously by our county. I worry about our children going back and in turn spreading the virus more to our compromised loved ones. As long as we are on the watch list, please keep our children learning from home. Thank you. Candelaria Vargas of SUSD Board Trustee Area 7 writes, Honorable Board of Supervisors, I'm reaching out asking for help for our SUSD students, families, staff, and community. My name is Candelaria Vargas, and I am an elected official representing the largest area in the largest school district in the county of San Joaquin, Stockton Unified School District, Area 7. I'm reaching out to you today because last week was the first week of school, and I was moved out of desperation to reach out to anyone and everyone who could help our families within our district who have been greatly impacted by COVID-19. This past week was faced with many challenges as families, community members were desperately reaching out to connect to essential resources: housing, food, medical care, child care, internet connectivity. All essentials for our students to thrive this school year. These are just some of the bare necessities that our families are in need of, and it's my understanding that with the millions of dollars of funding you received from the federal government aimed at relieving our community's suffering due to COVID-19, you can collectively do a whole lot of something to serve our constituents. It's going to take a coordinated effort from all levels of government to assist the overwhelming number of families in need. My students need you to take action to make these resources more readily available. I respectfully urge you, please do not wait another day. The next comment exceeded the 250-word limit, therefore the first 250 words will be read and the full comment will be included in the board business file. And the comment is from John and Lindsay Radar, who writes, "Good morning, Board of Supervisors. As we finish up the first week of distance learning, I wanted to share what we are going through as a family trying to teach in our home. We currently have a 3rd and 1st grader at Reese Elementary. First off, I want to say that the teachers have been doing a great job, and so much better than the cluster from the end of the last school year. They have come out organized and are doing the best given the circumstances that we are in. Daily, though, there are hiccups with Zoom where the program stalls out or they lose service. They are trying to teach kids over a computer but can't possibly be effective at helping all the kids at the same time in this type of environment. At this point, they haven't even met them, so they don't have a clue what they are dealing with. I honestly feel so bad for the teachers right now. In just the first 4 days of distance learning, both my kids have cried at least once per day. They are bored, feel left out, and are extremely frustrated with trying to learn and complete their daily tasks. My son is constantly done with his portion of work and then starts to get agitated because he spends more time waiting to get direction than actual working. And this is not the teacher's fault. She is trying to keep all of these children who are at different levels on the same page." The next comment is from Nicole Groman, who writes, "As a single parent who works full-time as a preschool teacher, I'm worried about continued distance learning. This week, I've been put in the inconvenient and unsafe situation of leaving my 9-year-old daughter home while I attend work. As I've done my best to monitor her distance learning, it's not possible. And thankfully, we haven't experienced any of the online bullying and inappropriate comments others have. It's scary to think she could be subjected to this since I am not able to monitor her. Being a full-time teacher leaves me no opportunity to assist her with technology issues, help with math problems, or staying on task. I feel no longer able to facilitate school on this capacity. Please consider the well-being and safety of our kids beyond COVID. It's no longer safe for our kids to continue in this capacity. I know I am no longer willing to risk her health and safety by having to stay home alone. Quitting my job is not an option. For now, she'll get done what she can, which will likely equate to all Fs, but that's her very best without a teacher or parent present and trying to learn new concepts. If she's not present all day, we'll just have to move on. This is not worth the stress of trying to stay on task and not falling behind. I understand the state controls much of what we do, but please, when possible, consider more than just COVID when we are able to resume." Michelle Groupie writes, "Dear board members, please consider Terry Withrow's concerns and requests. Our children need to be in school. This distance learning is unhealthy, arguably more unhealthy than COVID-19 is for them. Psychologically, this way of learning is damaging. Physically, this way of learning is damaging. Socially, this way of learning is damaging. The screen time is a huge issue that we will all need to be considering. Of course, there is the whole group of kids where school is safer than their homes. Please help end this madness and let parents who want to send their kids to in-person school do so." The next comment is from a curious and confused parent of 3 who writes, "To whom it may concern, after a week of distance learning, I can wholeheartedly say this is not what is best for my child. They are struggling and frustrated and run down. They need social interactions and in-person instruction. I don't understand why daycares, preschools, and distance learning camps are allowed to stay open, but a school that is helping to better our children and teach them must be closed. Is COVID only a risk for children if children are learning? I truly hope our county can give us some real answers, because right now it feels like we are just adhering to a governor's power trip. Caprice Schuler writes, distance learning is not working and affecting the emotional health of our children. The APA says children should not have screen time for more than 2 hours per day. With distance learning, they are staring at the screen for 4 hours, and this is not okay. Let private schools open. We have small class sizes and a plan to keep everyone safe. If we have teachers and students that want to return to person, let us. The CDC and APA both said kids need to be in school. Why are you not listening to these experts? Why can no one answer the questions of how it is okay for daycare and camps to be open, but schools cannot be open? This doesn't make any sense. Ryan Kern writes, Board of Supervisors, we implore you again to stand up for our county's students. Distance learning has begun and it has failed. There is no longer a question or a hope that this type of education will be enough to educate and ensure the well-being of our kids. We have the proof. The numbers are there in the lack of enrollment and involvement that is being seen in school districts across the board. We are losing our innocent children thanks to the school system and government failing to put kids first. To quote Dr. Park at your last meeting, quote, probably all our kids would survive and do fine, but could we stand to lose one teacher? Where is the moral cutoff there to say how many can we put at risk and how many can we stand to lose? That's the ethical moral dilemma, end quote. You are sacrificing our children. I will ask you, can we stand to lose one student? Where is the moral cutoff there to say how many can we put at risk and how many can we stand to lose? Because we have to abuse to suicide to hunger. For so many children in San Joaquin County, school is their safe place, the only place in the world where they are protected and cared for. We are losing them, and they should come first. Please find a way to protect these innocent kids. The next comment from Jenny Miller, she submitted 2 comments, one general comment and one comment specifically regarding consent items listed on the agenda. The combined comments exceed the 250 words, so I will read a portion of both comments, and the full comments will be included in the board business file. She writes, I pulled my kids from Lodi Unified School District after my daughter was exposed to an inappropriate picture a boy in her 5th grade class showed to students. The teacher had left the Google Meet live classroom but didn't kick students out. And with the absence of accountability, a student did what was wrong. I have heard that student unified kids were subject to pornographic pictures or videos as well. This is just one more reason why students need to be in school in person. The decision made by public health officer to keep schools closed at the recommendation of the state was the wrong one. The Board of Supervisors should have overridden this decision and opened our schools despite any government threat. What my daughter saw and what these Stockton Unified students saw is on you and everyone else involved in keeping our schools closed. In addition to inappropriate pictures, there were problems with lag and glitches, the inability for some teachers to log in to various instruction, and students to get into necessary lessons, and the general overwhelming feelings and emotional breakdowns the first days of distance learning. I can only imagine this will continue as time goes on. The burden on students and families due to the decision to keep schools closed is higher than the risk of contracting COVID-19. And with regard to consent items, she writes, I do not consent. I don't think county funds should be used for COVID-19 media. Billboards and messaging needs to stop. This is a waste of money, and these funds should be used for more important things, especially since the state is already overspending on these things anyways. Monica Fritz writes, Dear Board of Supervisors, our schools need to be open for in-person instruction now. Those who do not want their children to go should keep them home and do distance learning or homeschool. The vast majority of parents want their children back in the class because children need school for their social, emotional, and physical health. As a pediatrician, Dr. Park should know that the risk of not going to school greatly outweighs the risk of COVID. CPS calls are down, and it isn't because abuse and neglect is down. How do we know that all the children in our county are okay many times? The only people to check on them daily is their teachers. By denying the students an in-person, you are failing our most at-risk children. My children have now done over a week of distance learning, and it has been an awful experience. In 6 months, my children have gone from loving school to hating it because they need their peers and interaction with their teachers. The American Heart Association and American Academy of Pediatrics recommends children have no more than 2 hours of screen time a day, and even less for younger students. Right now, my children are sitting in front of a computer for 5+ hours a day. Their activity time has gone from hours a day with school, sports, and extracurricular activities to almost nothing. With obesity on the rise and the health problems that arise from that, Dr. Parks needs to focus on the whole child and not just COVID numbers. Children are suffering, and it's not the virus that is causing it. If he can't take care of all of our children, she needs to resign. The next comment is anonymous. With regard to item 29, page 6 of the agenda, advertising and communication, the use of funds for this purpose of COVID-19 outreach activities is unnecessary and obnoxious. We have had this message burned into our eyeballs and drilled into our heads for the last 160 days. There's no need to waste money on such an initiative. I believe many would view it as patronizing and unnecessary. Quick note on COVID-19. How do we go from 15 days to slow the curve to an indefinite period of uncertainty? Is there any science-based data that supports these continued lockdown measures? Why do we pretend that city-run camps and daycares are different than schools? What are we waiting on to open up and go back to actual living? Why can Walmart be open but my church must be closed? Do any of us really believe this course of action is necessary? If we were placed under oath and asked, quote, do you truly believe the governor's orders are necessary, end quote, how would you answer? Any free-thinking person who can read, know the data, does not support these measures. It's time. Open up our churches, schools, and businesses and tell Newsom to pound sand. Do your jobs. Defend us. Recall Gavin 2020. Lori Lapachette writes, to the San Joaquin County Board of Supervisors, we voted you in office in order to fight during tough times like this. Our children are suffering. Their mental health, development, and education are being put too low on your list of agenda items. This is a major issue that we need the board to fight for. I understand there is a risk of losing emergency funding, but the mental health of our children should be more important than that. School is essential. The numbers are not high enough to warrant closing schools. Distance learning is not working for teachers, students, and parents. It is failing. I am asking the board to take a chance like Stanislaus County board members have done. We did not vote the public health officer into position. We voted each of you into office to fight for our children. Now is the time to do it. The next comment exceeded the 250 words. Therefore, the first 250 words will be read, and the full comment will be included in the board business file. And this comment is from Stephanie Lenzi, who writes, I am writing this in concern of the harmful effects distance learning is having on our children. My daughter has been anxious and sad about having to learn and try to advance her knowledge at this critical stage of development on a computer. She tried on and off on Sunday, just anticipating Monday's Zoom class, not because she hates class or isn't doing well, but because she hates sitting in front of a computer screen for 5 straight hours. I am also concerned over amount of screen time she is now getting, which is out of my control as a parent. Limiting screen time has been a recommendation from AAP due to mental health. My daughter also cried all day long Monday, which not only affects her learning, but also her mental health. She used to be a top student in her class, and her teacher would assign her extra work. Today, I went to have her do homework, and all of it was already done. She is now going ahead and doing extra work on her own because she is so bored in class, spending so much time with kids who need the instruction. She no longer has the ability to have a one-on-one teacher who can prepare her extra work. I am worried my daughter is going to lose all motivation for learning, which she already is starting to. Another issue I do not understand is why can daycare camps be open? Why can, quote, homeschooling camps, end quote, be opened? Jessica Hill-Scotter writes, I wanted to let you know distance learning has been horrible for my children this week. Zoom meetings, dropping, kids crying, they are stressing out, clicking off one assignment and being lost for the next assignment. I don't blame my kids' teachers. I know they are trying, but my kids are not getting the education they deserve. I have had to cut my hours at work, so I make sure they are getting a quality education. But to be honest, I'm not a teacher. I don't know what I'm doing. My kids are suffering in every aspect of life. Why are we allowing our kids to suffer? When will people step up and say this is enough? Do you guys realize all the children that don't have a good family life? School is all they have, and now they can't even escape that. Please help our kids. Don't allow this to happen any longer. Allow sports, allow schools to open, help our children. If we don't help them now and give them the social and educational skills while they are young, they will have issues for years to come. Mary Elizabeth Ebhart writes, generations of my family have been deep and lasting connections with University of the Pacific Stockton and our region. As an alumni of the university and now serving as a regent, I am passionate about Pacific, what it does and what it brings to our community. For me, Pacific provides an unparalleled opportunity for an underserved local youth. Through our community involvement program, we illustrate our commitment and the community by offering at least 40 nearly full scholarships for local youth every year. This program has been in existence for 50 years, and more than 70% of the CIP graduates remain here. Many of these graduates are now leaders in our community. This is just one of many examples of Pacific's investment and commitment to Stockton and our region. The university is one of the largest local employers, and our economic impact is more than $400 million annually. I am grateful for Pacific and the enormous impact it has on our community, education, arts, culture, and economic. We now need the community to invest in Pacific. The COVID-19 pandemic has put us in a financial position which will be very difficult to recover without your help. Please think about the most important role of the University of the Pacific has played in our community for over 100 years and the importance of higher education for our youth and our community's future. Please do not take for granted our university, what it offers to our community, our youth, and the many people we employ. Please consider our request for financial support. Christopher Callahan writes, for 100 years, University of the Pacific has proudly called San Joaquin County home. Our student enrollment illustrates our commitment to the region with more than 30% of students from the county. We are a top employer in the county with 1,500 employees and the driver for the creation of nearly 1,300 jobs. Last year, Pacific provided an infusion of $400 million into the economy. Pacific is committed to this community and through its students and staff provide thousands of hours of service each year. We are steadfast in our commitment to improve our educational and economic indicators. The COVID-19 pandemic has had a tremendous impact in this county, with many businesses and organizations struggling to survive. Pacific has not been immune to these adverse impacts. In the wake of COVID-19, we took the necessary actions to ensure the safety of the campus by transforming our curriculum to fully online and transitioning our students and workforce home. These necessary initiatives, however, resulted in severe financial repercussions. This, coupled with the additional costs associated with operating in this new environment, has led us to seek out partnerships for help. To adhere to safety guidelines, the plans to reopen campus will require significant PPE, sanitizing equipment, hiring additional health staff, testing supplies, and enhancing our technology to operate remotely. In the face of an already challenging financial environment, we are seeking $2 million from the San Joaquin County Board of Supervisors to support our efforts. Thank you for your consideration. Montezuma Sanchez writes, I am writing to express several concerns with consent agenda item number 7. My concern is with this board trying to give Tracy City Council member Rhodesia Ransom and her organization Sow a Seed $616,000 of taxpayer money. Sow a Seed needs to be more properly vetted. Even on its own website, it has no board members listed and no publicly available tax returns. I question that the scope of the contract is within the capacity of their abilities, such as licensed mental health clinicians being on staff. The conflict of interest provision in the contract is of special interest, especially the section on nepotism, which bans relatives from being in the same chain of command in the organization. Ransom's own husband is a director of Sow a Seed, which pays Rhodesia. I am also concerned with the close relationship to Chair Kathy Miller, who herself is a current candidate for an office that includes Tracy in its territory. Ransom is also a current candidate for this very Board of Supervisors. I question whether or not, quote, personal gain, end quote, is at play, which is not allowed per the contract language. I am concerned this contract will benefit not only current political candidates, but also those involved in the organizations who have helped fundraise funds for both candidates' campaigns. Also, the quote contract, end quote, calls for providing mental health services on 6 campuses, even though schools in Tracy are not even open due to COVID-19. Please pull this item from the consent and reject until these questions can be answered. Linda Poteet writes, to whom it may concern, vote no on further spending of COVID propaganda. Everyone already knows about it. Just say no. And Madam Chair, that concludes the general comments that we have. There are additional comments that were requested for discussion items on the agenda.
Thank you very much. We're going to move on to the minutes. I want to make note to the board that we will not be approving the minutes for the regular meeting of July 21st. Those have been postponed. So we are just looking to approve the minutes of the regular meeting of July 7th, 2020.
Barring any changes, motion to approve.
Second motion.
We have a motion and a second. Please cast your votes. And that is approved 5-0. Thank you. Next up is appointments to boards and commissions. Supervisor Patty, do you have some recommendations for us in a motion?
Yes, Madam Chair, I have 2 at the following. I have this recommendation, appointment of 1 position to the Agricultural Advisory Board, 1 U.S. Natural Resource Conservation District nominee, position number 1116, for a permanent appointment, Brandon C. Bates. Next recommendation is appointment of a position to the Commission on Aging, 1 2nd Supervisorial District Representative, position number 2302, Chelsea O'Connell, incumbent. Madam Chair, that is all. I make this in the motion to approve.
Second motion.
We have a motion and a second. Please cast your votes. And that is approved 5-0. Thank you. Next up, we're going to move to our COVID discussion. We've moved this up to make it more convenient for the public to follow. A lot of people tune into this meeting specifically for these updates, and also to increase the productivity of our staff so that they can provide these updates and then go ahead and get back to work. So the first up is a discussion item on a status report on CARES Act funds expended and planned through the end of this year. Good morning, Ms. Gallo.
Good morning. Thank you. Good morning, Chair Miller, members of the board, CAO Nino, County Council Miles. I'm here this morning to provide you with the status report on the CARES Act funds expended from March 1st, 2020 through June 30th, 2020, and the spending plan through December 30th, 2020. Thank you. On May 12, 2020, the county adopted its initial strategy for use of the nearly $133 million in CARES Act funding received. At that time, approximately $118 million was designated to reimburse San Joaquin General Hospital, healthcare services, and other county departments for COVID-19 related expenses, emergency services, and other essential county services. $3 million was allocated to each of the 5 supervisorial districts for a total of $15 million to address impacts to the community due to COVID-19. As you are aware, on June 1st, 2020, utilizing $15 million, the county launched the Small Business Assistance Grant Program and was made available to the public to assist businesses and nonprofits with up to 50 full-time employees with unfunded expenses resulting from impacts caused by the COVID-19 pandemic. Additionally, on July 7, 2020, your board added 3 more grant programs: the Micro Business Assistance Grant for businesses with 0 full-time employees, the Enhanced Small Business Assistance Grant for businesses and nonprofits with up to 250 full-time employees, and an additional $1 million for the Personal Protective Equipment Grant, along with Round 2 of the Small Business Assistance Grant. Collectively, through August 14, 2020, over 500 applications have been processed. Over 370 grants have been approved, awarding more than $3 million in cash grants and approximately 19,000 protective masks. The current round of grants is open to businesses and nonprofits through August 31, 2020. As a prime recipient of coronavirus relief funds, the county is required to submit quarterly expenditure reports to the Department of the Treasury, Office of the Inspector General. The first report was submitted on July 17, 2020, and includes spending by expenditure category through June 30, 2020. A total of $16 million was expended through June 30th, which includes $14.8 million reimbursed to county departments and $1.2 million paid in small business grants. The County Administrator's Office has worked closely with departments to finalize estimated funding needs due to COVID-19 through December 30th, 2020. A total of $83.1 million is projected for all county departments through December 30th. As anticipated, the hospital, healthcare services, human services agency, and the sheriff's office make up about 92% of the total projected. In addition to departmental expenditures incurred and planned due to the public health emergency, projects are planned that will utilize approximately $12.5 million in CARES Act funds. First is the Housing for the Harvest program. There's been an update since the board letter was written. The county has had recent discussions with Adventist Health, and they will be assisting us in finding a provider to obtain 24-hour turnaround testing and results. A total of $1,016,084 is reserved to provide wraparound services to agricultural workers through December 30th, 2020, and 24-hour turnaround testing and results through October 31st, 2020. This will be done through a program developed and managed by the California Department of Food and Agriculture. In partnership with the Community Foundation of San Joaquin, which provided match funding of $100,000 to the project, and Catholic Charities, which will work directly with eligible program participants, county funds will be implemented locally to connect agricultural workers to temporary lodging for isolation and quarantine, providing case management, meals, wellness checks, and related activities. The San Joaquin County Clinics, $464,202 is reserved to provide testing and follow-up medical care for Housing for the Harvest program, the underserved population, and the homeless population. And the private hospital grant. $11 million is reserved for the establishment of a cash grant program to address unfunded COVID-19 related expenditures realized by the 6 private hospitals in San Joaquin County. To summarize, based upon actual expenditures realized through June 30th, 2020, the $16 million, which includes $1.2 million for small business grants paid through June 30th, the remaining funding for small business grants of $15.1 million, which includes the CAO's office projection of $300,000 that will be paid to the third-party contractors that are reviewing the grant applications, projections from departments through December 30th, 2020 of $83.1 million, and planned projects totaling $12.5 million. The county is on track to spend all of the roughly $133 million received in CARES Act funding. Recognizing the amounts for departmental expenses and planned projects are estimates, there is a possibility the costs will be greater. In addition, the projections do not include any unforeseen expenditures that may arise due to the public health emergency. Therefore, $6.3 million will be held in reserve, which is slightly less than 5% of the total CARES Act funding received. On July 7th, your board approved the county administrator to sign state certifications for receipt of funds for additional CARES Act funding from the state and realignment backfill funding from the state. The county has received the first installment for each, $2,967,194 in CARES Act funding from the state and $2,234,402 in realignment backfill funding. In order to account for the funds received and tracking of future expenditures, the Auditor-Controller established the Coronavirus Relief State Funds and CV State Realignment Backfill and deposited the first installment in each of these funds pending board approval. The State Department of Finance has encouraged the use of State CARES Act funding to provide full reimbursement for public health and public safety salaries during COVID-19. Salaries in both of these areas far exceed the State CARES Act funding allocation, and it is recommended to use the State CARES Act funding to partially cover these areas. This concludes my presentation. It is recommended that the board accept the status report on the CARES Act funds expended and planned through December 30th, 2020, authorize and direct the county administrator to negotiate and execute an agreement with Community Foundation of San Joaquin on behalf of the county to provide wraparound services to agricultural workers through December 30th, 2020, and retroactively approve the creation of the Coronavirus Relief State Funds number 20210 and CV State Realignment Backfill number 20220. The county administrator, the assistant county administrator, and I are available to answer any questions.
Any questions from the board? Supervisor Wynn?
Thank you, Madam Chair. First, I want to thank the CEO and your staff in regards to this effort. I think it's certainly a large step in trying to address the increase in the number of cases and certainly the numbers that we've experienced here in San Joaquin County. I think that one of the things that I'm not sure has been maybe touched upon, and I don't want to get in too much detail, but part of the discussion, which I think the CEO's office was already engaged in, was at the Agriculture Committee a week ago, Monday, where Dr. Park spoke, and certainly Mr. Zapian also contributed to the discussion in regards to funding for some of these testing and certainly the housing portion of it and the food. But if it hasn't already been done, and maybe it has been, but I think one of the things that came out of the meeting, obviously this is a group of agricultural representatives, farmers, ranchers, et cetera, growers. But in that discussion, one of the things that was touched upon, and Dr. Park certainly had some good comments in regards to how to address this, but I think from the agricultural standpoint, the concern is what's the protocol? What's the process? If, for example, a farm laborer may be, by virtue of temperature testing, has a temperature, or if they're displaying symptoms, or the public health department has notified them they've been exposed. There's a variety of things. We've already had some outbreaks in the agriculture community, certainly packing sheds, et cetera. So I guess my question is have we established a document whereby, for example, I've had conversation with the Farm Bureau, that farmers can go to know exactly who to contact, what's the protocol. For example, do they just send that particular worker for testing? And if they do, as has been mentioned, the 24-hour turnaround, which is critical because it does no good to test somebody and get their results back after they're 2 weeks in quarantine. So that's important. But then the other question is, do they then, based upon contact tracing, do they test others that may have worked with that individual? Or if there's any kind of symptoms that have been displayed, do they include the living arrangements? Because a lot of these farm workers, and I guess in many respects, a lot of our communities live in very close quarters. So that's an aggravating factor in regards to the numbers. So I guess my question is, are we working on a protocol that we can display or present to the agriculture community that gives them exactly what they need to do? And of course, once they've made that contact, this particular individual is immediately enrolled or engaged in the process. And then more importantly, what does the employer do in regards to protection of other employees or staff, et cetera. So are we working on that? And if we are, at what point are we going to be able to publish those protocols to the ag community?
Supervisor Wynn, Madam Chair, board members, we are working on that. So there's been some recent training that has involved the Community Foundation of San Joaquin, along with Catholic Charities, with the state of California partners. We have 2 clinic systems that we're getting involved with. One is our San Joaquin General Community Clinics. They will be part of that. I know they currently have a protocol with our room key activities. We are following some of those protocols that we will be emulating with our Homes for the Harvest program, but that's primarily based upon a 48-hour turnaround because we are utilizing our public health lab for that effort. The activities that are going to take place with the partnership with Adventist Health, and that's what created the additional $500,000 that's being recommended before this board to the additional piece of the contract with Community Foundation. That is a 24-hour turnaround. That vendor, and we do not have anything inked, Supervisor Wynn and board members, we are still looking at that. That will include not only the testing, the results, along with various protocols of who will receive priority, especially from our farm operations and our ag workers. And as I said, will be available 24 hours. CDFA, as a result of San Joaquin County engaging with Home for the Harvest, we are required as part of the wraparound services to have a 24-hour hotline. And so that will be in place through our work with our Community Foundation. So there will be probably at least more than one set of protocols because we will have a 48-hour activity, and then hopefully we're able to get a contract with this vendor on a 24-hour turnaround. The 24-hour activity with that vendor will also include, we're trying to get contact tracing as part of that effort. Right now, as part of what we do with Roomkey, there is some contact tracing with those individuals. So we will be mirroring a lot of the same activities and successes that we've already experienced with Roomkey as part of Home for the Harvest. But as this board knows and as the public knows, the key is the sooner we can get the results, the better, and the more effective we can stop the spread of this virus among this population. So Supervisor Wynn, the answer is yes. Do I have those in my hand today? No, I don't, but I know staff has been working on those since last week.
Well, I appreciate that. It's interesting in the public comments, there's a concern in regards to expenditures on marketing and a campaign to make the public aware. Interestingly enough, though, I read an article in the San Jose Mercury News in a comparison between California and New York and the way that the residents approached this virus. And it was one of the individuals that they interviewed for this article was from New York, came out here to have a baby in California, but she had mentioned the difference in attitudes between New Yorkers and Californians. She basically expressed her surprise at the kind of the lackadaisical approach in regards to Californians as opposed to the very serious approach of New York. I'm not making any judgments one way or the other. I mean, we all have our own thing. But I think one of the things that we need to do is, yes, as was stated in the public comments, yes, we're all aware of this. I mean, we've been inundated this for over 6 months. But unfortunately, what's happened is, for some reason, some individuals, knowing the potential and certainly the crisis we're in, are not taking it seriously, and that's one of the problems. And more importantly, what this particular program is doing in regards to public health and certainly the funding of medical clinics and certainly the Home for the Harvest and all those things is that when we find a particular area which is, and to use the term hotspot, it is happening, the more resources we can commit to that particular location or community, the better chance we have for lowering the numbers. And the key to the complaints, and we've all been just deluged by emails and telephone calls and meetings and comments by the public in regards to opening schools. The key is twofold. One is we need to get the numbers down to get off the monitoring list. And obviously, because the governor's mandate does provide that once we're 14 days, off the monitoring list, et cetera, you don't even need the waiver, which then gives school districts the opportunity to open. So we need to do our part to reach that goal. But the second part, and we've talked about this from the beginning, is individual responsibility. People need to be more careful. If they're going to go into crowded places where you can't social distance, there need to be some protective equipment worn. I was at an event last Friday. There was probably 80 or 85 people. And in that group, I'd say probably at least 25% weren't wearing masks. And it was in a building, so to speak. So my point is that, one, I appreciate what your staff has done in regards to this, and certainly Mr. Diederich and CEO Daniel Walcott. I've talked to him, and he's very optimistic in this program and certainly on some other things that are happening in the healthcare community. I think the one thing we need to keep in mind is, as far as our healthcare, this is not March. We know a lot more. We have a lot more treatments available. Obviously that there's discussion about a vaccine by the end of the year, but I don't think we're in the same place we were in March, where we closed down society because of this fear. And to be honest with you, it's interesting that in an article that they had a comparison between New York's rapid climb in cases and California's more flat line, so to speak. And if you look at our chart now, opening in end of May, et cetera, it is exactly the same graph chart that I talked about months ago, Farr's law. It follows the same pattern. There's a spike, there's a decrease. There's 21 to 28 days between cases and deaths. What we did in California, I'm not an expert, obviously, Dr. Park is probably more knowledgeable, but just as a layperson, we followed the same pattern 1840 in pandemics, and it hasn't changed. And so what we did, what I think we did in California, and I'm not being critical of the governor, I know he's trying, but my point is that when you open the door, natural physics and patterns that have been around for almost 200 years, they come back. We have the same thing happening in California, they happen in New York, except we've delayed it. So my point is, I really appreciate what you're doing, because I think by focusing on that particular area and reducing the numbers, we're going to be a lot closer to meeting our goals. And more importantly, for those who are very concerned about their children's education, to reopen our schools. So you can't compartmentalize and say, we'll do this, because it's all one big, global project, so to speak. So anyway, I appreciate certainly the work's been done, and look forward to and I agree, multiple protocols. And once we do that, certainly because we're focusing on the agriculture community and a certain demographic in our population, I think we can expand that to other areas, especially when we see hotspots pop up in other places, and do the same thing to tamp them down to meet our goals, hopefully sooner rather than later. So again, thank you.
Supervisor Elliott?
Thank you, Chair. Yes, thank you for preparing an excellent report here on what we're doing with the CARES Act funds, and for the work that's gone into trying to figure out the best usages for those funds, the way we can get the most bang for our buck on those. And I too agree that we need to continue a robust public outreach on this, because it seems that the more we have gotten the word out, the greater the effort has been on an individual basis to try to take just common sense protective measures to try to prevent the spread of the disease. So I think this Housing for the Harvest program is great. We need to ensure that our agricultural workers are able to continue to be productive as well, to keep the agricultural industry going at full speed. One thing that I didn't hear addressed that has come to my attention, there have recently been some stories in the media that the payroll protection program funds that small businesses have applied for and received are actually going to be taxed. Now are going to be considered taxable, and I think most of the businesses that applied for them thought they were grants or could be forgiven, and now if they have to pay taxes, that certainly reduces the benefit. And then also, what about our own small business program, small business assistance program? Are those grants going to be taxed? And if so, are we making that clear to the people who apply for them?
Good morning, Madam Chair and members of the board. Jerry Becker, Assistant County Administrator. To answer the question through the chair, Supervisor, the U.S. Department of the Treasury just probably 10 days ago put out a written notice to all CARES Act recipients across the nation that yes, indeed, the CARES Act funding that is being given out will indeed be viewed as a taxable income by the IRS. So we are in the county administrator's office. We are working on communication out to the 374 awarded grant applicants to make them aware of the fact that the funding provided by the county will indeed be taxable.
Has that had any effect on the numbers of people who are applying? Or have you gotten any feedback on that in terms of whether people have had second thoughts then if it's going to be taxed?
Through the chair, Supervisor, we have not yet put the communication out to those recipients. There are some issues related to 1099s and other issues that we're still trying to work through in the county administrator's office. I believe that we will continue to see a real interest from the community, if for no other reason because of the fact that even though some of that CARES Act funding will have to be returned to the federal government as a taxation, there's still the majority of the funding that can be used by those small businesses to address their rent and payroll and PPE costs. And I would just take this opportunity to once again mention to the board how grateful those recipients are to this board for the millions of dollars that you are putting back out into the community to help these businesses that are so struggling during this pandemic.
Well, I think that's true. I think I think those funds are beneficial, even though the total benefit will be reduced by the fact that now people will have to be taxed on it. But thank you for preparing those communications. We need to make sure everyone understands exactly what's happening with all of these funds. Thank you.
Mr. Becker, as part of our original application process, didn't we put a disclaimer on the application that it is up to the recipient to be accountable for any tax implications or the reporting requirements?
Through the chair, that is absolutely correct. We did, when we launched the original program on June 1st, we did have language in our agreement with each grant applicant that made them aware of the fact that they would be fully responsible for any tax issue related to this funding should the federal government decide that was required.
Great. Thank you. Supervisor Patty?
Yes, thank you, Madam Chair, and thank you for the report. I want to take a little bit deeper dive. There's a lot of information shared, and I would have liked to have seen it prior to have a little more understanding and ask some questions. In our methodology, I know that my office in particular, as all of our offices are being asked to keep track of our hours on COVID-related issues, and I mean, I know that anybody here can account for 8, 10, 12, 15 hours a day COVID-related because it's been very consuming. Is that part of the methodology of where we're getting reimbursements to the county?
Correct, Supervisor Patty. So let's just take the county administrator's office. We have online timesheets. We have actually a cost code that relates to COVID, that's reimbursable. And then we also have a cost code that relates to COVID that exceeds my normal 40 hours a week. That's COVID related. And so what we are doing is we're using those records and those documents, and that's what we're getting reimbursement for. And a number of departments are doing it in the same format when it just comes to pure salaries and benefits as the county administrator's offices.
Okay, so, and what would that number be if we're looking at our reimbursement for time spent? Do we have a ballpark idea?
For salaries and benefits, Ms. Regalo.
Just for salaries? You're saying countywide just for salaries?
Yes.
Okay, that I couldn't. I mean, I could tell you I have a breakdown of the $51.2 million for the hospital. Their payroll is $20.1 million. That's just for the hospital. For our, we had 350,000. We probably had.
She doesn't have one for all county departments from just to salaries and benefits.
Okay. So we have 55 million identified and 20-something million to the hospital alone.
So for the hospital, they had put in an estimate of $51.25 million. Of that, they gave me a breakdown. $20.1 million is just for payroll. For contract labor is $22.8 million. So they have, they have a breakdown. I mean, I can go into a little bit more detail for them, but each department is different.
Okay, understood. No idea about like our time and the administrative staff's time. We have no idea the dollar of that.
Just salaries?
Yes.
Bring it up. Oops, sorry. On our interim report that we had to submit to the Department of the Treasury, it didn't get into that much detail as separating salaries. The one that we do have to report by September 21st does, so it's all broken down. So I can bring you back a better number for countywide just salaries.
Okay, and so here's where I'm going with this. Our time as on the Board of Supervisors, irrespective of whether we're going to a committee meeting or handling whatever business, I believe is, and I think this is applicable across the board. And I understand we've got budget shortcomings and there's going to be some hardships coming to the county, but there's no greater hardship than what's going on in the private sector to the businesses and to the people that are having difficulty because of the forced mandates and closures. So, like, let's say I've got an accumulated number of hours on COVID meetings and discussions and issues of concern, but that's what I'm paid for. That's what I'm elected to do. So I'd rather take the money that's coming to my time and our time. Our responsibility is serving the county, COVID or not. So I'd like to see us break down and really, as a board, consider the application and what we're actually dedicating the money for, because I would rather get this money into the private sector, into the businesses that are forced closed, into the businesses that have hardship, that are going to be out of business, which will hurt our revenue stream in the future. When you lose 40, 60% of your local businesses due to COVID hardships, I'm more concerned about that enterprise continuing than the government enterprise continuing, if you understand where I'm going with this. So I'd kind of like to see a deeper dive in this, that the board really decides, instead of just approving this methodology, but we maybe have a more robust discussion about where we're allocating and how we're allocating it, because this is money that's very important that comes to us. We're responsible for it. All of my hundreds upon hundreds of hours, I don't care. I'd rather put that money into the private sector if we're being reimbursed for my time. I'm elected to do that. That's my job. That's my responsibility as sitting in this position. And I'm sure all the board members feel the same, even though it might be late hours and extra work. It's what we're here to do.
If I may, through the chair, to answer your question, I agree. You are paid to do. We are paid to do a job. Things come up, and that takes priority. But so one of the categories that we have to report is budgeted personnel and services diverted to substantially different use. So when I was given my position, I wasn't anticipating COVID, obviously, and so I should be working on other budget-related stuff, But I've had to, take that, divert all that time and focus on COVID, where I put in multiple hours like you. And so those are, and it's right on here, we're supposed to report that time, totally eligible to get CARES Act reimbursement, just like all the other departments. They receive their position to do a certain position, but not due to COVID. But because of COVID, they've had to divert that time and focus on COVID.
I completely understand that. Now, in this instance, using yourself for the example, due to the fact that you are spending a considerable amount of time on COVID, have we hired somebody temporarily to fill your position and do the other jobs that you normally do?
No, I just work a lot of hours.
So it's just getting done?
It's just getting done.
Okay, and I'm not sure the pay scale of who gets what, if there's overtime for hours or it's all part of what we do. But again, this is what we're here for. So I don't know that all of that extra money, even though we might categorically we might qualify for it. And again, this is a board discussion. I'm just raising the question because we may categorically qualify for it, and that's understandable. However, what else can we use that money for that's qualified? That might be better served. And I get it. I know that we're going to have a budget shortcoming because of, because of the sales and the impact and the devastation that's going to happen and property values dropping. I understand all that. That's possible. We haven't seen it yet. I don't know what it is, but I know there's people in the private sector that are dramatically suffering, losing homes, losing, the ability to provide for their families, losing cars, losing businesses. I personally, and again, this is a board discussion, but I think we need to take a deeper dive into where we want to allocate. Like, for instance, the hospital had to hire additional staff. Absolutely, I can see that as relevant because it's additional staff. But us spending additional time on something, that's the privilege we have of serving the public, in my opinion. I can't speak for the rest of the board. So as we're discussing this, and I know that we all understand the hardships that are happening in the private sector, I think we need to take a deeper dive of exactly what we're allocating before we finally approve it. And I'd like to hear from the other supervisors on that if they care to weigh in. And speaking of which, just while I'm on that subject, I'd like to see this board, it looks like in the report that we had approximately $15 million of grants still open. Is that correct for small businesses? Was that a correct number I got?
Through the chair, no. Over $3 million has already been approved. We have still much money that is in play right now for grant applications that have come in. So no, the board had allocated $16 million. We've utilized well over $3 million of that already in approvals out, and we have more grant applications that are coming in.
Understood. So we still have over $10 million perhaps available?
Correct.
So I would suggest that we come to the board, and again, I'm just a supervisor speaking here, but I'd like to see the board maybe consider and approve some other expansions of eligibility for known business operations that are forced into closure. We've got restaurants, we've got hair salons, we've got sports venues. All these people have leases and mortgages, payments, not mortgages, but bank loans on their businesses without sufficient revenues. So while we have more applications in the pipeline, I think it might be only for what would fit within the parameters, of course, and be allowable. But we may want to expand, and again, bring back to the board consideration of that expansion, those parameters. I think that it would be important because we can help these. I spoke to a business yesterday. They're 6 months in arrears when they open up their business. Let's say 7, 8, 10, 12 months from now, and then they're in arrears for that many months of back rent. It's not like all of a sudden you've got 12 times the amount of business happening automatically. Just take a hair salon, for example. If they missed out on all this income, but they've got rent due in the tens of thousands or even hundreds of thousands a year from now, who knows when this is going to end, then not all of a sudden people are going to book a haircut every day for the next 30 days and they can make up that revenue. So we've got people that have the audacity to be a business owner, people that have challenged, and decided not to just be employed somewhere, but to employ people, and they're struggling to make their payrolls and keep people employed. So I think it'd be beneficial to bring back to this board some new parameters to consider based on the fact that you've got some people that have these expenses, but they don't have the revenue stream, and we know who they are. We know they're not deemed essential, so we know that the governor and, statewide and even locally, they are forced closed. So I think it might be pretty easy to identify who that might be. Next question I have, for Project Roomkey, there was a slide up of additional funding to extend into, was it just December 30th of 2020? Correct. There was another million plus?
It was 2.8 million.
2.8 million. So have we negotiated with that property owner the purchase of that property? I know we've done extended leases for this amount of money. The property's only worth so many dollars. So at some point, I know that was a part of an initial discussion when we were debating where to go and how to use that funds, that we would maybe have a lease option. So we're, basically renting or rent option to purchase. Once you get to a certain number, it's just cheaper to buy the property. So I would suggest that we have that included before we start allocating more money to the same property. Let's say the property's worth $3.5 million and we've paid them $4 million for 6 months. We've overpaid for a property we could have owned, and we'd be able to use it in perpetuity. So I think that would be wise for us to be looking at negotiating that at this stage. Madam Chair, I think that's all I have for this moment.
Okay, thank you. Supervisor Villapudua?
Thank you, Chair Miller. Good morning. Thank you for that presentation. I'm just curious, just speaking to some of the people from the University of the Pacific, and I'm just wondering if we're able to help them at all. I know that a lot of the students support most of the businesses in San Joaquin County, and because there's probably no school, are we doing anything to help the university? I know in New York they've been helping, COVID funds have been helping the schools, and I'm wondering if we're taking any steps to help the school out.
So through the chair, Supervisor, at this point, the county does not have any grant programs specifically targeted to universities or education, nor ones that would are big enough to address the $2 million request that came from UOP. Certainly, the U.S. Department of the Treasury guidelines, there is some stipulated language in there about online learning. There is also some regarding costs associated with that. But at this point, our county does not have any grant programs explicitly set up for that program. We're very focused right now on small business.
Well, is there any way that this board can, negotiate somehow to receive some of the grant money to help UOP? I mean, they're in trouble also, and all the kids that go to that school, basically, they supply business. They help our economy in this town. I think that we should be able to help the university.
So if the board wants to take action on that, our problem is just capacity, Supervisor Villapudua, out of the county administrator's office. Both my department is topped relative to running any more grant programs. Thank goodness we have these two administrators to do the initial screening process. So we could put something out there. That's why the hospital grant, I've already requested EMS to consider running that. They're very willing to do that. But from an educational institution, whether it's the auditor controller or some other county department, but I know the county administrator's office cannot run another grant program. So I don't know if it's just UOP the board wants to consider. We could bring individual board letters to the board as long as they meet, the requirement, but just running another grant program out of the county administrator's office, we don't have the resources within the department.
How about the $15 million though? For each district, every district has $3 million, correct? I would say that UOP helps every district with all those kids that, they contribute to this community. I don't know how the rest of the board feels, but I think UOP needs help, and I think we should try to, open the parameters and try to help out. So,
so the current grant programs end the end of August. What if once that is done, if this board wants to give us some feedback today, then we could bring something back to the board, because then we'll know how many applications we have in the pipeline and of how much that 15 million is available after that process. Because just what if, and Jerry knows some of this detail much greater than I do, what if we already have 15 million of applications in the pipeline? Do you see what I'm saying? I would hate for us to not meet those needs of those small businesses of criteria that has been out there since the beginning of June. And then there was another round since early July that started, I think it might have been the third week in July. And some of these folks have been able to apply twice, which is pretty incredible. So if the board would, at least then that would give us some time to look at, okay, what kind of criteria could fall into that area when it comes to schools? And would we open it up beyond UOP?
Okay.
So if the board wants to give us feedback today.
From my standpoint, I would not want it limited to University of the Pacific. If there are additional funds from the grant programs that could be reallocated, I'd like to see some criteria that meet the CARES Act requirements. And I know one of those things was to prepare for distance learning, where it's been a tremendous burden on all the school districts trying to provide hardware for their students and the materials necessary to do distance learning. I would want to see, I wouldn't want to see it restricted. And, hopefully there would be some funds available. I also am wondering, we had put aside $6 million for a reserve. We could take, I'm assuming, we could continue to take applications for educational, and if we got to a point where it looks like we aren't going to need that $6 million in reserve, that's an additional $6 million that could very quickly be moved into that grant program, because the needs for the school district, they're going to continue through the fall. It's not like they're going to be over tomorrow. So that would be my input on that particular question. Supervisor Patty?
Thank you, Madam Chair. And just for clarity on that, are you thinking public schools as well? Or are you just looking at, kind of where do we go with this? Obviously, there's multiple school districts. We have a private college that's impacted. We've got other learning institutions that are funded by taxpayers. So just kind of a little clarity on where we might go as a board on that.
How about testing for schools if they do end up opening? Just, something that I know staff, I've been part of some of those conversations with both Dr. Park and Greg, so we are thinking about that. That's why we wanted to at least put the hospitals grant, even though it's going to tip the CAO's office over, but that's okay. It's an important area, and EMS is stepping up on behalf of the county administrator's office to assist us.
Testing at schools?
Correct.
I think that's a different subject altogether. We're talking about the funding for the institutions to be sustainable and viable in the current environment. Testing is a whole nother, we don't have students at the campuses to do testing.
But that goes along with what Chair Miller is saying. Say once they open, their issues are probably going to remain into the fall. And so what other challenges are they going to face in the event they start opening?
Sure. Okay. Understood. For other challenges.
That's my point.
Got it.
And Madam Chair, if I may, adding to what Ms. Nino has said, I would just want to mention to the board that Ms. Regalo and I were on a call with the U.S. Department of Treasury Office of Inspector General last week. And if we were to provide funding to public entities, it would be considered a subrecipient, and thereby there are audit criteria that occurs, and the county would be responsible for the use of that funding by the other public entities. The U.S. Department of Treasury, in their guidelines, does not have that same stipulation when we provide funding to private entities. So they have explicitly established criteria that requires us to view it differently as a government entity when we provide grants to other public entities.
So standing up a testing program might be different in that we would have the control over that. So from my standpoint, that would seem to indicate, let's look at what would be the most logical ways we could expend these funds that would benefit educational institutions. We let them make the decision, and we set it in terms of the criteria. Public institutions are eligible for this type of reimbursement. Privates have perhaps a larger range because of the audit requirements, but it would still give our entire educational system the opportunity to figure out where they might benefit and how it would help get our kids safely back in school.
Yes, Madam Chair, and I think it builds upon the suggestion you had made to us that it has worked so well, which is where the county, for example, is buying the PPE and providing it as a grant. Thereby, we do not have issues of folks being subrecipients because the county is controlling much of that, or they are contracting with a private firm or something of that nature to provide the service. The county controls the funding, therefore the audit criteria, it is my opinion, and again, I looked to Ms. Ricala, who participated as well in that meeting, it's very different. I would also just share for the board's information, one of the things that came out of this discussion with the Office of Inspector General that goes to the point that Supervisor Patty had made a few moments ago. Of the 562 applications the county has received from small business, I would say the number one reason that folks are not receiving funding from the county is because, as the supervisor mentioned, these folks do not have revenue to actually pay their bills. Our programs are built on a reimbursement basis. And the Inspector General's office touched on this heavily during the briefing last week, that had we moved towards something that was not a reimbursement model, there would be tremendous audits that would be required after the fact. And again, the county would be responsible for any of those funds that were provided that may have inadvertently been used in a way that wasn't eligible by the recipient. So the fact that the county still has this model that's reimbursement based, I would just submit to the board for your consideration that it really does protect the county in the long run to make sure that those will be eligible expenses going forward in the eyes of the Inspector General's office.
And so would that also be the case with, in the terms of schools with a public entity, if it was a reimbursable basis? So if it was that they had, the district had invested in notebooks for all their students, or, laptops, or whatever it was that they provided to the students specifically for distance learning, and they submitted on a reimbursement basis, does that make it eligible, or are they still subrecipients because of them being a public entity and we still have problems?
So, Madam Chair, I would want to do more research and work with our auditor and external auditors on that. My gut reaction to the question is something that specific probably would be okay. But the fact is the Treasury has all of these other issues. For example, the University of the Pacific talked about tracing, track and trace. If that was being done by a public school, there's the potential that that would not be applicable because there are certain criteria the U.S. Treasury has applied to the payment of government employees that applies only to public sector and not to private sector. So there's a lot of nuance to what the Treasury has established in their criteria that we would have to look at each individual case and the specifics of the funding being spent and then provide feedback so that it's an eligible and reimbursable expense.
Okay. Well, from my standpoint, I would like to see staff do some research on this and come back. What we hear over and over and over are obviously the small businesses, which we've addressed through grants, but healthcare, and we're now talking about grants for our hospitals, which I think is a really good thing, but also education. Those seem to be what we are getting the most input on from the residents of San Joaquin County, that they want to make sure that, the testing's done, the tracing's done, all of the things that we're trying to expand. We have been hearing over and over from the public, we want more of this of these healthcare services to be available, but we're also hearing from a lot of folks in terms of education that the whole system is really struggling. So from my standpoint, I'd love to see some more come back. Along these same lines, we'll take these comments and then we'll finish up general comments. Supervisor Elliott?
Thank you, Chair. From my perspective, I think the recommendation to look at what is still available after this second round of small business assistance grants takes place, I think we should look at what other ways then can that money be best used. This whole process of trying to determine how best to use the CARES Act funding has been something that we've been adjusting and doing additional research into on a continual basis as we've gone through this whole process. And that's the whole idea, is to try to figure out what are the best uses and what are those uses then that will give us the best bang for the buck. Now, and I certainly support looking at ways that we can provide reimbursement funding or assistance to educational entities there, and I think that where we should really focus on that are expenses that will help in getting the kids back in school. That's what we really need, is to get them back for the in-person education. The overwhelming majority of the comments we get about this distance learning are that nobody likes it. Kids don't like it. I don't know whether the instructors like it, but parents don't like it. It just isn't getting the job done. So whatever we can do with any of our CARES Act funding to assist in that process of making it easier for us to provide that in-person education again, I think is a great use of those funds. So anyway, I support just looking at what we've got left after the current round of funding for the small business protection. As was also mentioned, we can look at how much of our money that is kept in reserve is still available, and then we can look at some of these other uses for it.
Supervisor Wynn.
Thank you, Madam Chair. Just a quick couple of questions, actually. One in regards to the misuse of any grant money that we would provide to a business, for example. You had mentioned that the federal government would want to know that was spent as requested, or at least as the application documented, and also that some businesses don't have the money to pay to get reimbursed. Is it possible for us to make the payment directly to ensure that money goes to, like, mortgage or rent or whatever it happens to be, and bypasses the business, but it gives them the relief that they're asking for, without the possibility, since we're going to be on the hook for it, without the possibility of it being spent or misspent for some other use?
So through the chair, that is a discussion that we've had in the CAO's office, trying to determine whether or not that is a possible option. So we are researching that. We do not yet have an answer, but it is something that we've been looking at for a little while now.
Well, your previous conversation in regards to the taxation that Supervisor Elliott raised, I don't know. I mean, what are we up to? $2 or $3 trillion, that we're spending. We're giving this money to businesses that are on their death knell. They are just about ready to close, if not already closed. And to give them a hand up, so to speak, and then jerk it out from under them by taxing them on top of that, which they probably don't have the money to pay, which then probably get a lien against them or some type of, it just doesn't make any sense. I don't know how much money that they're thinking about getting back. I'm sure it's in the billions, maybe hundreds of billions. But, at least until the economy recovers and those businesses are back, and maybe it's an amortization over a long period of time that they can pay a portion of it. But to tax them next year on what they receive this year when they have no business is ludicrous. And I just wonder what the IRS, which unfortunately sometimes doesn't use their best judgment, my opinion. So anyway, that's just a complaint. I do have somewhat, I want to say, an issue. I think UOP is a great university. I know individuals who teach there, and they do a great. It is private though. It is funded by private contributions by parents, et cetera. But on the other side of it, I also think that Delta College is a great institution, and it certainly serves a larger base of our population within the county, and so is Stan State. So I think those are three great college entities. But which has been touched upon before, I know that in the CDC guidelines and a lot of discussions amongst school districts across the country, actually throughout the world, there have been certain protocols that have been instituted to protect the students and teachers in regards to in-class instruction. It would seem to me that if we're going to spend $2 million for UOP, I would rather spend $2 million on testing, because one of the things that's going to happen as we hopefully we're moving forward to getting off the monitoring list and getting to a point where actually school districts can make a decision to open up in-class instruction, it would seem to me that that $2 million and other maybe money that we have available would be better spent. One, as we're doing with the Home for Harvest program, is that it would provide, and this isn't something that would be given to the schools as far as money or grant. This would be a service that we would offer to the school districts, both public and certainly to private schools, an opportunity to have testing provided by the county at no cost. And that would be a tremendous help, especially considering the deficits that school districts and certainly private schools are experiencing. So that would be one part of it. The other part would be, because I know in some of the schools that I've looked at across the country that have opened, there is a certain amount of cost in regards to whether it be the laying out of the classrooms, the additional equipment, shields. I mean, there are just any number of things that are employed to protect the students and the teachers and the staff. And so it would seem to me that rather than giving $2 million to one institution, I would say if we did that, we would open it up to all institutions. But more importantly, I would say first and foremost, that money would be best used by the districts or the schools, both public and private, that are struggling to reopen, and providing them with the necessary equipment protocol. Just the mere fact when they talk about a daily cleaning, disinfecting of the schools is going to cost a tremendous amount of money. So I would say if we're going to spend some of this money in regards to the COVID crisis, I would say I would spend all the money in schools. Maybe we don't spend it all, but as much as we can to protect the students and the teachers to open in class. Because from everything I've heard, everything I've read, from firsthand accounts, distance learning, and it may have a few successes, but by and large, it's a disaster. I have a grandson who's in kindergarten, and his frustration, he can't contact the teacher when he wants to, and he likes that. I mean, in preschool, et cetera. My point is, and it's not just him. I've talked to other parents, but my point is that we have a lot of work ahead of us to get our schools back in business and provide an education. So that's my concern in regards to using the CARES funding. I appreciate Supervisor Patty's concern about businesses, but we haven't even spent the money that's been allocated already for assisting businesses. So I think we need to see how that pans out to the end of August. The other part is that as far as our activities, et cetera, and that yes, we have a job to do, and it's not just obviously the supervisors, it's the CEO, it's all county employees. We have budgeted for our salaries, et cetera, but the one thing that I would argue is that with that documentation that we provide as our COVID time, we are either using it obviously as required by the government or a reimbursement from the government, which is an infusion of money that we wouldn't have otherwise. which means that that money pays for what we've, as Ms. Regala has talked about, her time. And so what we would normally pay for your salary to do your regular job, we can take that money and put it somewhere else. And whether it be for businesses and whatever it happens to be. But I would argue that the biggest complaint that I think most constituents have is that we pay taxes, exorbitant taxes, and we don't get a return, whether it be from the state or federal government. This is a legitimate program that allows us to ask for some money back that we've already contributed in the past. So I would say if we follow the rules and do what we were supposed to do, the monies that we come in that will forego having to use those monies to pay our salaries or whatever, can go for programs or whatever this board decides to use for them. So again, I think that those reports need to be submitted, and the money we receive needs to be decided on how it would be best utilized. So again, I appreciate it. Those particular issues, and as Ms. Nino says, and Chair Miller talks about, I think we need a little more explanation. But I would advocate that we do everything with that money to open our schools. Number one priority, without a doubt. And I think we're making a step towards it with our Home to Harvest program and all the sundry components of that. And I think we can do the same in our schools in regards to maximizing the resources and certainly the availability of in-class instruction. So again, thank you.
So I have a couple of questions. First, we were told initially that there would be FEMA reimbursement for a lot of these COVID expenses. So how does this work in the sense that we are submitting for FEMA reimbursement up to 75% of those expenses, but then we're also getting reimbursed through CARES Act? Are these for different services? Is this to replace the FEMA reimbursement? I know we're not able to double dip, so I'm just wondering, how is this working together?
Right, and you're correct. We are not able to double dip. So we're working with Marcia's team at OES, and so they have the initial disaster. I forgot what it's called, but the disaster cost, which I think we reported was up to $10 million. So we knew a good chunk of that was going to be part of this CARES Act. So they will. I believe the way that Shelley explained it to me. I'm not sure if they're in the audience, but they have to submit stuff in the portal, but they do not request a reimbursement until after the disaster. So working with them, we will not be double dipping. We will remove this, and then they can still, if there's any excess, if there's any left, that they can still claim 75% of that. That's correct.
So
and that'll take about 2 years to get reimbursed through FEMA.
Okay, so that's answering my question. It's the delay.
Yes.
It's that it takes so long to get reimbursement through FEMA. That's why we're utilizing CARES Act money instead of just waiting and using CARES Act money for something else and then just reimbursing through FEMA.
You are correct, Chair Miller. This question was asked by one of the board members back when we brought this project to this board in May. So thank you for bringing it up again, because it's a good reminder to all of us within the county family, but also to the public. That's why, I use the term first in, first out. Since these funds have a deadline of December 30th, of 2020, and we have yet to hear, and believe me, there's been a number of us on the CAO team and outside of the Department of the County Administrator's Office, our federal lobbyists, to see if there's any movement on extending that December 30th deadline. And as recent as Friday with our CAOs Association, we're not seeing that that's happening anytime soon. So that's why this board agreed with staff back in May to utilize the CARES dollars first, but exactly as Ms. Regalo said, and I hear it among our departments too, we're filling out both sides of the paperwork, both for CARES but also FEMA. So in the end, anything that falls outside beyond the CARES dollar amount that's been allocated, we will submit to FEMA. But what's so critical here, we receive those CARES checks up front, which is very unusual for government.
Yeah.
And that's why the whole accountability piece is so important, that we have the documentation, but FEMA at least 24 months after the fact.
And so do we know if FEMA is going to be looking at comparing to CARES Act, and that perhaps, because I know 75% reimbursement is the maximum, that they may reimburse at a lower amount because of CARES Act?
And then Ms. Cunningham could come up too. So I'm going to state it as simple math. And so I'm going to say, so here we're putting all of our dollar amounts into this portal. So say this 16 million, that's in there. And say our total costs that were submitted into the portal might have been 10. That means through the end of June, we may not, for just the county, San Joaquin County as an organization, we probably would not have a FEMA reimbursement for just San Joaquin County, our organization as staff. Probably would not get reimbursed by FEMA through the end of June because we would have taken that reimbursement through CARES Act. And so whatever, essentially, it ends up being the net, same thing through the end of December. Whatever we submit through FEMA, through that portal, prior to it actually being submitted for reimbursement, we would take off whatever the CARES Act funded.
Correct.
Is that?
That's correct.
Okay. I tried to make it as simple math as possible.
No,
because it can get very confusing. And exactly as you said, Chair Miller, it is only 75%, but I'd like Ms. Cunningham to talk about, because sometimes it's been less.
Yeah, it has been, I know.
Good morning, Chair, Supervisor, Council, CAO Nina, Marcia Cunningham, General Services Director. You're correct, it is 75%. 25% needs to be covered by us. So, for example, myself, I'm putting, again, like everyone else, an extreme amount of time in. So anything that's above the 40, I report on the FEMA side of it because my overtime hours are not reimbursable because I don't get paid for overtime. But it is allowable for the 25% that would be contributed from the county side. Another reason why we're being asked to continue to provide that information. So, and again, if we put it through the CARES, we will not put it through FEMA. And I'm sure they'll be looking at that. And what I understand from the initial intent of the CARES Act, because of all the additional costs to the county, was that the purpose is they're expecting us to utilize the CARES Act. And there could even be the possibility of being denied because we didn't utilize those funds that were made available.
That's what I was wondering, if that was part of the component that federal government through FEMA would be looking at, and they would say, well, but you had CARES Act money, you didn't use it for this. And I guess the bottom line is we don't really know yet.
Correct.
Yeah.
I know, though, the intent is that we would utilize CARE, and they're not processing a lot of FEMA.
Right.
Or I'm hearing there has been denials because they want the funds to be going through the CARES Act.
Okay, thank you. So I have another question on the PPE grants that we've already authorized, and you said we had already distributed 29,000?
A little over 19,000.
19,000. So in terms of the dollar amount, we had initially authorized $1 million for that. Where are we with actually making the purchases and spending down that $1 million?
So I do not have the specific numbers off the top of my head, Madam Chair, but we have procured additional masks, hand sanitizer, and disinfectant wipes, and those are all on their way. We're expecting them later this month. So what we'll be doing is offering that as part of our grant program as well. But I don't have a specific dollar amount of how much of the $1 million that will entail.
So I guess my question, though, is we still have capacity in that
That's correct, Madam Chair.
program. So that's something that we could offer to schools, correct? I mean,
Correct. I believe so.
I
Yes.
don't remember what the criteria was on the PPE grants in terms of who was eligible to apply, but it seems like it would be relatively simple to expand that, and that's definitely something that would be of benefit to the educational system.
Do we know, Mr. Becker, if schools haven't already picked some stuff up?
Through the chair, I believe that we have some daycare and others that have. I'm not familiar with any schools. We have had at least one hospital come and pick up mass, and several nonprofits have come to pick up mass.
So the way that grant program is structured, are schools or districts excluded?
I know.
Madam Chair, I want to say right now it is nonprofits and for-profits that are there. We certainly could expand it, and I would recommend to the county administrator and to the board that it would be worth the board considering expanding the volume of mass that we're giving out if we're going to extend it to entities like schools, because we're capping it right now at 400 mass per request. And we are intending to allow entities that have already received mass to come and ask for another group of mass. So we could certainly do that.
So let's maybe come back and take a look at that, because that's another way that we can keep. It's an existing program. We already know it fits the protocols. We already know it's approved. If we can just expand it, we don't really have to do much to allow more folks to access that PPE. And then my last question, I had one of them was on the reserve, but we've talked about that could be allocated. Would that reserve have to just be allocated and moved over into one of these other programs, or does it actually have to be granted by December, the end of December? Go ahead.
So I believe the word they've used is it must be, maybe Ms. Regallo, committed, yes.
Obligated.
But the Department of Treasury just put out new guidelines recently on government entities and how they need to manage this. Clearly, what they're really expecting is that there's been some form of utilization for what they call the first wave of COVID-19. Mm-hmm. And that it's simply that the entity is waiting for invoices and things of that nature that could come later.
Okay. I would just like to make sure that that we keep that in mind for that reserve, that we reserve it as long as we realistically feel it needs to be held in reserve, but that we have a very clear plan for how we will quickly pivot and reallocate that reserve so that we don't end up having to send it back. We want to make sure that that $6 million does get used in our communities. And then the last thing is, I think these graphs and the breakdown of these dollars is a really positive thing for people to see. I think this needs to be very clear. The access to this breakdown with brief descriptions of the various programs needs to be accessible on the front page of our website at the county, so that the public that is interested in seeing how CARES Act dollars have been spent, they can very easily go on with one click. They can access the breakdown, get a brief description of the programs, and they can see that these dollars have been expended properly, that, where they're going in the community, and then we can, have a separate breakdown on the programs that are in the works. So that we're looking at, potentially reallocating grant funds that aren't used or whatever. So that would be my suggestion. We get asked all the time about how these dollars have been spent, are going to be spent, all that kind of stuff. I just think we need to make it easy for the public to get to this information, because it was very clear when you read the graphs, where the dollars were going. And I think if you look at that and you look at the departments where the large amounts of money are going, you can see what the county's priorities are, that it's very much healthcare. And I think that's important for the public to see.
I want
Supervisor-
to, go ahead.
Go ahead.
Oh,
No, go ahead.
Chair Miller and board members, I want to share with you the request for the hospital grant came from our EMS director as part of healthcare services. And as this board knows, our hospitals, including San Joaquin General, they have been so critical to treating those folks who have been severely impacted as a result of COVID. So that's why we brought today's before you. Originally, this board had also thought about we had put before this board to do a grant for just ag operations. But since we're doing what we are recommending today for the Home for the Harvest, we thought that meant the need. And also, as this board knows, we were trying to get some level of collective insight in the county administrator's office from our departments and what the need was. Mr. Culberson has shared with me on more than one occasion where his COVID patients are staying in the hospital 10 plus days more than what the normal would be. And so those are COVID related costs that typically a hospital stay, we're talking less than 10 days, with the level of severity, and it's above 10. So.
Thank you. Supervisor Patty, some final questions?
Yes, thank you, Madam Chair. Question for you is, what we're reviewing today, and are we looking for an approval of these, or is this just a report?
Supervisor Patty, this is a report. So what we're asking you to do is to accept the status report on the funds that are expended and planned to be expended through December 30th. We are also asking the board to delegate the authority to negotiate and execute the agreement with the Community Foundation for the ag workers in the Home for the Harvest program, along to retroactively approve the establishment of the coronavirus state funds, new fund, along with the state realignment backfill fund.
Got it. So my question is then, as we've talked about, we know that we've got additional expenses for overtime or staff, and then I've brought up the question of reimbursement county. Supervisor Wynn is in favor of reimbursing the county for his time. It's a very unique time, and it's great that he wants the county to be reimbursed for it. I don't want my time reimbursed. My time is in service to the community. So my point is, are we able to, and we're not actually receiving that money into the county, even though we're eligible at this point. Have we been reimbursed to the county based on what we've submitted?
Yes, we have. So as of the end of June and further, we have done reductions, and the way that comes in, I'm going to dive into the weeds here. It comes in a reduction to an expense. And as I said, there are timesheets that are attached, and a transfer is done, and it is approved out of the county administrator's office for all of the county departments that are submitting that information. So for instance, if there's salaries and benefits for public health, additional staffing for tracking and tracing, all of that gets submitted, and a reimbursement is done to the Division of Public Health. So we are doing that on an ongoing basis based upon direction that we received back when we brought this original program to the board back in May.
Understood. Thank you. I'm in favor of perhaps amending, based on the conversation that we've had, going forward, since there's still a pot of money that's still available, and as Ms. Cunningham had mentioned, FEMA is going to potentially reimburse us to a percentage which might be quite adequate, even though we may have to wait a little while for it, but it might be adequate versus 100%. We might get 25 or up to 75%, whatever that may be. But if we can open up and find out the parameters, as our CAO's office and Mr. Becker have indicated, they're looking into how we might be able to directly pay for lease agreements that are in default for businesses, and you've looked at that, as was mentioned earlier. Since we're looking at opening up the parameters, we may want to shift the focus on reimbursement of county, excluding, of course, overtime and additional staffing, that additional expense. But I think that it would behoove us to maybe bring back to the board, option A or an option B or even option C of where we can use those funds. And if by the end of December we've not fully utilized that pot and the county is eligible of reimbursing our expenses as qualified, then we can make that decision. But if we can get more money into the private sector, as the CAO's office and Mr. Becker have indicated, and as we've discussed, whether it be through university, whether it be through testing, if we can get more of that money out versus just reimbursing for our staff. Again, my time is my time. And again, I don't believe the county should be reimbursed for my time. This is what I'm elected to do. And I serve that, with that responsibility, whether it's COVID related or it's a hospital meeting. It's what we do with our time. So, I'm in favor of maybe amending what we're doing based on what we've approved in the past, but we've got, another 4 months before we've got to utilize this funding. I think we may want to look at opening up the parameters.
Chair Miller and board members, I would need action on that to change that, because I've got to tell you that will be a lot of work, changing course at this point. But I hear what Supervisor Patty is saying. I think it's somewhat, there's that $6 million reserve. I've got to tell this board, I do not believe we're even covering all of our costs right now. And this is me, being down in the weeds as much as I can be, and my own staff, and hearing from department heads. We have a hospital that is essentially almost, $450 million, $480 million budget annually that operated at a deficit last year and has for the last 2 years. And I know their costs are extremely excessive as a result of COVID. So I just put that out there. So I would need direction from this board if this board wanted us to change course, because that doesn't just take, direction from the CAO to department heads. We would be literally going back and looking at beyond just timesheets, like I said.
Well, through the chair, this is maybe this point going forward. Understanding that the hospital, overtime, additional staffing, that expense, the incurred loss, I'm not negating any of that. But I'm talking about the reimbursement of staff time. Mm-hmm. That's not an additional cost. It's just staff time. That may be $2 million, that may be $22 million in the next 4 months. I have no idea. We didn't quite qualify that number of what it's been since March. So I think going forward, it might behoove us and this board to shift our priorities and open up the parameters and use of those funds, whatever falls within that which is allowable. I'm not saying we're reinventing. I'm not saying we're risking anything. I'm not opening up Pandora's box to, create a grand problem for the county. But if we open up the parameters and we find buckets that we're able to utilize that we are not fully utilizing, as you guys have indicated that you are looking at as it is, I don't think it's that big of a deal. We know that there's additional staff. The sheriff's department has additional staff, has overtime expenses because of COVID. The hospital identified overtime staff, additional staff. We understand that. Those are known costs. So I think it's pretty easy to decipher. I don't see how it's a tremendous shift of and labor to do that. I just think it's a matter of shifting our priorities and opening up the parameters of where some expenses can go.
From my standpoint, I don't support redirecting the activities to submit for reimbursement. The reality is our budgets have not seen the major hit yet in terms of loss of revenue. That's going to come in the next 2 years, maybe even 3 years. And there won't be CARES Act money then. And so for us to submit for every nickel that we can qualify for now allows us to balance our budget and to perhaps hold some of our own dollars in reserve, which don't have strings attached. The CARES Act dollars have tremendous strings attached to it. They can't be used to backfill revenue. If we can hold some of our own funds in reserve, that's what it's going to take for the county to get through the next couple of years without massive layoffs and reduction in services to the residents of San Joaquin County. I absolutely appreciate that that you don't want to submit for reimbursement for your salary, but the reality is the county will have to pay you your salary for the next 4 years, whether or not we get reimbursed or not, which means other employees at the county may lose their position because of budget shortfalls. I have served in elected office during a major recession, and I can tell you that it is painful in the extreme when you have to begin laying off your district attorneys, your law enforcement officers, your correctional folks, your probation folks. Everyone takes a hit, and law and justice is the largest percentage of our unrestricted spending in the county. You cannot balance a budget, a public budget, without impacting law and justice. It's impossible. I can just tell you it is impossible. You can close almost every other department down and you can't get to it if it's a bad enough recession and your revenue is hit badly enough. So I just think we absolutely need to submit for all the reimbursement we can right now, because going forward, if we have more discretionary money in the county, we can help our businesses. We can help the community because we will have county dollars that won't have the strings attached. So from my standpoint, I would not change course. I think we need to take every lifeline that is being thrown right now, because 24 months from now there won't be any. And the federal government and the state, they will not come to our rescue. I've been there, and they will say, you are on your own, balance your own budgets. So from my standpoint, we need to submit. Supervisor Wynn?
Yeah, real quick. Supervisor Patty somehow indicated that somehow I'm being greedy by getting reimbursed.
I never said greedy. I never said the word greedy.
I understand. Just let me finish. I guess the point is that the projection for the Board of Supervisors is $347,000 for the remainder of this year for COVID-related, which would be funded through the CARES Act. What I hear you suggesting, and I understand, I understand wanting to fix businesses just like everybody else. But to say, well, let's just forego the reimbursement, that means $347,000 that we would normally get through the CARES funding, we wouldn't have, which means that $347,000 come out of the general fund, which we can't use for anything else. So it isn't about me. I get paid, you get paid, we all get paid. And to somehow argue that we should be more charitable and take this money and give it to businesses, there is no more money. If you don't take the reimbursement from the government, there is no money. You take it out of the general fund, which is no longer available for anybody, including businesses. So I just want to, I don't understand how your argument by not getting reimbursed is somehow being cavalier and charitable when in fact it's just rejecting money that is going to be handed to us as part of the process. So anyway, but again, I would agree with Chair Miller that every opportunity to supplement our budget by virtue of grants, funds, whatever comes is important, because at some point in time we are going to pay the piper because of the loss of revenue, certainly because of this pandemic. So anyway, thank you.
I have somebody else here. Supervisor Villapudua.
Thank you, Chair Miller. I just want to bring up UOP one more time, if I don't mind. I know they're a private university, but I don't understand is by them we don't help UOP, and all other Delta College is also a perfect example. And what are the impact of the community? We don't help schools like this, these big universities that bring all these kids and that help. They do a lot in the community as far as all these kids. They pay rent. They go to businesses. They support local businesses. I don't understand why we just can't help these two universities, well, Delta and UOP for that matter. I was hoping this board can take action and maybe in the future, the next 30 days or 60 days, create we can discuss it again and create some sort of grant for them.
So Supervisor, Chair Miller, board member, Supervisor Villapudua, based upon what I heard today in my notes, and I know Jerry and Sandy, Mr. Gallo took copious notes, we will come back because the end of August is when the small business grants program ends. Hopefully by the last board meeting in September, we could share with you what excess funds, what may remain from that small grants fund, and then the board could decide at that time to see what they want to do when it comes to education, and we'll bring some options. We'll also fully vet that other piece from the business, if whether or not, I think, Supervisor, when you had brought up, why couldn't we possibly pay their mortgage company directly because they didn't have the revenue to pay for it. We will do some additional due diligence in that regard, but we will include educational institutions. And if the board wants to give us direction now, we could check on the PPE loan and go ahead and open that based upon today's discussion to all of our educational institutions. So at least Supervisor Villapudua, we could start there, but we will bring some options because then we would have had almost 30 days. And I know we have an early board meeting in September. It might even be the 15th. So hopefully we could make it by September 15th or the first board meeting in October. That just popped in my head.
That'd be great if we could open it up, and then maybe the CEO's office can engage with the OP to find out what's needed, and even Delta College. And if we could take action today, that'd be wonderful.
So I heard from the board kind of including all those other public schools also, Stan State, I think one of our board members brought up Delta, UOP. So the upper ed schools, we will definitely reach out to see what we might be able to form as a result of it. And I apologize, it'll probably be the first board meeting in October because I don't think we'll be far enough going through all the applications in the small business grants from it ending the end of August. And as this board has been very diligent to meet those needs, and as I said, we have multiple businesses that have now been able to apply twice, and I'd hate for us to not meet all of those needs and have a greater insight, at least be down to 25% or less of those applicants to know, what that status is. And we may have part of the remaining 15 million that's still in that small grants and possibly consideration of a portion of the reserves at that time.
Okay, so would you need that in the motion if we were to approve this?
No, it's direction. As long as I'm seeing some heads nodding from board members, would that work for all of you? Okay. So it'll probably be the first board meeting, Supervisor Villapudua, in October. If we could come earlier, believe me, we would. But as I said, we're trying to do all that we can, and we want to get this home for the harvest. And thank you to this board for that consideration. And I need to thank those partners, Community Foundation of San Joaquin, Mr. Zapian, Catholic Charities, and both of those agencies are coming to the table prior to board action, along with Adventist Health. Mr. Wilcott came forward on the 24-hour to assist, and potentially provide some health care, clearly a need in this community, and also the Community Foundation bringing some matching funds. And please know the size of it can easily be scaled up if additional people would like to participate financially. And I would encourage those to do so. And we will more than be willing to accept that and to scale it up as needed. And we'll bring this board, whether it's here in public or even just through memo, a status of that program, because our goal is to make it as successful as Room Key has been for this community when it comes to the homeless population.
Great. Thank you. Unless there's more discussion, I don't see any requests here, then we are looking for a motion to accept the status report, authorize and direct county administrator to negotiate and execute agreement with Community Foundation of San Joaquin on Home for the Harvest, and to retroactively approve creating the 2 state coronavirus relief and realignment funds.
So moved.
Second.
Okay, we have a motion and a second. Please cast your votes. And that is approved 4-1.
Thank you.
Thank you, Chair and board members.
Thank you. And I apologize. I should have asked the clerk if there were any public comments received on this item before we voted. I apologize.
Thank you, Madam Chair. No, we have not received any comments for this particular item.
Oh, well, that's a relief. I know. Okay, we're going to move on to our regular COVID update. And first up is Dr. Park.
Good morning.
Good morning.
I just have some data to share with you today. Okay. Sorry, this is just a little bit fuzzy. These numbers are generated every morning by the epidemiologists at Public Health, and so this was basically uploaded into my slide deck just before coming here. And it is a bit fuzzy, but if you look, you'll see that our current case count is that very last line at the top, 15,201 positive confirmed cases of COVID thus far in our county, which represents an increase of 131 cases in the last 24-hour period. Our death count stands at 280. So this is information that I was not able to share with you 2 weeks ago because the numbers were so off due to the state's data glitch. The state did correct this last Sunday. They found the error with their data management system, and since then, daily, every county has been working to make sure that our numbers are all correct. What we did do was we put out an order asking all labs to simultaneously, as they report to the state their numbers, give us their numbers as well, dating back to July 25 when the problem started, so that we can then go back and compare our reports that we're receiving directly from the labs with what the state's CalReady system is showing. So our IT team is working on this, and it should take probably by the end of the week to really firm up these numbers. They're likely to be pretty accurate, but they might be some undercounts on some days. So as we go through that process of confirming that CalReady does indeed have all of the positive cases accounted for, we will have more numbers to share. But this is likely to be pretty close to reality. You'll note that we were averaging some very high days, about 250 cases a day. And if you look along the bottom, we've been in the hundreds, as high as 200s, of course, but there have been some days where we've had new cases less than 200.
Dr. Park, I apologize. It looks like the clicker may not be working, so I can do it manually from here.
Okay, thank you very much.
When you're ready for the next slide.
So next slide, thank you. So in the meantime, while the data was frozen with the state for a good 2 weeks, this was the only number that we really had to follow, and I'm thankful to EMS for sharing this. And this we know to be accurate because it is daily reported by our 7 area hospitals. And it shows you that we were at one point, if you look at the peak of the blue line, we had as many as 262 people with COVID in our hospitals on July 27th. You'll see that that number did steadily come down, which has been very optimistic to look at. We had a slight bump and a rise up again in the last couple of days, but our total today stands at 160 people in hospital. And so when you compare that to our highest, which was 262, we have 100 less people in hospital today than we did on July 27th at the peak. The number of COVID positive people in our ICUs is 53, that's that red line, with 33 of them on ventilators. this still represents an ICU capacity of 123%. So we've been over 100% capacity in our ICUs since early July, so over a month that we've been technically in surge. This number, 123%, was looking quite good yesterday when it was down to 106. It has been as high as 149% on July 31, and then 146% was another high on August 10th, just a little while back. So recently it's been as high as almost 150. And so looking at it at 106 yesterday was quite encouraging, but since yesterday's numbers, we've had a few more admits to our ICUs, bringing our ICU capacity number back up to 123%. Of the total number of people in all of our ICUs across this county, 43% of ICU beds are occupied due to COVID. Next. Again, this is a slide from EMS that shows that we have a total hospital bed capacity of licensed beds, 982, and the most current numbers show that we have 684 of those beds currently in use, and as I said before, 160 of those are for COVID, which makes up about 23% of total hospitalizations. Next slide. As I said, the numbers were frozen at the state between about August 1 and just literally yesterday. So they have been working on that glitch, and finally yesterday in the afternoon felt confident enough to re-release the county data monitoring list. It has had just dash marks across because they weren't able to give us numbers. So every county has been waiting and waiting on this to see where they stand. And you will see here again, just taking yesterday's numbers from when this got reposted yesterday. We're doing okay with testing. Again, that very first bar is not a metric that is used to keep us on the list. It's just a number to tell us how we're doing with our testing. And the state's goal for us is to do at least 150 tests per 100,000 population over a 7-day average, and we're at 177. This is lower than it has been in the past, but still meeting the goal. Where we have numbers is where we're dinged, and that's under the category called elevated disease transmission, and there's two parts to that. There's a case rate per 100,000, and you'll see that we're at 230.7. This, again, as I have explained in the past, is a number that is measured with a 3-day lag, and they would like us to be at a case rate of 25 per 100,000. Our testing positivity rate has dropped a bit and now is at 11.4, but the state goal is to have a testing positivity rate of 8%. This is measured with a 7-day lag. The other categories for percent hospitalization change, ICU beds, and ventilators now show check marks, which means the state feels that we are passing on those numbers. So they're the two categories still that for which we remain on the list. I will show you the next, not yet, but in just a second. Just wanted you to kind of look at those numbers, 230.7 and 11.4, and keep those in your mind as I show you the next slide, which I just want to explain to you is a little bit different. So the next slide. This is the snapshot tool, which is shared with us privately by the state, and you need a password to get to it. And I want to show you that this is just a little bit off of those numbers. Instead of 230, it says that we're at 226. The snapshot is mostly supposed to mirror what is publicly facing, the numbers that I just showed you before. But it's a little bit off, and I don't know why. It's usually right on target, so I have a feeling that this will be corrected over time. But it's not largely different. But I wanted to show you again the 5 categories for which we are, for which people get on the data monitoring list. Here is the case rate per 100,000. The second bar is the testing positivity, which instead of 11.4 says 11.3 on this tool. But I'd like to share it with you because I want you to see that in the green we are going down. We had been as high as a case rate almost to 400, and a couple of weeks ago, right before the system froze, it said 308, and then we were frozen. So this is an improvement from just 2 weeks ago. And next slide. On Snapshot, it doesn't ding us for our for any of the other three categories. It does ding us for the percent of ICU beds, saying that we're right on the margin at 20%. As I said to you before, we had a check mark on the state. So what I want to clarify here is that although I have access to this tool and I'm asked to use it to see whether we're getting worse or better and to see how we're doing compared to other counties, the public-facing grayish-white graph that I just showed you before, which is available on the CDPH website, is the one that is used to show us whether we are going to be remaining on the county data monitoring list or not. Just sharing this with you to show you again all the green down arrows that show the improvement that we've had. And one of the main reasons why I like to look at Snapshot is because it gives me a sense of how I'm doing in the county. So the next slide. I've shown this to this board before, where we were as high as 5th place for our case rate, and you'll see now that we are in 13th place. Nothing to brag about, of course, but I just wanted to show you there's some reassurance here that we're moving in the right direction and that we're not really one of the worst off counties in the state, and we've made improvements as far as our ranking goes. So I'm very encouraged to see that. Next slide. And another reason why I like to use this tool is because it gives me some interesting markers that I don't otherwise have access to. This is a graph, and I suppose I could have made this graph, but it's a 14-day average, and it shows how we compare to the state as a whole. So the blue line is the state of California, and the orange line is us. And you can plug in any county and get your line. If you look at this, at the state as a whole, this ends, it's not up to today, August 18th. This ended about August 15th, the very right side of it. And it says that around August 15th, the state had an overall case rate of 180 per 100,000. And ours was the 226. So that's where we are at. But it's just encouraging to look at it visually to see how high we had been and how far we've come down to really be still on top of the California average, but doing much better and much closer to the average for the state. And next slide. This is the 7-day testing positivity rate. And, the governor has said that the state's at about 6.5% to 7% testing positivity. He always comes out with those numbers. That's the blue line. Our number had been as high as 17.8% in mid-July. And that's when the governor came here and said that across the Central Valley there were some very high testing positivity rates, as high as 18, and that was in reference to our county when he said that. But if you look at it now, we're at that 11.3 or 11.4 testing positivity rate, still not the 8% goal that the state would like us to be at to get off that monitoring list, but making progress, as you can see. And so next slide. I've shown this picture to the board before to show you what's available on the governor's website. So this is off the covid19.ca.gov website. And I show it again just so I can be clear to anybody who's watching that although this website says that we have a case rate of 428 per 100,000, again, it is that other graph that we are using, that the state is using. Many health officers, including myself, have complained that the numbers don't match up. And in our case, they're vastly different, from 226 to 428. Very hard to identify why this is. And when the State Unified Support Team was here on August 6th and 7th meeting with us, I did bring this up, that the discrepancy was very large. This is, as I said, from the governor's covid19.ca.gov website, and I know that a lot of the public like to go to that website, and it's very easy to find this map and click on our county and see these numbers. The CDPH, which is regulating the data monitoring list, has no control over the people at the governor's office that are making this calculation, and we are demanding to know how the calculation is being made. But we were reassured that the number we are using is the number on the CDPH website. So I wanted to bring it forward just to make that clarity. They also say here that we have a testing positivity rate of 12.3, so a little bit higher. It's interesting to look at. I still like to look at this because it does give me a sense of whether we're up or down. And some reasons that were given for why it's different is that lag again with the state monitoring list. The calculations were made based on lagging numbers, and they did that purposefully, and this supposedly does not have that same lag. Okay. The next slides are from something that's public-facing. This is the CalCat data. Thank you. And so anybody could access these numbers by going to the governor's calcat.covid19.ca.gov. I take it with a grain of salt, always, because I'm not sure exactly how to use these numbers, but I like to share them anyways because there's obviously a lot of effort being put in by these various data scientists. There's been some talk about getting rid of the ones that are way off. But I don't know. They're really looking into it and trying to refine it. And they feel that the more data scientists that add their numbers to this collection, the more the ensemble will be accurate. But it's telling us that our R effective right now is at 1.25, so a little bit higher than it was the last time I shared this with you, which is still indicative of COVID-19 spreading in our county and increasing. And next slide. One of the reasons why I have difficulty interpreting this is because those blue lines, which show how you're doing as a county compared to other states, has us in like the 5th place as far as having one of the higher R-naughts, which is not a good thing. But literally, a week ago, we were way down on the right side of this graph. So kind of hard for me to utilize, but supposedly this data has caught up with the glitch, and this data is what the state is saying is currently accurate. So a little bit disappointed to see the R naught showing that we're still having some spread and some increase, potential for increase here. And as you see, our county's in a darker color showing that we don't have the greatest R naught. So it's just precautionary because although we can look at our hospitalization rates and our numbers going down and it's all very encouraging, it's a short-term decrease that we're looking at. And what we really need to go for is a more longer-term decrease. And I'd like to be optimistic about what I'm seeing, but we really, really would like to see those graphs from EMS continue to go down. We don't want it to stall where we're still at 123% ICU capacity. We want that to be driven down more and more. And that's what I don't know yet is how we're going to be able to drive that down. If we're still at an R naught of 1.25, it's not so great. So we still need to do our messaging, and we are. So the good news is that as time goes by, we're getting better and better at the messaging we're doing and with involving others, and the work goes on. It's not stalled just because we're looking a little bit better by numbers. It's actually ramping up. And so I'm very hopeful that by ramping up all our efforts, getting the messaging out there, and working with more organizations and having things such as the Harvest Program, which we just did talk about earlier, all of these things should really benefit us, and I'm hoping that our R naught gets driven down as well. Next slide. These are the forecasts put out by various data scientists, and again, the ensemble shows that happily the line is going downward on this one. And so we are forecasted to have less people in hospital. And this is really what bears out when we look at the EMS numbers, is that our hospitalization rates are definitely going down. When I say that we have 160 compared to 262 last month, and we believe that eventually that will lead to decreases in ICU rates. There seems to be a lag if you look at other counties and other areas of the country where hospitalization rates started to go down. ICU rates fell 2 to 3 weeks later, lagging behind that overall hospitalization number. So as more people recover and get out of the ICUs and less people get admitted to ICUs, we're expecting our ICU numbers to go down too. So this is very encouraging to see this. And the last slide. This ensemble shows just a tiny bit of an upswing in the curve, but not as bad as it might have looked before. And our projected numbers for deaths by September 16th is now 304, which is less than projections we've seen before. Again, this is, of course, all forecasting. And so I wouldn't be able to tell you how accurate that is, but just wanting to share with you what the data scientists are showing us, who have been hired by the state to give us this information. So the last thing I want to say is that in order for us to get through this fall season, I would really encourage everyone to get their flu shots. This is going to be so important for the next few months and even the next 6 months as to how we get through the concomitants of flu and COVID together. I'm sure you've read about it in multiple newspaper articles talking about how flu season's predicted to be bad because it's going to complicate our COVID pandemic. So another mission that we're on at Public Health is to really increase messaging about that and hopefully help with the schools. Schools are not in session right now, but we still want to help with getting those kids vaccinated. So as much as the board can help us get that message out wherever you speak publicly, please go ahead and encourage flu vaccination.
Dr. Park, do we know when the flu vaccines will be available?
They're usually available in the beginning part of September, and many companies are ramping up their production and producing 10 to 15% more than they normally would in a year because the demand is expected to be greater. So we should be having it. September is usually the start.
Great, thank you. We have a couple questions. Supervisor Patty?
Thank you, Madam Chair. Through the Chair, Dr. Park, if you were able to listen to the many cries and pleads from the public, when are we opening up public schools? I mean, just what do we got? What hope can we give parents? When can we open up the schools?
So that is a state mandate that you can reopen all schools once you come off of that data monitoring list for 14 days straight.
How, based on what the trends you're seeing, again, looking for hope for these parents, what are we seeing? What indications do we have?
Well, as I said, we had a case rate of 308 just a couple of weeks ago, and now we're down to 226. I didn't know what to expect when the whole system unfroze yesterday. I really had no idea whether we would be down that low, and I was actually quite pleasantly surprised that we were at 226. Because I didn't know if it would be 280, 250, but we're down. But as I said, the metrics need to be below 100 on itself or below 25 and below 8% positivity. And I have no way of predicting when that will be. I wish I could say to all the parents who want kids back in schools that it would be next month. I don't think that's realistic, but I can't say whether it would be 2 months or 3 months or 4 months. I really don't know, but looking at how far we dropped just in 2 weeks, it's very encouraging.
So, question, Governor Newsom had released some parameters allowing discretionary decision-making for medical directors locally. Do you see any ability for us to have a discretionary decision to open up schools, some schools, any schools, in any capacity? Based on what, he's given several guidance, parameters allowing local decision-making in that regard.
So I believe I did hear the governor have some comments last Friday, and then Secretary Dr. Gowley got up and seemed to walk it back a bit. And so it's a little bit of a confusing message what's coming out of the state. I do understand what the governor said. I would think that the beginning process for us to reopen schools would be through that waiver process. That is probably the best way to start approaching this.
And do we have any applications for waivers that you're considering so we can maybe get there, slow walking it, but maybe get there? Is there any wiggle room here?
So I was, to be honest, taken by surprise that the state put out language that said each county would have a waiver application. That is not what we were told. I was under the assumption that the state was going to have a universal waiver application, and that is not how it was rolled out. So we do need to make a waiver application process, and we're in the process of developing that, and it's with county council right now.
When will that be ready?
We'll defer to county council on that question. Thank you.
Through the chair, county council.
I will finish my review of it before the end of the week.
Excellent. And it comes back to you, and then comes to us, perhaps. Question for you: when it comes to, I had a conversation with a family friend who was COVID positive, and he's taken several tests that come back positive, positive, positive before he gets a negative. I think it was actually, he said 4 tests, 3 negatives, three positives before he got to a negative. Is that same one person, now that they've got 3 positives, piling on to our positive count? Or is this singularly identified as an individual for the positivity rate?
No, thank you for that question, Supervisor Patty. It counts as one person, and that is statewide, that is the way it counts in the CalReady system. And that is because this disease is still so new. It's only 6 months old, and from what we know, anyone who tests positive again is probably still likely shedding virus from that very first infection, and we don't consider it to be a case of reinfection. The science is still out there, but science shows that people cannot be infectious per se and not have symptoms, but could still have virus particles that are picked up by the PCR testing. And so we don't actually recommend that repeated testing. If you are over your symptoms, you are over your isolation period after 10 days, as long as you're afebrile and symptom-free for 24 hours. So we use a symptom-based approach. But people who do choose to get retested are counted still that first time as one case. In a year, when we know more about COVID, and if we have someone who tested positive in March and test positive again next March, maybe that would be counted as a second case, because by then we might say that person really did have a reinfection as their immunity waned off and got a new infection. But at this point, that's not the case.
Got it. So again, one person, three positive tests is still one person.
Yes.
Thank you very much. That's come to me from many people. I appreciate that. I also appreciate the flu shot recommendation. I'm a big advocate for it. I think it's fantastic. There are some clinical studies and proof that supplements boost immunity, such as simple as vitamin D, vitamin C, and zinc. And I'm wondering if maybe San Joaquin County could put together a recommended list of simple supplements. I've spoke to doctors from UCSF and Stanford that have recommended, and there's clinical studies to prove that just those 3 supplements would boost immunity and lessen the impact when you are sick. Is there any plans for San Joaquin County through you to come up with a recommended daily supplement that could lessen the effect and the contagious nature of COVID?
That's an interesting question, and I think I would have to review the science on that. I don't know of any language coming from any county such as that, and I suppose I could speak to our local doctors and specialists to see if they have any knowledge base on or experience with that.
I can plug you in with a doctor from UCSF and Stanford that worked with Bill Gates Association and did numerous amounts of work on immunology. That he recently reached out to me and said that you guys ought to be trailblazers here. I don't know why everybody's not embracing this, but it's a very simple formula. C, D, and zinc would boost immunity and lessen the spread of the virus. So I'd share a contact, and if you could reach out to him, and maybe we could be unique in the state of California, come up with a recommendation for supplements. It could only help, right? If effective.
Thank you. I'd be happy to get that contact from you.
Now, when it comes to treatments, are we doing anything there's a lot of university, a lot of studies, whether it be international or throughout America, of different types of treatment when on a ventilator or pre-ventilator to lessen the time maybe spent on a ventilator and in a hospital. Do we have a protocol that's allowed? For instance, I know it's debatable in some instances, but the hydroxychloroquine and combination of hydroxy and zinc have in some studies proven to be very effective. Are we endorsing or promoting that here in San Joaquin County?
I know that many of our area hospitals are doing their own internal data gathering. Not really, I wouldn't say studies. I don't think that they're actually doing anything experimental or, like randomized controlled studies on their patients. They're trying to treat the patients as best they can. So there's no study in that sense happening, but there's a lot of data collection going on.
Okay. But we're not promoting anything in the county to perhaps help, since we're at high risk. I'm just wondering what else we can do to lower that risk and get people out of the hospital faster and efficiently and effectively.
No, the county is not promoting any particular treatment regimen at this point. Each hospital has their ICU specialists and their medical surgical specialists that are using the the guidelines that they have and the medications that they have on hand.
Would you be willing to maybe contact those directors in the hospital that are effectively using whatever means, and maybe we can see certain trends are working better elsewhere? So we're looking at something locally, forget about nation or internationally, but we can maybe see what's being done at one hospital or one medical system that another could utilize that may have great effects. And they may already be communicating, but perhaps there may need to be, a central level of information that's shared.
So through Dan Birch with EMS, who is our Medical Health Operational Area Coordinator, or MOAC, we have a weekly MOAC meetings, MedMAC meetings with all of our hospital CMOs, and we have great participation. And some of this has been discussed as remdesivir has been used and dexamethasone. We've heard some negative things about hydroxychloroquine, and we know that our local hospitals are not prone to using that so much. But definitely where remdesivir is available, they've used it, and they're using steroids. I can't tell you what every single hospital ICU doc does out there, but there is discussion amongst all the hospitals during that weekly MedMAC call, and they do share their internal data and their knowledge and what they're learning from the months of treatment that they've been doing.
Okay, thank you. I'm sure it's a moving target and people are amending whatever might be happening. Question for you, is the state willing to amend some of the measures of the heightened concern that put us on the list that prohibit us from opening schools? Based on, that standard was a couple months old, perhaps, and I'm wondering if maybe they need to take a fresh look. We've got children that are adversely affected, but they are not a high risk group. So I'm wondering if the state's willing to, if that's happening in any discussion.
There have actually been discussions about that from other counties, asking if the metrics will be changed at all, if those 5 metrics will be revised, removed, or redone. So the state's aware that there are some concerns about it, and to my knowledge, they're putting together a task force to look at it again.
Got it. So we might get some information on that soon. On that note, I wanted to share, recently there was a Stanislaus supervisor meeting, and Terry Withrow, the much younger brother from our sheriff, Pat Withrow, gave a great and interesting presentation, and I'm going to utilize a lot of his information. But question for you, how many kids age 5 to 15 have tested positive for COVID in San Joaquin County? Do we know?
We don't do a 5 to 15, we do a 0 to 17. Mm-hmm. And it's been over 1,000. I don't have the number now, but it's been consistently in about 9% of the total case count.
Got it. So what we did see, we did discover, and again, I'm going to cite Supervisor Withrow in many capacities, but since February 1st, 2020, per CDC website, nationally, 45 kids under age 15 have died from COVID, which is, of course, tragic. Every single child that is passed, I have a child that's in grade school, I understand it. But what's even more tragic is that during the same period, 13,088 children died in the U.S. from other causes. So, looking at it further, 11,371 in the adult range of 55 years old category have died from COVID nationwide, versus 189,000 plus have died from other causes in the same age group. Again, this is nationwide. So that's the age group. When you look at the 55 and below, that's the age group that's usually in the parenting and the teacher range. Very grim statistic, of course, but a couple hundred kids, die every year just from the flu, which, being an advocate for flu shot, I think it's great. The problem that I think we have and that we're seeing from the parents is that the school-age children in our county come from disadvantaged homes. And we have roughly 150,000 school-age kids. If you start to look at that and you say, 50% are at or below the poverty line. So let's say you had 75,000. Well, let's pare that down to maybe roughly 30 or 35,000 kids that are adversely affected by the home study and this, distance learning. And even if you're, have the ability to be home and parent, as you know, as a pediatrician, distance learning for a kindergartner, first grade, second grade, third grade, and on is difficult and challenging in and of itself. So we are risking the future in San Joaquin County of our young population. And statistically, it's proven that for every year of education you fall behind or do not complete or are lacking, it's a 10% decrease in your life earnings. So, we've got a challenged population in and of itself, people that are living at or below the poverty line, a lot of single parent families, and there's an incredible hardship. So I'm wondering what and how we can help them through, the powers that are vested in your authority, the challenges that we have, if by challenging at the state level, whatever we can do to change. You hear parents, even parents that are not at the poverty level, are struggling with their kids, and they don't want them to fall behind with hours upon hours. As I'm sure, again, as a pediatrician, you can imagine a child for 4 hours on a screen in kindergarten is not really learning very much. So, we have a challenge here, and it's statewide, it's nationwide. What can we do to mitigate that problem? And I don't know if there's a legal way out of this where we can exempt children from the emergency declaration, since we have 45 kids nationwide under the age of 15 have tragically passed away from COVID. What can we do? What parameters? What can we do through our county council's office and allow and create parameters for kids to get back to school so we don't lose an entire generation? This is an incredible hardship, as I know you're aware, and this is a dramatic and terrible burden for you to have to bear as a medical director for San Joaquin County. I don't envy it for a minute, and I know it's a burden, I'm sure, that keeps you up late at night. And again, I've said it again, but as a pediatrician, I'm sure your feel for the kids is dramatic and very impacting. So believe me, I understand the problem for all of us here. I'm kind of looking for a pathway, what we can do for these kids.
No, and I understand, and I know that our superintendents and our school principals are doing their best to make distance learning as beneficial to the kids as they can, but I do understand all of the concerns about distance learning, and I know that Tony Thurmond was on, with the governor about giving, technology services to the kids in California and getting all of that into their hands so that they can access the distance learning component. But even with all of that access being given to kids who might come from impoverished families, the fact of the matter is, with the Chromebook at home, it's still not as good as being in class. But what can we do? Honestly, from where I stand, the best thing that we could all do, and this is going to sound trite, and I'm not trying to be, facetious, but honestly, what we can do is socially distance, wash our hands, not touch our faces, wear our masks, because there's nothing that I can do beyond what is the law set by the governor. I know a lot of people think that there is, but I don't have the power to override what's coming from the state. So what I can do, and what any of you can do, is to really be role models and to really tell the public and get the public on board with driving our numbers down. Because we're not going to be able to get our kids back in school until we get off that watch list. As much as we dislike the watch list and don't like the phrase watch list, we're being watched. And the only way to get our kids back in school is if we all stop having gatherings and stop spreading COVID. This virus is not as smart as a human being, right? We're humans, we have brains, we're smarter than them, and yet we choose not to do some simple things that we can do to drive it down. It moves from person to person the way we let it, and we have to let it stop moving from person to person in our county. So, not trying to be funny at all, that's really honestly what I see as the mission of what we need to be doing.
Understood. Now, I don't take your comment as in a dismissive. I know that's very, very impacting and very difficult. And if county council is working on perhaps a parameter for an application to open up schools, that's great. And I'll close with this. I saw a really interesting presentation last night about pandemics historically. They subside only in under two different ways. First, medically, if a cure is found. That's fantastic if and when, and it has happened on rare occasions in the past, smallpox being one of them. But medically, it's challenging and it's uncertain if and when that would happen. Secondly, it's society. It's that people actually it runs through and kills everybody. That's as the presentation and as history will note, either the pandemic will wipe out everybody and there's nobody left to die, so then therefore the pandemic is over. Or socially, people, if you look at history and the Spanish flu back in 1918, people in society, they just get tired of it, and they get tired of being quarantined, and they just go out and they go about with their lives, and the virus runs its course, and whatever happens, happens. So I don't know that we're ever going to get ahead of this. I don't know that until this virus runs its course, and you being a doctor know much more about this than I, but it was a very interesting presentation that in the history of pandemics, only one time with smallpox was a cure found. So we may be looking at a virus that's going to be going on in perpetuity. And there may be another virus that follows it. So, we're looking, we're 50, almost 40 something years, and we're looking for a cure for the virus called HIV. People that are HIV positive are still looking for some sort of, immunity and prevention from catching it. So I think we're running into a very precarious time in our history that, if we're thinking it's okay to shut down and the shutdown doesn't fix it in months, are we looking at years and years of homeschool, distance learning and years of this hardship? I don't know that we're going to survive that as a society. So, I know it's a very big picture, problem, but, in your conversations at the state level, as we're trying to get a grasp on it, I don't know if we're actually going to get to, net zero and have a manageable level anytime soon. So, thank you for your time, Dr. Park.
You're welcome.
Supervisor Elliott?
Thank you, Chair. Earlier, we talked about the glitch in the reporting, the information, and all of that, and apparently there have been some adjustments made based on finding where some of the glitches were. But on a recent phone call, a CSAC phone call, Dr. Galley mentioned that there was still deduplication going on this data. So apparently there are cases where people are entered more than once, and someone is going through there and trying to detect that. Are we involved in this deduplication process? I mean, that could bring our numbers down considerably if we have duplication.
The state is involved in that, and it's a small gap, not likely to lead to major shifts in our numbers. So there's a few things that the state is still mending and working on, but for the most part, the glitch was fixed. I don't worry about us having any duplication because, as I said to Supervisor Patty earlier, we don't count one person twice anyways. So if we were to see the same name, same address, same date of birth, our system is designed to not duplicate.
Okay. But then the state is the entity that keeps these numbers and then feeds them back to us, right? Mm-hmm. Okay, so somewhere they are apparently detecting some duplication.
Right, I understand your question. I don't think it's a major issue in our county. My epidemiologists haven't spoken to me about it.
All right. Well, let's at least be mindful of the fact that there is duplication somewhere. So if we can assist in that deduplication process, well, we should certainly try to help. On contact tracing, we didn't really talk much about that today. Last meeting, you mentioned that our contact tracing efforts had not resulted in tracing a case or an outbreak, whatever, back to a single church or a single gym. Are we still finding that to be true?
Yeah, the outbreak list is continually updated, and we continue to add on outbreaks, but that continues to be true.
Okay, so are we feeding that data back up to the state level, saying, look, here's what our contact tracing is showing us, so shouldn't we consider that in terms of looking at reopening some of those businesses if we are not in fact finding any COVID being traced back? Then why are we continuing to keep them closed or restricted?
The state has access to all of that data. We do have to enter our outbreaks, and the state has access. How often they look at it and whether they use it to determine the laws they come up with, I couldn't tell you. But yes, we enter that data, and the state has access to all of it.
Well, when you get the opportunity, make that suggestion. I did that on a recent call, or at least asked the question. So I think it's worth looking at. If we've got some people keep talking about, we're going to use the science, we're going to use the data. Well, let's use what data, or use what information the data provides, and provide some way to use it to our advantage. Thank you.
Supervisor Wynn?
Thank you, Madam Chair. As always, I appreciate your presentation, and I understand that the challenges that you face on a daily basis. I know a lot of the emails I get have been sent to you, and I'm just CC'd on them, so I can only imagine the ones that I don't see that you also receive. As been mentioned by others, there's a lot of data that's flowing around actually the world in regards to certainly one of the main issues, which is the school situation, and whether it be New York opening their schools or other countries that never close their schools, like Sweden and places like that. I always appreciate comparison, but I also know that there are differentiations that aren't taken into account, especially when you talk about numbers of cases and things. And I think the population of Sweden is like 10 million. So it's about a quarter the size of the state, let alone a country. And so, there's a proportionality that sometimes is lost in these comparisons. So numbers, are sometimes misleading. And although I would argue that one of the things Supervisor Elliott just touched upon is that although Sweden didn't close down their businesses or schools as other countries did, it isn't as if they didn't have any cases. They did have cases. But the other part of it is there's a different culture in that country as opposed to other countries and even states. And one of the things that was interesting is that the residents very rarely frequented any bars because they understood the potential for being exposed. So there was some common sense. And the other thing was, in Sweden, between the residents and the government, there's a layer of trust that maybe doesn't necessarily exist everywhere in the United States. So when the government said something, people took it seriously, and the government reciprocated by not closing down the entire country. I know I read it's been a few weeks ago, and there was a couple articles, different articles. One was talking about that worldwide there hadn't been any infections by students to teachers or students or children to parents. I don't know if that's still true or not. I understand the numbers that's been talked about, and the 97,000 that they did in the last 2 weeks in July of children's cases. But again, numbers are great, and certainly we can compare it. But I guess from my vantage point, the thing that I am interested in, and you touched upon it, is the waiver process, because I have my emails. I send out the process as outlined by the governor, and it's only TK through sixth grade, so it isn't obviously go up to middle school or high school. So some people don't understand the limitations. The second part is that although the governor has somewhat given you the authority, you still have to, I think, broach it with the State Department of Health. It isn't automatic necessarily that you unilaterally can make those decisions. So, and it doesn't say that they approve it. It just says there's basically a consultation or a discussion. And maybe just because of what we've experienced over the last 6 months dealing with California and a variety of regulations, it would seem that especially last week and the week before, when our numbers were really high in regards to being monitored, and the problem with it spiking and continuing and increasing. It didn't seem to me that even if, for example, you received a waiver and looked at it, because the numbers were climbing, and therefore it didn't appear that common sense would dictate that you want to grant a waiver when in fact we're looking worse than we were the day before or the week before. Things have changed. We're going in a different direction. And I guess my question is that, for example, I know that, and I've looked at a lot of these proposals from different, primarily private schools, but obviously public schools. And I guess my question is, and I know county council is drafting something, but I know some of these protocols that are developed by these schools are very detailed and have a lot of moving parts. And so the question arises, for example, a school district or superintendent today that has drafted a plan for reopening, and I've looked at a variety of ones actually nationwide, and there's the distance learning, there's the hybrid, which is little distance learning, little in class, alternate days, those types of things, and of course the one that everybody I think wants is the in class instruction. Would a superintendent or a school board be probably better off to submit a gradual plan in regards to opening as opposed to saying we're going to open the doors today? And I know most of them, because of the restrictions, are doing distance learning, which is step one. But maybe offering a hybrid of sort, because I know some school districts are talking about morning and afternoon, Monday, Wednesday, and Friday, and Tuesday, varying from week to week. What specifically would you be interested in regards to approving? And I don't want to put you on the spot because I know they vary, but I'm at least asking, do you have any preferences in regards to the protocols that would be best to allow a district to at least open the door? And when I say open door, I'm not saying in class necessarily, but at least progressively, and obviously, as you've said, driven by the numbers, because we talked earlier about trying to solve one of our hotspot problems in the county, and therefore reducing the overall numbers. And I believe that until we get a handle on some of these locations where there is an expansion in the number of cases or deaths or hospitalizations or whatever, that you or certainly the state would never be amenable to grant a waiver, or the other side, which is probably more beneficial, is to open doors entirely, because we are beyond the 14 days of no longer being on the watch list. So is it primarily the structure of the classes? Is it is it social distancing? Is it the disinfecting every day? There's a whole list of things. I'm sure you've seen them all. But what are your priorities as things you'd like to see first as an action to open a school? And obviously, if for chance our numbers are, by the time this waiver is reviewed and maybe even considered, it could change, because you could submit a protocol today based upon today's numbers, and let's say a month down the road, things have changed drastically. We've gone through the 14 days, and so instead of step one, you could automatically go to step 3, which is the in-class instruction. So, are there, in your mind, and based upon your discussions with fellow public health officers in the state, have been things that you would want to see first prioritized in regards to these waiver applications?
Sure. So it's interesting because way back at the beginning of the pandemic, people were sending in protocols, and it was, am I essential or am I not essential? And I was trying my best to keep up with them and tell them that their protocols were approved. And that largely had to fall by the wayside. And I figured out that that's not what I'm supposed to be doing. I don't approve or deny protocols. And now that really has been fixed by the fact that everyone is just supposed to follow sector guidance anyways. You can't show me a protocol and ask me to approve it, because as you're allowed to be open, you're supposed to follow what the state has put out as the protocol for your sector. The unique thing about the waiver is that here again, now I am supposed to look at a protocol. Only for this particular group is a protocol required again for this process. So they are supposed to demonstrate certain things are happening, such as the disinfecting and the masking and all of that, and the distancing. I don't prioritize any of it. It's all important. So I would need to see that all of that is in the protocol. and that they're going to be following the sector guidance, which lays it out very clearly on the governor's industry guidance website. So, yes, there are protocols. I do need to look at them when it comes to the waiver process, but I'm assuming that most schools understand what needs to be in them, and they are writing them nicely. So I wouldn't expect that a key ingredient would be missing from any of them. And if it were, of course, that would be something that would have to go back to the drawing board. But I don't prioritize any one function over another. They have to meet all the guidance parameters. When it comes to the way they reopen, I have no authority over that. And people think I do, but it is a school district decision, and each school district has a board, and they decide if they're going to reopen full classes, hybrid, half days, and that is not my decision. I can make recommendations, but even there's some difficulty. So there's no clear answer, and it's not my decision in the end. But you know, and there's a lot of stuff you could read about that as well. There are some models where half the kids show up in the morning and the other half show up in the afternoon. That would be daily, though, and you would need to disinfect every day between the morning and the afternoon classes. So sometimes it's just not as easy as saying half the kids show up Monday, Tuesday, then you clean on Wednesday, and then the other half show up Thursday, Friday. And the days that you're not there, you're doing your learning from home, and your teacher's giving you assignments that carries you out through the rest of the week. So there's many, many different kinds of ways to look at it in hybrids, and when you get up to the high school level, it gets even more complicated because you're talking about kids who normally are in hallways passing each other and in 7 different periods. So there have been a lot of creative ways to look at it. There are some people who say that by having some kids at home half the time and show up to school half the time, the half of the time that they're not in school, they are going to be with babysitters and with play groups and with other people that are going to be more, that are going to contribute more to the spread, and then they're going to come back to school and spread COVID because they picked it up on their time off. So there's some argument to that, too, to having 5 full days, and it's not up to me to decide. From a public health standpoint, it would be easier if people did hybrid learning, and I think that the risk is lower, to be honest with you, so that if you have a class of 30 and 15 of them are there on Monday, Tuesday, and the other 15 are there on Thursday, Friday when there's an outbreak, I only have to deal with the 15. I don't have to deal with all 30 and worry about where have all the 30 been in their lives outside of school. The outbreak is in a smaller group, and that's what we call cohorting. And so from a public health standpoint, the more you can cohort and get them into smaller cohorts, the better. So that's all I'll say to that.
Okay. And then touching upon Supervisor Elliott's comment, which is equating to, unfortunately, the shotgun approach. In other words, if you're in this particular business, you can't open, period. And as he asked in regards to certain types of businesses, I guess the question would be, and maybe in discussions with your fellow public health officers in the state, it would seem to me, because I talk to business, I'm sure we all talk to businesses, and I've gone to businesses, especially in the interim where they were able to open, and I found them to be very responsible, conscientious in regards to all the protocols, and hearing them say that they're concerned about, you know, not doing one particular aspect of the sanitation requirements for fear of being closed down or suspended for 3 months, et cetera. But it would seem that if, and I don't know how you do this, because I know, for example, the bars and some other establishments were some of the problem, but I've looked at the enforcement numbers as far as ABC and Consumer Affairs and all these state agencies that go out and do all these inspections, and the number of citations is minuscule. So the question arises is, most businesses, probably 90% plus, maybe 95%, are doing what they've been asked to, and therefore protecting themselves, their employees, and the customers. But unfortunately, when you have this blanket restriction, those who would do everything they could to protect the public are not open, and it's kind of sad as opposed to in the regular world, when we enforced our health laws, it was only when a business showed a problem that we reacted and shut them down and did an investigation, and maybe it's the volume, but it would seem to me that at least as a transitional, that we might be more likely to allow businesses that have a track record of following the rules, not having any violations in the past, to open. And then, of course, if something happens and they fall, then action can be taken. But to kill 100% of businesses for maybe at most 5%, it seems like it's kind of an overkill in regards to restricting or protecting the public. So anyway, just a thought. But again, I understand your role. I understand the healthcare role, but it's like if you had two buildings burning across the street from one another, and you had occupants inside that you wanted to save, it would seem like you would try to go both directions as opposed to just focus on one building and let the other one go. What we're doing is we're killing businesses, and a lot of them will never come back, which is unfortunate, especially for those who invested their life savings in that. So again, it just seems to me that it takes more work to monitor something where you have an opening and you have a number of businesses potentially that could violate the rules and obviously have a potential outbreak. But we've talked about, the increase in suicides and suicide prevention calls and alcohol and drug substance abuse and a variety of things, not even including school. So again, it just seems to me that this close down is counterproductive, because these are things that we actually see, not projecting to happen. We all know of businesses or industries that have been dramatically affected by the rules of this state. Certainly we'll focus on that. But again, I just throw that out there because I think we can be a little more reasonable in our approach and not kill businesses and jobs at the same time of trying to protect the public from this virus. So, thank you.
No, go ahead.
Oh, I'm sorry. No, go ahead. Finish, please.
I just wanted to say that, I understand what Supervisor Wynn is saying and Supervisor Elliott. So I do have this list that's given to me like on a weekly basis that tells me that the governor's strike team or enforcement task force has been in our county. I don't personally see them, but they give us reports that they've been here and they've done secret visits. And it is very reassuring. We've had, to date, 12 bars and 70 restaurants in our county that have received in-person visits with no violations. So, I don't think we've had any nail salons or hair salons visited as yet. I didn't see our county on that list, but it's just encouraging to see that, yes, our industries are largely doing the right thing, and we'll see what happens. There's some talk about how do we decide what's going to open first. And so I will tell you, to inform you that there was talk about this yesterday. When schools do reopen, because we get off this list for 14 days, is that the only thing that reopens? What else can reopen? And so that talk is going around at the state. And it's very difficult because technically, when you get your check boxes across all 5 metrics for 3 days in a row, your county falls off the data monitoring list. But yet, the July 13th order by the state health officer clearly said that that's not when you reopen to indoor restaurants, indoor nail salons, indoor hair. That's still going to be a decision coming from the state later and separately. So interestingly, we could get off the county data monitoring list with 3 days of check boxes, but the only thing that you can really earn by getting off that monitoring list is the school reopenings, and that takes 14 days off the list. We don't know what's going to happen with businesses, and it's going to be difficult because people want to prioritize schools, and a lot of people would like to prioritize schools, but then at the same time, we know that small businesses are suffering. So it's very hard because what do? Open them all up at the same time? 14 days was created for the schools, but what are we doing? What's the parameter for businesses? And the state's trying to come up with a framework for that. But that's their next difficult hurdle, is to come up with some sort of rule. Schools first or businesses first?
Thank you. Supervisor Villapudua?
Thank you, Chair Miller. Good afternoon, Dr. Park. First of all, I just want to thank you for that presentation, and thank you for all your hard work. You're doing a great job.
Thank you.
I'm just wondering, is there anything this board can help you with? Are we doing everything we can to make your job easier?
Wow, thank you for that question. And now I know I'm going to regret it, because I'm going to go home and think of 5 million things I could have said, but nothing's coming to mind right now.
Well, please keep this in mind, and my phone's I'm good at returning texts.
Again, if you could just role model the habits that we want everyone to follow, that would be great.
How about as a county? Is there any department that you need help with? I mean, let us know. Please let us know.
I will. Thank you.
How about as far as the Hispanic community? Are we reaching out to farm workers? Are we doing better to reach out to them and giving them access to tests and results and stuff and so forth?
Yeah, we are, and this is something we spoke to the Unified Site team or support team that came from the state. They were very focused on ag and the Latino population, because, as you know, they only visited 8 counties in the Central Valley that are not doing so great, and so there was a lot of talk about it. We do have increased testing planned, not directly from public health, but as Ms. Nino said, San Joaquin General Hospital, which has been doing a lot of the testing at the homeless shelters and at encampment sites, is now going to be testing our ag workers. So from what I know, they are now calendaring events. They're starting to calendar events. They're starting to work with the industry, with our ag commissioner and with others who are involved in finding out where can we do some testing. There are 2 sites where we know that a lot of our migrant farm workers live, the RTZ1 and RTZ2 sites, and those are being calendared. And the agreement we have is that as San Joaquin General Hospital goes out to those sites and finds people where they live, the lab was collected and will be brought back to the public health lab, and we have a really good turnaround time right now because we've caught up. So we are prioritizing that. And the testing turnaround time will be 1 to 2 days for ag workers that are tested through San Joaquin General Hospital. So yeah, those are getting calendared. We've done some research, and I've talked with ag, and I know that there's thousands of farms, and so my initial goal was just to go out to all the farms and find them where they are and do some public health education and give them masks and hand sanitizer, and realize that it's not that easy to actually go out to the farms. Sometimes the owners are not so keen on having us there, and even if we go out, not everyone shows up for the testing event. They're working, and so we just get a handful of farm workers. So what we're trying to do is find people where they live and where they are outside of the workplace, so churches and living centers. But that's getting done.
Okay, well, let me know if I can help. I speak Spanish, and I know a lot of people in that area. I grew up in farm, so I'm always here to help.
Excellent.
And thank you very much.
Thank you.
Thank you, Dr. Park. As always, we appreciate your updates. Next, we're going to have a brief legal presentation from County Council, just a little overview on a couple of legal issues we had questions on at our last meeting.
Thank you, Chair Miller. I was asked to comment on the legal review process for the public health orders. The Office of the County Council interprets the laws as they relate to the state and local public health orders and advises Dr. Park and the board with regard to those laws. The office also analyzes the legal framework for the local public health orders and how they relate to executive orders, state public health orders, the guidelines, and even the FAQs that are issued by the state. On July 17th, the state provided guidance for reopening schools, but directed that schools and counties on the monitoring list could only provide distance learning. Throughout the state and here in San Joaquin County, we received reports of private schools asserting that the state's order for distance learning did not apply to them. After consulting with Dr. Park and in an attempt to resolve this issue, I prepared an order clarifying the state's order stating that all educational institutes providing K-12 education in the county, including public and private schools, were restricted to providing distance learning until the county was removed from the monitoring list. The health objective of the order was to limit the opportunities for the spread of the virus consistent with the state's order as people from diverse households come together for an extended period of time. The legal and practical objective of the order was to provide clarity on the issue and prevent unintentional violations of the state order. Dr. Park and I usually discuss pending issues before the board meeting. However, that did not happen on the 4th. And I believe that what the board and the public observed on the 4th was the difficulty that comes with trying to harmonize and apply the state's orders, which are often ambiguous, and fail to recognize and address the full spectrum of the problem at hand, with the guidance received from the state, which may actually be in conflict with the order. Schools and daycares, as we heard this morning during public comment, are a perfect example of that issue. Daycares can operate in the county. Daycares have always been able to operate, even from the very first executive orders regarding COVID. Presently, schools cannot. As long as daycares remain small, they don't present a significant problem. But if schools who cannot operate can cloak themselves with daycare licenses, as some have, and have in person the whole student body, then the exposure risk is identical to the school operating. And the public health objective that was to be obtained by closing the school has been defeated. I know that Dr. Park recognizes the vital need for daycares and day camps so that parents can work. We've discussed that the real issue is the in-person nature of the setting and generally not the activity that occurs at the setting, although the state's order is specific that says you cannot conduct in-person learning. I'm told that the state is trying to work through this issue of the daycares, day camps, and schools, and hopefully they will provide clarification on that. Going forward, I will do my best to ensure that Dr. Park and I meet before the board meeting to resolve any issues so that the county's message is.
Okay, thank you. Any questions for Mr. Miles? Okay. Thank you. And I think that's it for our Supervisor Villapudua.
Chairman, I was wondering if we could get an update from our sheriff, Mr. Withrow.
Sure.
Thank you.
Madam Chair, thank you, Mr. Supervisor Villapudua. Hey, I just wanted to come up real quick and speak. Supervisor Patty brought up my brother and some of the stats that he spoke of at their last board meeting, and I just wanted to touch on a point here. Since he spoke on that subject, the threats and emails that he has received and his family has received was very impactful to all of our family. I'm sure you guys receive a lot of negative stuff all the time, hopefully more positive than negative. I know what Dr. Park has gone through since she's been trying to do what's best for our community has been horrendous to her and her family. And so I just wanted to speak on that for a minute because Supervisor Patty used some of the same statistics. So I wanted to try and head off anything that might come your way to make sure the public knows that my brother and everyone up on this board and Dr. Park and everyone who works here in the county, our sole goal, the reason we do this job, is to try and help our citizens. We all may disagree on the way that we go about that, on our political opinions on how things are handled, but every single one of these board members, Dr. Park, the department heads, the CAO Nino and her staff, their sole goal is to do what's best for our citizens. And as I said, we may not agree with what that is, but you have to respect the fact that they are fighting for our citizens and our community. And so it's okay for us to disagree. But when you cross that line and to start making threats or degrading them personally because of their opinions, that's where you lose us. And I want to make it clear that it will not be accepted by any of the law enforcement here in San Joaquin County or in Stanislaus County. And we have the ability, although you may think you're anonymous behind a keyboard, many, many times we have the ability to make sure we can reach out and remind you that you can be held accountable for what you say. So we all have a right to our opinion. We elect you folks because we know that you have what's best in mind for our community, and we appreciate what you do, and we appreciate what Dr. Park does. And it's okay, as I said, to disagree, and that's why we read these all day long. But let's do it respectfully. Let's do it legally. And if someone chooses not to do that, I want you to make sure, as you all know already, but to reach out to us in law enforcement, and we will make sure that you are safe and do whatever it takes to make sure people don't model that type of behavior that happened down in Stanislaus County. So just wanted to throw that out there to the public and try and head anything off. So thank you for allowing me that.
Thank you, Sheriff.
Yeah.
We appreciate it. And
May I, Madam Chair, just reply since I'm the one who brought up those stats? Thank you. Sheriff, thank you. I appreciate that very much. Was unaware of any threats or anything going on, and I appreciate the safety and security that you and all of the deputies and the sheriffs and the police department offer us as we serve the public, and sometimes to the pleasure or dismay of others. And certainly I wasn't looking to stoke anything and not looking to provoke, but we do challenge and ask from our staff that which the public brings upon us. And so I think today's discussion from all of the supervisors was very robust, healthy, and addresses the current issues as they concern the citizens. So thank you very much, though, for that statement.
Thank you. The only thing I would correct is that my brother is much older than I am. So.
I'm shocked.
thank you. Now that we've cleared that up, do we have any members of the public, any comments?
Yes, we do, Madam Chair. The first comment, and although these may seem similar to the public comments, they did specifically request that these comments be for discussion item number 2. Jenny Miller writes, make the decision to open our churches, open our schools, open our businesses, all of them. Fire or call on public health officer to resign. Making decisions out of fear, what if, and funding are not her job. Her job is to follow the science and our own numbers and make decisions based on that, not hypotheticals. Cancel our state of emergency. We are not in an emergency. Thank you. Jessica Drake writes, our community needs you to take a stand. The mental health, physical health, education, safety, and livelihood of our children is in your hands. If you want to take a stand for them, if you won't take a stand for them, then who will? Our government is failing an entire generation of children. I don't need to quote the CDC and American Academy of Pediatrics. You know their recommendations. Schools need to open. Every child has the right to a proper education, and sitting in a room alone in front of a screen for hours a day is not the education they deserve. Please find the courage to be the leaders they need and develop a local ordinance that allows schools to safely reopen for in-person instruction. How can you justify, how can you justify that students can gather in a daycare facility in front of computers while they Zoom their teachers that are in the next building? There's no logic in this. It is time to dig deep and find the courage to rise above politics and put the health of our kids first. Bree Mayer writes, I am only 3 full days into distance learning with my 1st and 3rd grade children, and I can't help but feel like we are all failing them. I'll preface this by saying their teachers are doing an amazing job and are truly making the best of the situation. I am also able to homeschool to help facilitate everything so they have the best scenario possible. But in the bigger picture, they are not going to thrive if this continues. I can't help but think of all the kids who don't have the privilege of a parent home to help, or the students who are no longer receiving meals normally provided by the school, or worse yet, a safe haven from an abusive home environment, given that schools are often the first line of defense in spotting problems at home. These are the kids we are truly failing, and for what? The data that we are basing every decision off of has been proven to be inaccurate, and even so, the numbers seem to be far too low to warrant complete shutdowns of all schools. I believe the schools are essential. Our children's mental and emotional health is essential. The safety of the most valuable students is essential. I also think approval of up to $620,000 on continued billboards, TV, radio, and digital marketing towards COVID-19 is a completely ridiculous waste of time and money. You are continuing to test healthy people. As a parent of children who are being used as political pawns in this mess. Geneva Haynes writes, good morning to the board members and leaders in attendance. I am Geneva Haynes, the Executive Director of Mary Magdalene Community Services. I was pleased to have been invited to be a part of an important web video conference in early August 2020, hosted by Health and Human Services and representative from Region 9, as we sought to address concerns related to African American in San Joaquin and COVID-19. I was equally pleased to have been a part of the local forum hosted San Joaquin County Public Health and State Department of Public Health last week, addressing our local COVID-19 concerns. Based on national, state, and local data, African American are at great risk for being disproportionately impacted by COVID-19. Our local data is currently under review by the state, but the PHS dashboard does expose a clear concern that when infected with the COVID-19 virus, African Americans have a higher probability of death. I would again caution that instead of waiting for enormous rise in numbers in this particular community of color, we learn the lessons taught us throughout the nation, and let's work now to get in front of the problem. We have COVID-19 funds and a possible opportunity to partner with Kaiser Permanente in their campaign to work in California's most impacted Central Valley counties to stop this virus. Mary Magdalene Community Services looks forward to working alongside government help stop the further spread of COVID-19. And Sarah Duncan writes, you are failing our children miserably. School is essential. Private schools and religious schools are essential. It's clear politics have been put ahead of our students' well-being. It's clear that students with IEPs, students with special needs, and anyone who utilized additional assistance from our schools, teachers, and counselors are being overlooked. You are depriving children of meaningful education. You are depriving them of the tools that require and deserve. How many students are going to fall through the cracks during distance learning? How many are not logging on at all? How many are left home alone all day because their families cannot afford daycare or camp? How many find safety at school? How many will fall into depression? How do you reach each of them if they are not in a classroom? How do we encourage them? Those that cannot afford reliable technology or internet, a tutor, a babysitter, daycare, or even a distance learning facilitated day camp are being oppressed and discriminated against. The students need to be on campus. They need this option. They need their instructors to meet their needs in person. Everyone deserves the right to learn and thrive. Get San Joaquin County schools back open with the option of an on-campus instruction without masks. And Madam Chair, that does conclude the comments for this discussion item. I would like to point out that we received a letter from the Fire Chiefs Association that will be distributed to the board members, and it was a request to rescind the draft EMS policy number 3205. And like I said, that'll be distributed to the board and included in the business file.
Okay, thank you very much. Okay, I'd like to get through the consent calendar and then take a break before our next scheduled public hearings, because we have some folks who've been waiting to get these approved through consent. So are there any items that anybody needs to pull from consent? Okay, I'm...
Yes, I would.
Okay, Supervisor Elliott?
7, 24, and 26.
Okay, Supervisor Patty? Okay.
No, article number 7, please.
That's Supervisor Elliott's
Oh, okay, thank you.
that one,
Great, thank
so
you.
we'll...
I didn't hear him say it, sorry.
Yeah. So we'll start with item number 7. Good afternoon, Mr. Diedrich.
Good afternoon.
Supervisor Elliott?
Thank you, Chair. So I had a couple of questions concerning this one. And this had to do with providing school-based interventions for children and youth services. And yet, fairly obvious that the schools aren't going to be open. So my question is, can this actually work on a distance basis to try to be providing mental health care or mental health services to children via TV or internet?
Supervisor Elliott, through the chair, we did an RFP last year to start this program, and we were intending to start it before the schools closed down. It's been revised and brought back to get us started with distance learning, but I do know that Tony Vartan, our behavioral health director, I believe is also on the phone that could speak more eloquently to how we're looking to have this start.
Yes, good. Madam Chair, Ms. Martino, thank you. Diedrich, response to the chair, the scope of work has been designed on all of our school-based contracts to ensure that...
Mr. Vartan, your voice is kind of coming in and out. Can you make sure that you sit close and consistent to your microphone, please?
Yes. Can you hear me better?
That's better. Thank you.
Good, thank you. The scope of the work has been designed as such that providers will be able to provide services and continue serving school-based children and their families using remote methods of telephone and Zoom capability. We've been providing services since the start, and we found...
Mr. Vartan, hang on a minute. We're going to have IT try and check on your line because your voice is, you're just coming in and out. It almost disappears at times.
Thank you.
And Supervisor Elliott, I would admit this is probably not ideal having a Zoom, not non-face-to-face, but I think in the absence of providing any of these services, because some of our students might be traumatized by not being in the classroom, so this is a stopgap measure until we can have our contractors physically in the classrooms.
Supervisor Elliott, it's my understanding that at least one of the vendors is on the line. Would you care to hear from one of the vendors in terms of how exactly they will be providing the services, or do you want to just wait until we have hopefully fixed Mr. Vartan's line?
Sure, they can. It'd be nice to hear how they propose to do that.
Okay, I believe we have a representative from Sow a Seed on the line. Could you identify yourself and maybe let us know a little bit about how these services will be provided from a distance basis?
Yes, thank you to the chair and to the... Are you all able to hear me okay?
Actually, you're coming in and out too, so the problem must be on our end of the line. It must be our audio that's the problem.
To continue?
No, I don't think so. We're not going to be able to hear you. Thank you anyways. I saw Chris Woods come in. Did you have no information on this item? Okay.
Well, I did have a couple of other questions that go along with it as well. And this is supposed to be something that is provided by mental health clinicians. So now, and these are community-based organizations here, nonprofits. Do they have mental health clinicians to provide these types of services?
They should have a variety of licensed clinicians or associate clinicians that are being supervised by licensed clinicians. And I understand there might be an issue with Sow a Seed and licensure, and that's a Medi-Cal billable licensure issue. And I know I spoke with just a few minutes ago with our administrative director at Behavioral Health who informed me that they are working through the licensure issue as far as them being able to directly bill Medi-Cal. But my understanding is that these services, in order to be billable for Medi-Cal, would have to be provided by licensed or supervised mental health workers.
Okay, so then the question becomes, should we go ahead and authorize a contract here if all of the licensure issues haven't been addressed yet?
If indeed they are not addressed and not in place, I'm more than willing to bring this back for consideration at a future date.
Oh my God, that is not.
I'd recommend we do that, just so there isn't any question about that and how we are spending our money.
Am I allowed?
Hang on, please. And
then,
I want to remind you to anyone calling in, please mute your phones when you're not speaking. Thank you.
I apologize. Thank you.
And then an additional question was raised, I think, during the public comment period about nepotism, I believe, and are there any concerns about that? Now, the Sow a Seed Foundation is run by Rhodesia Ransom, who is a candidate for Board of Supervisors. So I'd just like to get a clarification here from County Council. Should she be elected, would that create a problem here with conflict of interest or nepotism? I think some of her family members are on the board. Does that create a problem?
It would not create a problem. Sorry, it would not create a problem with the granting of this contract. It could create a problem should they seek to renew a contract if there are familial relations between a supervisor and any supervisor and grants or contracts that are coming before the board. So yeah, there could be a problem in the future.
All right, and thank you for that clarification. In terms of the licensure question, on the other contract with Child Abuse Prevention Council, is there any problem with their licensures and fulfilling all of the prerequisites to be able to do these services?
Supervisor Elliott, through the chair, I'm unaware of that, and the other issue with the other contractor was just brought to my attention this morning. And like I said, we're looking at it to confirm if there truly is an issue or not.
Right. Okay. Well, I would say we should clear that up before we go ahead with issuing contracts. Thank you.
Supervisor Patty?
Thank you, Madam Chair. I think I agree with Supervisor Elliott. It might be worthwhile pulling number 7 until we have a little more clarity. And I know that Ms. Ransom's listening, but on the Sow a Seed website, unlike Child Abuse Prevention Council and unlike consent item number 8, the Telecare organization, we see no board of directors. We see no programming participants, managers, directors, anybody in charge of anything as far as it relates to staff on your website. And on your events calendar, it's completely blank. So you might want to populate your website and fill it with your board and perhaps provide some additional information. I know, having been a former board member on Child Abuse Prevention Council and attending monthly meetings and looking at budgets and having a board oversight, it was very important because we were accountable for all the dollars coming in, but not questioning Sow a Seed or their efforts and what they do within the community and with youth. I just believe we need a little more definition about that organization before we're allocating any funds to them. So I agree with Supervisor Elliott. I think it would be wise to pull number 7 for future consideration.
I have a question. It's my understanding this is not the first contract that we've had with Sow a Seed?
That is my understanding as well, and we're also bringing this as retroactive, so there are services that have begun.
And so it's my understanding that the vetting has already occurred and that they do have audited financials and that Behavioral Health Services has already conducted that, because not only is this retroactive, but it's my understanding it's not the first contract that we have had with Sow a Seed, correct?
That is my understanding as well, and I know BHS did some due diligence before we got to the stage, so it was late news to me. My understanding, the concern today was more along the lines of if they were certified for Medi-Cal billing. That is our goal with all of our contractors, because if they're eligible to bill, we can draw down federal financial participation rather than using purely realignment or Mental Health Services Act dollars to fund these services.
So if they are not eligible, would this not be a vendor that we would have selected?
I don't think we can go that far. We have other vendors, specifically in the drug Medi-Cal organized delivery space, where we're encouraging them and giving them technical assistance so they can become Medi-Cal certified. So that is ultimately our goal. That way, as I mentioned, we can draw down federal financial participation for some of the services when they are compliant.
Okay, I know that we always have a difficult time finding enough clinicians to deliver the services, so I know that the goal is always to try and get the vendors that we do have to be able to participate and be reimbursed in as many ways as possible. I have a bit of an issue with singling this out and pulling it because, in my opinion, it's political. I think it is unfortunate that this has happened, but the individual sending in the comments and the individuals wanting to pull it are on record as supporting Ms. Ransom's opponent for this position. It's not an issue on the contract now. She hasn't been elected to anything, and she is already a county vendor. I think it's very, very unfortunate that that this has been singled out. Staff, I have confidence in our staff, especially in Mr. Diedrich and Mr. Vartan, who work with an incredible number of contracts with a very large number of community-based organizations across this county. I do not believe that if Mr. Vartan or Mr. Diedrich believed that this certification was an issue on services that have already been rendered, they would have brought it forward today. And they certainly, I don't believe, would have brought it forward on a consent calendar. So in my opinion, I would not want to see a community-based organization not be reimbursed for services already delivered in good faith for the county, especially when they are an existing vendor for the county delivering very hard to source services to our youth and our schools in the county. So that's my position. I personally do not think it should be pulled from consent, and I believe that if there is an issue down the road, we will see it come back to us from Behavioral Health Services. There will either be a revision to this contract, or we will not see SOACED come forward on additional contracts. Supervisor Wynn?
Thank you, Madam Chair. I would agree on the standpoint that service has already been rendered, correct, Mr. Diedrich?
That is my understanding.
Okay. And the other thing is we've talked time and again on this board in regards to the need for not just behavioral health services, but certainly for those for youth because of the lack of organizations that can provide this service. So I think the context of the disagreement as to the contract is irrelevant in regards to this particular decision providing services. So I would agree with Chair Miller that this is something that we've already utilized, and therefore I think we have an obligation. It's not uncommon to do these retroactive approvals. We've talked about this with Mr. Culbertson, certainly Mr. Diedrich, and unfortunately, we have a tendency, probably no fault of our own, to have these retroactive approvals. So anyway, that's just my take on as a objective observer. I'll put it that way. Thank you.
Supervisor Villapudua?
Thank you very much. I understand. I agree with what you're saying. It is political, but the problem is, I believe Mrs. Rhodesia Ransom, I believe she's the CEO of this company. Is that correct?
I'm uncertain. I just know it's a nonprofit.
Well, I got a lot of emails last night, and people are pretty upset and they're fired up, and this is public money. I think that it should be put on the shelf and try to figure out what the ramifications are. It is political. I agree with you, Supervisor Miller. I do support Mayor Rickman, and unfortunately, I think this should be shelved and we can look into it a little deeper. That's all I'm saying.
I'm going to see if Mr. Vartan, again, can either call in and address the issue of certification or perhaps email the clerk.
So, Madam Chair, ISD has suggested that we attempt to mute all of the mics so that there's no feedback and that might help alleviate the problem. So I'll go ahead and give that a try, and then if Mr. Vartan could go ahead and speak, we can see if that works.
Yes, good morning. Can you hear me?
Yes, we can.
Thank you. Apologize for the technical problems on this call. Just a couple of comments and clarifications. As you know, we have a great need for community organization providers to assist with servicing the special needs and the gaps that exist in the community for mental health services. And we continuously encourage and look for CBOs to actually engage and sign up through RFP process for providing these services. The providers that have come in front of the board today have been selected through an RFP process, which looks at certain requirements for the provider to be able to actually be selected. And as a last part, because a lot of these providers often have not provided Medi-Cal services, once they are selected, we know that we have to work with them and assist them into becoming Medi-Cal certified. SOASEED is one of those organizations, and our team is currently working with them to help them become Medi-Cal certified through our processes and through the state. And the boilerplate on the contract does state that the provider will not provide services until they are Medi-Cal certified. So as of date, SOASEED has not actually provided any billable services that would be billed through this contract, and they will not provide such until the Medi-Cal certification has been completed. I just wanted to make that clarification because I would just hate to, take out a contract where we actually have steps to ensure that those items are completed prior to the service provider actually providing services.
And so, Mr. Vartan, through the RFP process, the organizational structure of this CBO has been thoroughly reviewed and vetted?
At the time, our purchasing department who manages, I'm sorry. At the time, the purchasing department actually vets all the requirements of the providers to apply through the RFP, and they thoroughly look at the items submitted and ensure that the submissions required meet the scoring requirements at the time.
Okay, thank you. I'm going to ask if Ms. Ransom wants to very briefly weigh in on this.
Yes, thank you for the opportunity to weigh in. And I just hung up with Courtney Flores, who is going to send over proof of our Medi-Cal approval. We are, in fact, approved. It's part of the contract. We've definitely been providing services. We've been, due to COVID-19, asked to step up of providing additional services to fill in the gap for social emotional support and mental health, which is overseen by a clinician per the contract. It is, there are several roles that are clinical, and there's the mental health specialist, because this grant also includes prevention and early intervention that does not require clinical, but we have both. And so we were requested by the schools to provide this service, and that is how we ended up being contracted with the county to begin with. We were not originally a Medi-Cal provider, but as Mr. Varchin did state, they did walk us through the process to become Medi-Cal certified. Courtney Flores was our assistant in that process. I just hung up with her. She's sending that documentation over to Mr. Vartin. I also would like to just really point out this is very unfortunate, but as a nonprofit executive director and an elected, I've gone out of my way to keep my job and my employees, because we do hire people to do this work, separate from politics, because I think those are both two very important jobs. And so I do want to point out that while this is happening here, there's an onslaught of Twitter and Facebook and Instagram that's coinciding with this as an attack, when really this is my job. I am an employee. I serve a board of directors. Our website is actually being redone by Elizabeth Devine, if you'd like her contact information, and that's why it's not been updated. We were taking advantage of COVID to redo our website. That was not a requirement. However, I will say that the county does have our financial statements, our board of directors, our bylaws, and every requirement that was necessary to receive the contract, including our board and its relationships and the professional organization our board members serve in. And you actually have an audited financial statement. So it's not me, an elected person, sitting here, trying to just do a contract. We have people who are trained professionals serving our kids at a very important time in history and for a very specific need in our community. So I hopefully Courtney gets that over to you very quickly, but we have already been providing services as schools have asked us, and the county has approved us for telehealth. Thank you.
Thank you.
And this is Tony again. I did actually did receive a copy of the certification on my computer, and I do see that indeed Associate is Medi-Cal certified, and they are certified to provide the case management, brokerage, mental health services, and crisis intervention services to the community. So, as also previously was mentioned, we've had other contracts with Associate that were the non-Medi-Cal, and they have provided services in the past as well. The requirement of providing mental health services indeed are such that they have to be supervised by licensed mental health providers, and each level of service requires a different level provider, and all the CBOs that we have acquired do meet that requirement, and we have to always ensure that they have the specialty providers to provide the services, and so CBO indeed does as well.
Okay, thank you. Supervisor Patty, did you have a quick question?
I did. I had a quick question for Ms. Ransom. And in spite of what anybody might be thinking, this is not political. I have no axe to grind with anybody. And I appreciate, Ms. Ransom, that you're available and participating. I know this is your pet project. It's what you do in the community, and I appreciate and respect that. So no axe to grind here at all. Looking on your website, and you said your website's being redone, but looking on your events calendar, it was blank. Is that because you're redoing the website and you're repopulating the activities and the action you are taking in the community currently?
Mr. Patty, it's not populated because it's not populated because, one, we're redoing the website, and two, our COVID environment has changed. We used to do various after-school mental health programs throughout the community, and that's what that event page would tell people about. Now we tend to email our clients as things come up, and we're just now going back into the school environment, and quite honestly, we took advantage of this opportunity to revamp the website because all of our services are being taken virtual, and we want students to be able to send their referrals virtually, our schools, because our referrals come from mental health professionals in schools as well as parents, so we want people to be able to virtually. So we really just, in order to be able to meet the need during a COVID environment where things are constantly changing, we needed to revamp our website. Honestly, the website has not been a priority for the organization because we serve more in schools. We've been in an organization since 2005, so we've served in schools, and that is our primary referral source, as well as community centers and churches that also refer, but there really hasn't been a need the website was not our main focus. We were really more focused on the services that we provided.
Understood. How many board of directors do you have in your Sow of Seed organization?
We have 7 directors, and we also have an advisory ad hoc, not ad hoc, but an auxiliary committee also made up of community members.
Excellent. Thank you. And last question, how many students on an average annually and then with a modified final trimester last year and moving into this year, how many students are you reaching out to and mentoring and providing some very beneficial services?
We typically have over 600 students per year, but if you could hold on, I have my associate director that can give me an accurate number. Each case manager is allowed to have 25 students at one time in the schools. As you see, this contract is for 6 schools in Tracy, and we also have several schools in Stockton. So it's typically, the lowest it's been in years is like 400 students per year. But it averages somewhere between 400 to 600. I don't have the exact number, but if you like, I can go have someone pull it up for you.
No, that's fine. And just currently, the current school year starting off, how many students are you engaged with or anticipate engaging with as we're in a modified system here?
So in our modified system, I will tell you, when school first went to virtual, the biggest problem was the inequities, and everyone did not have access to technology. So our staff were seeing less than 45% of the students. That started to ramp up towards the end of the summers, particularly in Stockton, as they have wellness centers in some of their schools that were very instrumental in getting those students online. And so right now, what's happening is we've had a small break for the last few weeks. Tracy Unified started last week. They've asked that we start, they have a need for a substance use program, which actually we've already got staff assigned to that, as well as their anger management program. And quite honestly, we've been requested to beef up services during the COVID environment because basically they're saying students and parents are complaining about anxiety and isolation, depression, and just not being able to interact. So this is now, we're kind of starting off with the school year. I can't tell you exactly what we're expecting. I know that the school district has asked us to be staffed at full capacity because their school day is only going to go from, I believe, 12 to 3. It may be flipped the other way around. I think it ends at 12. And then we're going to work with their students in the 0 and 7 period. Normally we would be on campus, but now because they have such limited instruction, we're going to work with them more in an after-school setting. And we're going through protocols to see if we can have a small number of those at our community settings in person, but we really need to, because we are essential, the work we do is essential, we could do that. But we just want to make sure that we have protocols that will keep the pods together and make sure that there's a safety. So we're working with the schools very closely to find ways that we can honor their request to serve the mental health and social emotional needs of their students right now.
And you obviously keep records of all of the students and how many people you work with, correct?
Absolutely. We have everything. We actually have reports that we have to turn in. So yes, we definitely keep records. There's attendance at every school. The schools actually have their own attendance that's separate than our attendance because our organization we have our own outcomes that are over and above the students. The schools just want to know that the person signed in and, was actually receiving the service. We have specific outcomes we're looking for, so we absolutely have all of that information. We've been audited. We are available if anybody wants to come and see what we do, or I can give you references if you'd like to speak to schools and counselors throughout the county.
Great, thank you. And just remind me, the last question is, you've been doing this since, 2005, did you say?
Yes, we've been officially doing it in schools as a nonprofit since 2005.
Excellent. Thank you. And I know as a city council member, you understand the responsibility we have. This is not a political target. I appreciate that you're available. You've answered questions quite effectively and very informatively. So thank you. I'm satisfied. Thank you very much.
I appreciate it, Mr. Patty. Thank you.
Thank you, Ms. Ransom. I'm sorry after going through a full RFP process, you had to go through a second interview, but you did a fine job representing your organization, and we appreciate it. Before we finish up with consent here, I'm going to call for a 10-minute break, and then we will be back. Okay, Supervisor Elliott.
Yes. So. Yes, that was some valuable additional information there. So I just want to ask Mr. Diederich here, are you completely satisfied now that there is no basis for any further confirmation of statuses here or any further need for any further investigation into the appropriateness of granting these contracts?
I got an email. They have confirmed their Medi-Cal billable status. It went through an RFP process, which I know is a thorough and transparent vetting. So I do have no reservations at this point with moving this contract forward.
Okay. And with that, then, I will withdraw my objection as well. I will make just an additional observation that it's a little disingenuous on the part of our board chair to accuse others of bringing things up for political reasons when one of the first acts she took upon being sworn in as a supervisor was extremely political. So, you know, when we're talking about political things, politics does get involved with these things. But I think it's also a matter of record that Supervisor Miller supports Ms. Ransom as well. So, I mean, it all kind of evens out on the thing. We're asking legitimate questions here as to whether it's appropriate for the county to grant contracts. And I think we owe it to the people that we represent to make sure that everything's on the up and up. So with that, I withdraw my objection.
Thank you. We're going to take a 10-minute break, and then we will be back.
Good afternoon, everybody. A brief 10-minute break, and our chair, Supervisor Miller, had a personal commitment and urgent matter to take care of. So as vice chair, I will resume the rest of this meeting. And I'm going to pick up with staff wanted to do a presentation on consent item number 11. The HCS accept the invitation from the National Association of Counties to be designated an innovator county for the Stepping Up initiative. Do we have anybody here to give a presentation? Thank you, Mr. Dietrich.
Thank you, Supervisor Patty. With me today, I have Stacy Hernandez and Cindy Borges with Correctional Health, and very pleased to have a brief presentation today, reinforming the board of the support that we have for a Stepping Up initiative and looking at the prevalence of mental illness within jail and providing services to them and decreasing the length of stay, and also some of the other diversion activities we've been engaged with since spring of 2016.
Good morning, and thank you very much. I'm Cynthia Borges, and I am the Chief Mental Health Clinician for Correctional Health Care. So if we could begin the first slide. Oh, the clicker, thank you. Thank you. Basically, the Stepping Up initiative is sponsored by the National Association of Counties, the Council of State Government Justice Centers, and the American Psychiatric Foundation. The goals of the Stepping Up initiative was purposely to reduce the number of people with mental illnesses in the jails, share lessons learned with other counties, support a national initiative, and encourage county officials and employees and residents to participate. They're providing the county's tools to develop an action plan and to be more effective in using of resources, facilitate access to treatment, promoting safety, and appropriate alternatives to incarceration. In our early beginnings in May 2016, the Board of Supervisors adopted a resolution supporting the Stepping Up initiative's call to action. With the assistance of the Community Corrections Partnership, they formed a Behavioral Health Justice Steering Committee to develop baseline information, identify programs and the services available, and then to evaluate those findings and make recommendations for implementation. The key criteria to be named an innovator is to establish a shared definition of seriously mental ill, looking at the number of persons booked into jail and having them screen for mental illness using a nationally validated screening tool, and then data collection to monitor the effect of the county's efforts. So one of the first things that we looked at was to use to define serious mental illness, and San Joaquin County utilizes the definition that's been established by the California Code of Regulations, Title 19, Chapter 11, stating adults with serious mental illnesses are persons 18 age and over, currently meets or at any time during the past has met criteria for a mental disorder as specified with a recognized diagnostic classification, and we are currently using the Diagnostic Statistical Manual 5, and displays functional impairment as determined by standardized measures, which impedes progress towards recovery and substantially interferes with or limits the person's role of functioning emotionally, socially, and or occupationally. So the work that we've done currently at looking at this is in conjunction with our partners through the Sheriff's Office, our booking process. We've received the Community Corrections Partnership funding. We're using the evidence-based tool that was developed by the Policy Research Institution. We have a first means of identification through the Sheriff's Office Medical Screening Questionnaire known as the MSQ. Then the Correctional Health Services Medical Health Questionnaire, and then finally looking at our mental health screening. So in addition to this, we realized that we also needed to have access to be able to gather more information to ensure that we are adequately evaluating individuals who are coming into the jail. So through our behavioral health partners, they authorized us to have access to the clinician gateway. This way, if a person meets also any of the SMI definition or has previous BHS history, we can also look at that, and then through that information as well, we're able to consult with our psychiatric providers and then also do a referral if further psychiatric medications would be needed. If a person is identified as SMI, before being released from the facility, the mental health clinicians may also authorize an admission to BHS Crisis Stabilization Unit, meaning that there are 3 clinicians within the facility that have the ability to do 5150s and to automatically admit in conjunction with our work through behavioral health services. And our Sheriff's Department is kind enough to help us transport these individuals safely. Also, our jail records is updated and custody staff are alerted about persons as having an MSI, which provides an opportunity to develop a discharge plan, including a warm handoff to community resources. So what this basically means by that one particularly is that if there is somebody that's identified with an SMI, and we are having them in the facility, before they're released, there's a flag, and that flag will alert us to ensure that the correctional officers will contact members of the mental health department so we can appropriately either clear them, do a warm handoff, ensure their safety, maybe even connecting them with family members if they have active family members. So we're trying to reduce individuals from coming back into the jail, but also to connect them to supportive services. So looking at this, our expansion. So since the initial CCP funding from January 2019 through December 2019, over 22,760 individuals have been booked into the San Joaquin County Jail. And of those, over 11,195 of those individuals have received a brief jail mental health screen. What we were finding is that results indicated that we were improving access to such services as substance abuse services and homeless services, but we still have some work to go. So in March of 2020, additional funding was awarded by the CCP for program expansion. So we're adding 3 additional mental health clinicians to complete our 24/7 coverage in the booking area. So yeah, I'm sorry, that is a repeat. How come this is repeating? Went in the wrong direction? My problem. So sorry.
Operator error.
Operator, absolutely operator error. So let me go back here. Am I not clicking it right? Okay. My apologies. Oh. Let me go back one. Oh, well, basically I can kind of finish that. Basically, just to do a closure and appreciation when I go back one more. So again, the expansion. So we're looking at our goals to successfully screen the majority of individuals transported into San Joaquin County Jail who have SMI or co-occurring substance abuse. We're looking at doing complete full assessments and diagnosis at the point of booking, and the brief jail mental health screen has specific questionnaires that would warrant that and identify the mental health department that a full comprehensive evaluation would need to be completed. This also will ensure appropriate treatment and care for those detained and increase the number of discharge plans linkages to the proper resources in our community. So once this happens and all of the positions are filled and have passed the Sheriff's Office security background clearance, we'll be looking at a booking mental health team that will consist of 3 licensed vocational nurses or psychiatric technicians, 6 mental health clinicians, and 1 mental health specialist that will predominantly focus on doing the case management specifically targeted for individuals who may be being released. Did I get the right one? Yeah. I've already said that. Am I going backwards?
That's the same one that keeps coming.
I know, it keeps, okay, I'm looking at the button, so it's not departmental or me error. I'm going to hand that over to my fearless leader here. Okay, thank you. Where it
keeps going back.
It keeps going back. So I don't know. So basically, I'll just going to wing it from here. So basically, San Joaquin County was approached so that we could be an initiative, for stepping up an innovator county. And they basically what that will mean is that they are asking us to help other counties who are interested in expanding their mental health services, that we would be able to provide additional counties throughout the United States, not just initially in California, with technical assistance. And without the continued support from our Board of Supervisors, county administrators, sheriff's office, community, our behavioral health services, our healthcare services, many of our community-based organizations, we would not be able to continue to do this, but we do also want to acknowledge their appreciation for their continued support. So thank you.
Thank you very much. Any comments or questions from the board? Yes, Supervisor Elliott.
Thank you, Chair. Just an additional question. It certainly seems like a very worthy thing to be engaged in. But I was curious about the slide there, and I'm not sure I read all of it correctly. But the one that was talking about when you were doing these assessments and you wanted to make sure they had them done before the person was released, are you talking about when they are initially brought in for booking or when they're released after there's...
No. The goal of this project is that anybody who is initially entering the facility will receive. So basically, every person will receive a mental health screen, the brief jail mental health screen, and also looking at any type of identifiable suicidal risk. So that is at the point before they are released. So if we have somebody who is answered accordingly to what the questionnaire questions, which are the flags, then that immediately flags a clinician to do a full comprehensive evaluation with a diagnosis. And then based on that, it allows us to determine what might be the more appropriate services if they are going to be released in the community. If they're staying, then that allows us to appropriately work with custody classification for placement and then for further mental health services.
Thank you.
You're welcome.
Anybody else? Excellent. Well, thank you for the presentation. How many people on your team?
That's a really good question. Because we're understaffed, we're still trying to fill positions. I can tell you where we'll be at if we fill all the positions. We would be at about 31.
About 31.
And yeah, I want to say we're currently at maybe 15, maybe about 15. We're about down half.
Oh.
Yeah.
Well, from the board to you and staff, excellent presentation. Thank you for the update. Great job. Obviously, you're being innovative and having a fantastic impact for some of those that are most at need and in risk in our community. So thank you. Pass on the good word of appreciation from us to all of you. Thank you for doing a great job.
Thank you.
Thank you. My apologies for clicker error.
And by the way, you've got the best presentation voice. Very.
That's her therapist voice.
That was my therapist voice.
Very good. Thank you. Well, moving on, I believe Supervisor Elliott had pulled consent item number 24. We've got EMS authorizing funding for a warehouse to support emergency medical services, medical health logistics, and support of the COVID-19 emergency, not to exceed $600,000 and approve related budget adjustments.
Yes, thank you, Chair. And this, I just had a question on this one.
Sure.
So we're talking about building a new warehouse. And my question was, can any of the properties that are out there on the airport property be used to fill this need? If we have an existing structure out there that we already have control of, perhaps we could refurbish it more quickly and cheaply and do this with less money, more conservation of the resources we have available. So has there been any checking into that?
Supervisor Elliott, thank you for that question to the Chair, Supervisor Patty. We have looked at a variety of options. What we settled on for our logistics need was to build it near our current operation for consistency sakes. If we moved off-site to the airport or to another location for existing building where we could remodel. Although that's an option and it may be less expensive, it would be more expensive to operate as we move forward in the pandemic versus standing up where we're hoping to put it where our current base is being operated.
Okay, so and the specific place that you intend to put it is where?
On the grounds of San Joaquin General Hospital on the hospital complex now, where we're currently operating our base.
All right. So as long as we've considered it and we think that's the best option.
Yes, sir. I think that's my recommendation. If we can do it, hopefully we can come in under budget. That's our goal. We've engaged capital projects along with community development and public works staff and got input from those other departments in putting our proposal together. So hopefully we can come in. The goal is to get this stood up as quickly as possible, but clearly before the inclement weather arrives, because our current process just won't survive the rain if when it does come, hopefully soon.
Right. Thank you.
Thank you.
Any other questions from the board? Seeing none. I have a quick follow-up question for you. If you're going onto the county hospital grounds, is there adequate parking for the anticipated influx of people coming in for services?
Yeah, currently it wouldn't increase the traffic because we're already providing that service. This is just a more expeditious, more efficient process in order for us to do that. But it shouldn't increase traffic or parking.
Understood. Thank you. Next up, I've got item number 26 for General Services, approval of emergency occupancy agreement between San Joaquin County and Shiv Shankar. This is for the Project Room Key budget. I believe Supervisor Elliott, you also pulled this?
Yes, thank you. I had a question on this as well. This question concerned the fiscal elements. Under the fiscal impact portion of the staff report, it says CARES Act funding will be used to cover all the costs, and then it says FEMA reimbursement may be available for up to 75% of eligible costs. So if CARES Act funding will cover all the costs, what will be the role of the FEMA reimbursement?
So I'll jump in and answer that, Supervisor Elliott. Chris Woods, Human Services Agency Director. In terms of the order of operation for accessing funding, the CARES Act funding will be utilized first. It is anticipated that sufficient CARES Act funding will be available and FEMA would not be necessary. Should CARES Act funding not be available, FEMA would be the next available federal funding source.
Okay. So we really don't even expect to use the FEMA reimbursement right now.
That is correct.
Right. Okay. All right. Thank you.
Questions from the board? Seeing none, I have a question for you, Mr. Woods. It was brought up in discussion earlier today about the purchase of the properties versus continuing to just lease or rent the rooms for long term. Is this part of the negotiation? Are we looking at, have we appraised that property and looking at closing a deal, perhaps buying it, because we have a long-term need for some sort of supportive housing, to say the least?
I'd probably look to David Tolliver to address this specific property, if there's any negotiations available for that property. But in terms of Project Home Key, the state, and I just learned on Friday through the Director of California Department of Social Services, Kim Johnson, that the state has received 125 applications throughout the state for $600 million. So the program is already oversubscribed. I know that there's an effort going on locally with the City of Stockton, STAN, Central Valley Low-Income Housing, with support of the San Joaquin Continuum of Care for a project here locally. But in terms of this location, I don't have any information, whether the property owner would ever be interested in doing that.
Tolliver?
Good afternoon, Chair Patty, members of the board. David Tolliver, Assistant Director, General Services. To think about Project Room Key, the beginnings of it coming out of SB 89, it was a temporary measure or a temporary effort to provide a framework for providing housing to the most vulnerable homeless individuals. And so our funding stream on Project Room Key has always been looking at lease agreements and wraparound services that are temporary in nature. And so we haven't had any direct discussions with potential folks we're going to be in partnership with about buying. I would caution not to get optimistic. Many of the folks that we have discussion with are local owners. Of course, there's a price on every property, but local owners are more, they're family businesses. They're more likely to want to keep their property versus sell it. However, we haven't made an offer or even entered into negotiations, but I would suggest that would be the framework or the environment that we're in right now.
Would you think it might behoove us to actually have the conversation before we approve anything further? We can maybe work it into the framework of what a lease purchase option would be?
So if you're asking me, and you are, I would say what might be the budget, what might be our overall strategy in terms of what price point are we looking at, and that would arm us with information regarding negotiation. Project Room Key, again, is a temporary measure. Director Woods mentioned Project Home Key, which is a recent state attempt to maybe wrestle with this issue more deeply in terms of looking at purchases of property for county or city use. And so there's more information coming out on that all the time. I'm not sure if that answers your question or not.
Well, my concern is that we're looking at the first 60 days was, just under $1 million, and we've got another contract to extend another $800,000. We want, $1.6 or $7 million going toward the rental of these rooms. I don't know what the property value is worth, but maybe it's time to, before we start just renting, look to close the deal and have an agreement with the property owner.
Absolutely, that's a consideration. However, in terms of SB 89 and CARES Act funding, there's significant restrictions on how those funds can be used. If we were looking to purchase, unless we're looking at sources of funding that might be available through Project Home Key, we would be looking at county general fund or perhaps other county resources.
Would this fall, CAO, Ms. Nino, would this be in Marcia Cunningham's department, Director Cunningham's?
And Mr. Tolliver is Marcia Cunningham's assistant director.
Got it. Okay. So, I guess no action is being taken and no thought to do something different than what we're doing. So, I would look at purchasing the property if we keep leasing it and this goes on into 2021. I mean, we can be leasing it for $2, $3, $4 million and purchase it for $1.8 million or $1.9 million or $2.6 million. I don't know what the number is, but I think we should be examining that as a county and maximizing the utilization of those dollars. Thank you. Appreciate it, Mr. Tolliver.
I just want to make sure that the board is aware, both as Mr. Tolliver mentioned, and I appreciate you stating that, the room key funds along with our CARES funds. Room key was for temporary COVID housing. CARES Act does not qualify the purchase of a facility.
So I just submit again that just as Nino suggested that the room key and the CARES Act dollars could not be used for the purchase of a motel or hotel, but the Project Home Key, that's where those funds are available statewide, and not only any jurisdiction could apply for those funds. So any city, the county could apply for those funds, and if a city wanted to cite a homeless project in their city, they could certainly apply to do so. That's what we've seen with the city of Stockton, housing and stand, that project.
Excellent. Then just so I understand correctly, then we would not be able to use that Project Room Key in any capacity towards a purchase.
That's absolutely correct.
Okay, great. I appreciate that clarity. Thank you very much. Any other questions or comments from the board? No, seeing none. I pulled item number 29 from our Public Health Department, authorize the purchase of advertising and communication services to support COVID-19 outreach activities not to exceed $620,000 and approve related budget adjustments.
Yes, Supervisor.
Excellent. Just a few weeks ago, we had a conversation. We were looking at different marketing tools that were being utilized, and I let it be known and voiced quite loudly that I thought it was very ineffective presentation and we've got schools impacted by our COVID numbers. We've got our economy impacted by our COVID numbers. So I'm wondering, what if we're doing, before we approve this money, what are we doing different so that we've got some flashing red signs and, great big, bullet points of what to do or not do versus the very stagnant and very kind of bland presentation that we had?
Well, with me today, I have Assistant Healthcare Services Director Matt Garber, who's been assigned to public health since basically mid-May to help support their operations. He's been my point of contact with most of the media campaigns, but working with their PIO team, our CAO's office to get some of these off the ground, as well as external consultants. And we've really been focused on informing or more so reinforcing behavior, as we know that this type of campaign isn't going to necessarily change behavior. I know there was some comments about the avocado green color. I think what we went with was it was a county branding color, and I know it's kind of pastel, but we wanted to make sure that it was representative of the county's branding to a degree. We used CDC format for the messaging, and the messaging from the CDC was shown by them to be relevant and was tested. We focused heavily on Spanish-speaking television and radio, and that's at that point in time, that was where a high number of outbreaks were occurring in the community. We are now coming forward with essentially phase 2 with updated creative messaging and to reflect the current conditions. So I don't think anything specifically is baked in the cake right now. I do know that during the Unified Strike Team meetings with the state a couple weeks ago, they had some concerns about, well, why are we duplicating some efforts? Specifically, I know in the mornings when I'm getting ready for work, I will watch Sacramento-based television about the weather, and I watch a variety of channels. There is a prevalence of California Department of Public Health messaging on the television stations now, specifically in the cable market. So I think we might be pivoting away from cable and focusing more on radio, but also on other areas that would be gas toppers when you fill up with gas, as well as signage on cars, but more directly to, I wouldn't say flashiness of a campaign, but these are static images. We went with graphics rather than wording, but we're looking to pivot to use some of the electronic billboards where those messages can be rotated and a little bit more colorful, if you will. But Matt could probably fill you on a bit more of where we're looking to go. We're looking for an authorization for the through the end of the calendar year. I know in speaking with some of our media consultants, because of the upcoming election and the propositions, there's not going to be a lot of opportunity to actually purchase ad space within television, radio. Most of that inventory's already been bought up through the end of early November and the election. But this is seeking. We got ramped up in June with the support of the CEO's office and some flexibilities on how we could start funding these things, absent coming directly to the board for a larger purchase. So we've exhausted those flexibilities of using purchase orders, or even I think some of these ad buys were actually used on a variety of county credit cards. So I think what's before you today is an allowance. It's probably an up to, but I don't think anything's been specifically baked into the cake. I know if this item does pass, we are looking to engage more broadly with local consultants to better inform our message. We also want to pivot towards social media, and you probably saw Dr. Park, not so much today, but the last board meeting, talking about our social media, but our Facebook or Twitter. You need to follow us. We want to pivot and use some of our media consultants to actually use some of the push advertising, such that when you're geofenced and physically in our county and on your social media feed based upon a variety of demographics, we might be able to push advertising onto your social media or onto your smartphone and other devices, and we want to pivot someone in that direction. But I'll let Matt fill you in on a little bit more of what we're looking for immediately.
Sure. Good afternoon, Supervisor Petty. Matt Garber, Assistant Director, Healthcare Services. Just briefly, just to fill in a few more details, updates, we were able to engage with Dignity Health, and they offered their designer for advertising free of charge. So they are working with us on billboard redesign. So they're going to give us some updated colors, making it a little more punchy and the design so that we, moving forward into phase 2, really from informing the public to really trying to engage and reinforce behavior. And we're also looking at revising some of the television advertisements as far as the PSAs in English language. We're looking at doing some more emotionally connecting with the audience instead of just reinforcing the message. We're using some visuals with actors so that we'll be able to really stimulate just thoughts about really working with your community and trying to be masking not only just as an edict, but also encouraging folks that this is the way forward. This is how we can get our businesses open, and basically just looking at some other ideas for messaging as we're producing some of those advertisements.
Excellent. So we're kind of innovating and doing things a little bit different or additional.
Absolutely.
All right. Mr. Dietrich, you brought up, as you were mentioning it, I was just thinking, God forbid there's a tragic event happening and we can do an emergency broadcast system to send out messages to smartphones, which I'm almost thinking, I don't know what the authority it takes to do that, and I can't speak for the rest of the board, but this is a medical emergency and an extreme hardship. Is it possible to start doing more messaging, do direct messaging that way?
Candidly, that's something I asked our risk communication, and I know they're looking at it. I don't know what type of exigent issue we need. I know at the end of July, when we had our high point of 262 individuals in the hospital, I think that would have been an opportune time. I have not seen that recently, but I know back in the April, May time frame, I did see some other counties push that out, and that indeed, that's going to get your attention. It's going to be simulcast on all of the cable, the broadcast, the radio, and getting a message out. So we're working to see how we can craft that message and what compliance really need to make sure that it's a qualified use of the emergency broadcast system.
Excellent, and I'd appreciate maybe sharing with us what those plans might be in the message, and simple, effective, and getting out. My concern is that what we saw when we flattened the curve just months ago, which seems like forever ago, everybody got relaxed, and all of a sudden look at this tremendous spike. So we start to see the numbers come down a little bit. It's like, okay, we're heading in the right direction. Well, people can become more relaxed now, and then we see a whole nother spike, and we'll never get these kids back in school. So I think there's great messages messaging that we could utilize, and an urgency to be diligent in this, in 1, 2, 3 points of action.
I would agree, and I think this messaging and all these non-pharmaceutical interventions flatten the curve to a degree, flatten the economy. I think we need to message this, that by doing these things, that everybody has a part to play, but in doing your part, we can then begin safely opening up the economy and opening schools. But my goal is not so much to open schools, but to keep them open. And I know a lot of the messaging in public health, we don't want to focus on negative items. It's not saying don't do this. And we had short messages, but I think to be most responsive to your guidance, Supervisor Patty, is we have a lot of flexibility, and we're just seeking the authorization for a dollar amount, and with that, engaging our internal, external partners and our subject matter experts to make sure that the campaign is going to be impactful, timely, and a local message.
Great. And lastly, the $620,000 that's asked for, is that adequate? I mean, we have an emergency here, and we've got critical situations going on, whether it be people's lives affected from lack of being able to bring their kids to school, as well as jobs and the economy. So is that we've got CARES funding and we've got a little reserve amongst the things that we look to allocate, is this enough to really blanket the message?
I think at this time it is. We could always come back. As I mentioned, the inventory in the market, specifically the cable, which is very pricey, we might not be able to get spots for a while. But I believe we're going to have the flexibility. And as I mentioned, we're getting a lot of, I wouldn't say free, but the California Department of Public Health, those messages on what I watch for, television, they're on morning, noon, and night. And as you drive up and down the freeways, the Caltrans signs, mask up, and a lot of it, there's a lot of messaging out there that we're aligning with. Part of my philosophy is I want to use as many big public health partners as possible, be that United Way or Dignity Health. I'm glad that they've come alongside with us, and they've pushed some of these marketing campaigns. As you're aware, Dignity and United Way assisted and brought the Mask On campaign. So as we can can continue to leverage our partners and have a synchronized messaging, and they're all basically reinforcing the same message that wear a mask, wash your hands, stay at home when you're sick, socially distance. If we all do this, hopefully our numbers continue to decline. We'll get off the state watch list. We'll stay off the state watch list, and we can safely and perpetually reopen our economy.
Excellent. Thank you. And any other comments or questions from Supervisor Wynn?
Thank you, Vice Chair. I think one of the things that I've heard that I think have gotten people's attention since we reopened, and we experienced a spike in regards to the numbers. In my conversations and emails, et cetera, I emphasize that if you want to open your school or your business, you need to draw down on the numbers to lower the cases. The question is simply, for example, I know what we're doing on message signs for Caltrans, but I ask the question: you want to open your business or schools? Wear a mask. Period. I mean, that's really the key, because I understand the sanitation, the washing hands. I get it. But the one thing that that probably spreads this virus most frequently is our droplets. Things that we sneeze, speak, whatever. And so, I don't want to be one-dimensional in regards to our message, but I think somehow we need to communicate that if and people care tremendously for their businesses, for frequenting businesses as customers, for opening schools, et cetera. And there needs to be a connection that if you want those things to happen, you have to be more responsible as an individual to protect yourself and others. Now, how we communicate that, I don't know. I'm not a marketing expert, but I think that's got to be a clear message, because that's the only way we're going to really, make any headway on this is to get people to be more responsible. As I mentioned, the San Jose Mercury article, this individual from New York says, they took it real seriously in New York. Why? Because, frankly, they mishandled it in many ways, and they saw such a dramatic impact upon their neighbors and their families. And fortunately, we haven't had that catastrophic effect yet, and I don't want us to have it, but I think that somehow we need to get people to understand that their actions are directly attributable to our numbers. And until they understand that they have a stake in this, and it isn't about government restricting or regulating or prohibiting and all those things that government loves to do. It's a matter that individuals need to be consciously aware of their actions will drive our numbers, and it's each individual person, family, workplace, et cetera. So I throw that out there because that's what I hear, and that's what I communicate is you are part of the solution. It isn't government. It isn't the hospitals. It isn't all these others. It's look in the mirror. It's you. So anyway, just a thought.
Thank you. And I would agree. We all play our part. Once the governor made the statewide masking mandate, I saw a lot more people wearing the mask because maybe it got a little bit more serious. But at the end of the day, we all play a part. This on the margin, it keeps adding up, and wearing a mask protects others from us potentially spreading droplets when we are asymptomatic. But I have seen when I think back in June, going to Home Depot, maybe 10% of the people in Home Depot wearing a mask. Now it's universal.
Excellent. Any other questions, comments? No. Very well. And thank you. I know that there was a challenge to do better, but you and the team have all stepped up and done exactly that. I think it's effective and sorely needed. So great job. Thank you.
Thanks, Supervisors.
That is it for our consent items that were requested to be pulled and discussed. I'm looking for a motion to approve.
Make a motion to approve the consent calendar.
Second.
I have a first and a second. Please vote. Our consent item carries 4-0. Moving on, we've got a scheduled afternoon public hearing from CDD, public hearing to consider the Planning Commission's recommendations to adopt a mitigated negative declaration and approve zone reclassification application number PA1900300 of Ella Walker Knoll Trust, care of Dillon and Murphy, 4th District. County Council, are we on?
The item that has the potential for a continuance is the later item.
Okay, so we're good here.
We're good on this.
All right, excellent, thank you. We've got our John Funderburg, Principal Planner, and David Kwong, our Community Development Director.
Thank you, Vice Chair, and members of the Board of Supervisors. I'm going to defer to John here, and he'll make the presentation.
Good afternoon, Vice Chair Patty and Supervisors. This project is a zone reclassification application to change the zoning of a 14.57 acre parcel from AG40, General Agricultural 40 acre minimum, to Rural Residential, RR. The parcel has a general plan designation of RR, Rural Residential, and a zoning designation of AG40, General Agricultural 40 acre minimum. Existing land uses for the parcel include a single-family residence. Land uses to the east-south are agricultural with scattered residences. Uses to the west are residential, commercial, and agricultural with scattered residences. Land uses to the north are industrial, residential, and agricultural with scattered residences. This is a copy of the assessor's parcel page. The parcel highlighted in red is the subject parcel for the proposed zone reclassification. Background. On December 13, 2016, your Board of Supervisors adopted a comprehensive update of the San Joaquin County General Plan. Prior to the adoption as part of the General Plan Update project, the county accepted landowner requests to change general plan use designations of their properties to reflect their preferred land use for the proposed properties. One of the approved landowner requests approved by your Board of Supervisors came from the current applicant. The applicant's request was to change the general plan's land use designation of the 14.57 acre parcel from AG to rural residential. Pursuant to the general plan, the rural residential designation is intended for use in rural communities. The subject parcel is within the boundary of the rural community of Victor. Pursuant to Development Title Section 9-300.1A, the rural residential zone is intended to provide for large lot rural home sites enough to support private wells, on-site septic, and stormwater drainage, all of which will be reviewed with the submission of an application for the underlying project. Agricultural mitigation. A zone reclassification that changes the permitted use of a parcel from agricultural to a non-agricultural use shall require agricultural mitigation. Therefore, the zone reclassification application will be subject to providing agricultural mitigation. Agricultural Commissioner response. On January 13, 2020, the Agricultural Commissioner's Office submitted a response stating concerns regarding agricultural activity on parcels adjacent to the project site and the impacts of pesticide applications posed to a home. The Agricultural Commissioner's Office requests the property owner implement a buffer zone around the parcel as part of their mitigation measures. Since this application proposes only to change the zoning designation of the subject parcel to align with the general plan designation previously approved by your Board of Supervisors as part of the 2035 general plan adoption, no action is required at this time. The Agricultural Commissioner's buffer zones request will be reviewed at the time of a subdivision application is submitted. The Planning Commission considered this matter on the consent calendar at its regular meeting on June 18, 2020. No one requested to have this item removed from the consent calendar, and no one spoke in opposition to the project. The Planning Commission voted 5-0 to forward a recommendation to the Board of Supervisors to adopt a mitigated negative declaration and approve the zone reclassification application. This photo is taken from the shoulder of State Route 12, looking southwest to the single-family residence on the site. This picture is looking south onto the project site. This photo was taken on the north side of the subject parcel looking east. Recommendation. It is recommended that your Board of Supervisors, by board order, adopt the mitigated negative declaration for zone reclassification application number PA-1900300 and approve zone reclassification application number PA-1900300 based on the ability to make the required basis for zone reclassification as attachment A in your board package. Thank you, Supervisor Patty. Supervisors, concludes staff's presentation.
Thank you very much, Mr. Funderburg. Any questions or comments from the board? Seeing none, I will ask that we open up a public hearing. Any comments from from the public on this item?
Hi, I'm Joe Murphy with Dillon and Murphy, representing Ella Walker, the landowner, who's also in attendance. Can't really add much to it. This report was very thorough. You may recall I was here about a year ago representing the property just to the west of this, where we asked for a rezone, and we were unanimously supported that. This project, as John said, went through Planning Commission with no neighborhood opposition. Voted unanimously at Planning Commission for recommendation of approval, and we just hope for your support today. Are there any questions
Excellent.
You might have?
Thank you, Mr. Murphy. Any questions for Mr. Murphy? Seeing none, as clerk of the board, do we have any public comments that have been sent in on this?
Vice Chair Patty, no, we do not.
All right. Well, any final comments or words from the board? If not, then I'll look for a motion and a second so we can vote on
Supervisor
this.
Patty, just a quick comment.
Supervisor Wynn.
This has really nothing to do directly with the project, but in the letter from FEMA, from Gregor Blackburn, the branch chief, you might advise him that John McGuire no longer works for Public Works.
John McGuire no longer works for Public. That's correct, Supervisor.
Well, he has him listed as a contact for the applicant. So I just bring it up, just for his clarification, and certainly for the applicants who may want to call John McGuire at this number, it needs to be upgraded.
I'll make sure that's correct.
Right, thank you.
Okay, looking for a motion.
Vice Chair Patty, it would be appropriate to close the public hearing.
Thank you, County Council. The public hearing is closed. I am now looking for a motion.
A move to approve staff recommendations.
Second.
I have a first and a second. Motion carries 4-0. Thank you very much.
Thank you, Supervisor Patty. Supervisors.
All right, so our next, and thank you all for coming in. Our next public hearing is to consider the designation of Fritz Buckman as the County Road Commissioner effective August 31st, 2020. I believe we have a presentation from Ms. Brandy Hopkins. Do we have a slideshow of Mr. Buckman?
Not today. I can.
This is going to be a boring presentation then, isn't it?
Well, I don't want to say that because he may be listening, so no.
Okay.
It'll be exciting.
Excellent. Thank you, Ms. Hopkins.
So, good afternoon, Vice Chair Patty, members of the board, County Council Miles, and CAO Nino. I have just a few brief comments to provide context and overview for the public hearing this afternoon. Human Resources has requested this hearing today because California Streets and Highway Code Section 2006 requires the county to have a designated road commissioner. And as this board is aware that on July 13th of 2020, our former Director of Public Works position became vacant. The former incumbent was our County Roads Commissioner at that time. Mr. Buckman has been designated by the County Administrator as the Interim Director of Public Works while Human Resources conducts a recruitment to fill this position. It is recommended that Mr. Buckman also be designated as the County Road Commissioner effective August 31st, 2020, while the recruitment and appointment of a new Director of Public Works is conducted. California Streets and Highway Code Section 2006 specifically requires the road commissioner to be a registered civil engineer. Mr. Buckman has held that status since February of 2000. Mr. Buckman has also been the Deputy Director of Public Works for San Joaquin since October of 2011. In accordance with legal requirements, a 14-day notice of this hearing was published in a local newspaper, The Record, and posted at the county courthouse. This posting took place on August 4th. This concludes the overview. It is recommended that the Board of Supervisors conduct the required public hearing and, if supported by the hearing process, approve the designation of Mr. Buckman as the County Road Commissioner. Thank you.
Thank you, Ms. Hopkins. Any questions, comments from the staff at this moment? Seeing none, I move to open up the public hearing. It's now open. If anybody from the public has a comment, or clerk of the board, do we have any comments that have been sent in?
Vice Chair Patty, no, we do not.
Okay, then I announce that the hearing is now closed. Since to the board members. Any further comments? Brazili? No?
No further comments. I'm prepared to make a motion.
Okay, looking for a motion. Thank you.
I move to approve the designation of Mr. Buckman as the County Road Commissioner effective August 31st, 2020.
Second. I have a motion and a second. Please vote. With resounding success, it's approved 4-0. Congratulations, Mr. Buckman. Thank you.
Thank you.
All right, we are now moving to the close of our meeting, getting rounding up here. We're at the board supervisor comments and committee reports. Any board member would like to share anything at this point?
Vice Chairman Patty, you may want to hold those and skip down to the scheduled afternoon item so we can knock that one out.
Okay.
And then go to board comments and then close the session.
Great. Thank you, County Council. So moving to our scheduled afternoon item from our Community Development Board with public hearing regarding the appeal by Craig and Sue Stevenson and Lorena and Richard Ippolito of the Planning Commission's approval to use permit number PA 1800177 of the Kusilakari Corporation, care of Brian McNamara, 1st District.
Thank you, Vice Chair, members of the Board of Supervisors. David Kwong, your Community Development Director again. With Chair Miller being absent from this hearing, the appellant and the applicant are both here today, but they have differences of opinion which they can speak to in terms of whether they want to proceed with a hearing. So I would ask that the board take in their input as to whether they want to continue the hearing or proceed, and you can make a decision as to that once you heard their input. Because I think, well, at this point, the applicant wants to move forward, and the appellant does not. The applicant does not want to move forward. Sorry, I'm stuck. And the appellant does want to move forward. So I would recommend that you take their input into account prior to making a decision on whether to move forward with the hearing or not.
Very well. Would we have the applicant available to come in and make a statement?
Could we take the appellants first?
Sure. The appellant, please come up to make a statement.
If I can interject here, Vice Chair Board, the applicant does want to move forward now. So there's been a little change over the last half an hour. So both the applicant and the appellant would like to move forward with the hearing.
All right, then would we be starting with a presentation from you, or are we coming in?
We would start with a presentation from staff and then the appellant second.
Great, thank you very much.
Thank you, Vice Chair Patty and members of the board. Today's item is an appeal of a use permit application to establish a religious assembly facility for up to 185 people. The project proposes to develop the site in 2 phases over 6 years and includes the construction of a mixed-use worship building, a kitchen, a total of 5 meditation retreat buildings, which are similar to approximately 1,500 square foot residences, a pagoda building, maintenance and administration building. The proposed project is located on the east side of South Priest Road, a little less than a mile south of East French Camp Road, within the urban community of French Camp. A similar project was proposed by a different applicant on behalf of the same organization in 2012. The project was denied by the Planning Commission on a 2-2 vote in 2013, and ultimately the item was appealed to the Board of Supervisors, where it was denied in 2014. The current project was heard at the Planning Commission hearing on June 18th of 2020. After reviewing all written material and receiving all oral testimony, the Planning Commission voted 3-2 to approve the project. On June 24th, 2020, the project was appealed to the Board of Supervisors. The project has a general plan designation of low-density residential. the neighborhood religious assembly use type may be conditionally permitted in the RL designation. The site has a zoning designation of agricultural urban reserve 20-acre minimum, which also conditionally permits the neighborhood religious assembly use type with an approved use permit. The 5-acre project site has an existing single-family residence and some accessory buildings on site. The surrounding parcels are primarily residential with some agriculture to the east and to the southwest. This is a copy of the site plan submitted by the applicant. The center of the property is where the pagoda is proposed. The residential meditation retreat buildings are located along the northern property line and also along the southern property line. This type of project is categorized as a neighborhood religious assembly, which is the smallest category of religious assembly and is based on attendance. Although the maximum attendance for this site is 185 persons, typical daily operations include an average of 15 attendees during the week and approximately 65 attendees on the weekend. The applicant anticipates a maximum attendance of 185 people during special holiday events, which occur an average of 4 times per year. Although the typical operation consists of smaller numbers of people, the project was reviewed at maximum capacity from an environmental perspective in order to determine potential impacts from the project. One unique component of this project is that the facility will host silent meditation retreats for up to 50 people at a time, around 8 times per year. The facility proposes these participants to stay in one of the 5 meditation retreats with 9 to 10 people per unit. A major focal point of the site is the construction of the pagoda building, which is proposed for construction during Phase 2. This building will have a total height of 62 feet and is comprised of an almost 24-foot tall building and a steeple-like architectural feature that is approximately 38 feet tall. There is no additional floor space in the steeple feature, and as a result, the height restrictions in the ag zone do not apply. The appellants state that there are 2 bases of their appeal. The first is that the appellant states that the road width of South Priest Road is inadequate for the type of project proposed. The Department of Public Works states that South Priest Road is classified as a local road and has pavement width of approximately 24 feet with 12-foot wide lanes, which is adequate for 2-way traffic. The applicant's traffic engineer prepared a traffic technical memorandum and found no significant traffic impacts resulting from the proposed project. This technical memorandum was ultimately reviewed and accepted by our county traffic engineer. Alex Chetley, Interim Deputy Director of Development Services for Public Works, is here, and he can answer any additional questions regarding the roads. The second issue is of the height of the pagoda. As stated previously, the pagoda is an important focal point of this project. The actual height of the building is 24 feet. In the AU20 zone, there is no height limit for non-residential or non-accessory buildings. A 24-foot tall building is consistent with what the surrounding development in the area. A residential building in the agricultural zone can be up to 35 feet in height. The steeple feature is also common with the construction of a religious building. This feature is specifically called out in the development title, Chapter 9-1005, as permitted beyond the height limits in the code. In this case, the steeple will be an additional 38 feet tall and it tapers off to a point. This is an example of the type of pagoda that could be constructed. This picture was provided by the applicant. This is a picture of the road, South Priest Road, facing south to give a perspective of the width and design of the road. This photo was taken from South Priest Road, showing the entrance to the property. The picture also depicts a single-family residence to the left, which is not part of this application. And this is a photo that depicts the existing agricultural building on site that's proposed to be converted to a mixed-use worship building in Phase 1. Finally, this is a photo of just the location of where the pagoda would be located, which is in the center of the property. This concludes my presentation. I'd like to recommend that the Board of Supervisors deny the appeal of Craig and Sue Stevenson and Lorena and Richard Ippolito, and uphold the Planning Commission's approval of use permit number PA 1800177 with the attached findings and conditions of approval contained in the board packet. Thank you.
All right, thank you very much, staff, for that presentation. Any questions or comments from the board at this moment? Seeing none, I'd like to ask that the appellant step up to the podium here and speak to the board.
Chair Patty, it would be appropriate to open a public hearing at this point.
Public hearing is now open. Thank you.
Gentlemen, my name is Craig Stevenson, and I live at 568 Amy Court, which is 4 parcels actually down from where they plan on putting the religious retreat. My wife and I have lived on that property. We built the property about 30 years ago. We've lived there. I've put my blood, sweat, and tears in that property, and I do something almost every year to improve my property. Not to offend any of the neighbors. I make sure that none of the things I do offends them at all. I know for a fact that people that are trying to put this through are basically really nice people. They want to bring peace and tranquility to everybody, except for that they're not bringing very much peace and tranquility to me and my wife and some of our neighbors. When they first started doing this, we had over 108 people sign a petition to stop it. These were local people that live in the area. They submitted, I don't know how many letters, quite a few letters, but none of the people that they submitted letters are from that area. They're all from Modesto, the Bay Area, Stockton, Sacramento. None of them live there. One of the people who denied us when they did the permit, get it done, she said, well, I think it'll be pretty. Well, yeah, it could be pretty, I guess, but if it's not next door to you, I guess it would be pretty. And if it's next door to you, you don't think it's so pretty. I can't sit in my front yard without looking out and seeing this big steeple temple with a light on top of it. And it's like, that's something that I didn't want to do. When we built out there, all that area was just homes like ours. They were like little ranchettes that people put their heart and sweat and tears into. And I don't understand why now all of a sudden these people who bought the property knew it wasn't zoned for that to begin with. The last time that we did this, some of those board of supervisors took a ride out to the road itself and saw that it was not feasible for that to be there. It's just not the right place for it. So I don't know how many times we have to go through this, but it seems like every time we turn around, it's like they want to do something else. Now, we couldn't get all the people together because of the COVID virus, but only 2 people have moved away that signed that petition, over 108 people, and that live in that area. So all these people that they're saying, these people like this or they like that, well, they don't live there. None of them live in that area. There was only one person that they ever presented that lived in the area, and we talked to him after the Planning Commission, and he told us, he says, I really don't care. He says, what's going to happen is if it becomes a nuisance to me, he says, I'll just sell and move. We don't plan on selling our house. Like I said, we've been there for 30 years. We made it into something very beautiful, and it's something that we want to stay with. And I'm asking you, I'm begging you, to please don't let them ruin my neighborhood with it. It's going to ruin it. Like, it doesn't belong on that road. And I can't say anything more than that. So I'll let somebody else talk, and thank you very much for your cooperation.
Thanks, sir. Is there anybody speaking on behalf of the appellate, or would we like to move to the petitioner?
Ippolito. I also live in the same area as the Stevensons. My house is facing Priest Road, and I would be 4 houses down from the temple. And probably of everybody that lives in that area, I've had the most experience. I lived in Fremont in 2 separate areas, and Niles was the last one I lived in. That was next to a Buddhist temple. was about a mile and a half away. The other one was on Spady Street, which belongs to the Kaslakari Corporation. And that was the temple that I'm assuming that they're still operation to my knowledge. But it was stated to me up here by Mr. McNamara that I had refused to talk to him and that I was talking about some other temple. So I just kind of wanted to make that clear to him that it wasn't. One of the statements he made was, however, care should be taken before we group all Buddhist monasteries into a single category. And I agree with that. In any religion, that's the truth. But in this case, they're all pretty much the same in the things that they do and the kinds of things that they celebrate. Thank you for allowing me to speak today. During all that we're going through with the pandemic, it's really appreciated. I moved from the Bay Area to get away from the stress of not having my own space, meaning neighbors so close I could handle them a cup of sugar without even leaving my house. I've been around 2 Buddhist temples in my life, 58 years of age, one in Niles, California, and one located at 40174 Spady Street in Fremont, owned by the Kaslakari Corporation. They plopped these temples right in the middle of housing districts. Note, I supplied street view photos of both at the original meeting. At the first meeting in 2013, I explained the celebrations they have and what it was like living near 1.5 miles away from my home. This one would be 4 houses away. We have 108 signatures saying no to the temple. There are some letters expressing concerns and dissatisfaction at the idea of the temple. The monks themselves are nice, but admitted that they could not control how many people show up at their celebrations. Their attorney at that time was Corinne E. King. The Buddhist temple's latest requests and changes to the temple plans have only made me more against this build and the plan. The temporary living quarters for 30 women and 20 men is unacceptable. If they were there during the day only, I might feel differently. They say how bad they want to be an improvement to our neighborhood, but the right area right now, which you could see from those pictures, from the very beginning is an eyesore. They don't even try to keep it green in front or remove the weeds. I'm sure some of you think that's petty, but if they're not caring for the property now, why should we think it'll be different later? When I moved into my home on 2.5 acres in 2007, the front and side yard was plowed dirt. We spent $150,000 to landscape, plant trees, and put in sprinklers so it improved the area and made it beautiful. I love my home and I maintain it daily. At the planning meeting, an inspector stated our 2-lane road could handle 7,000 cars a day. I'm telling you that's absolutely not possible. Sounds like I'm back in Fremont again. They cannot control the people coming to the temple or their behavior, and that is my main point. If it stays similar to the other churches in the neighborhood, not 63 feet high, and no overnight temporary housing, I could work with it. But our area is like living in the country, and we want it to stay that way. To my knowledge, none of you live on our road. You probably have never driven down it. Please do it. It needs to stay this way. As I stated in my last letter that I read before to the council, the people willing to allow this temple this size in our small neighborhood will not be living here. We will. They originally stated that they would only have 4 celebrations a year. They failed to say that they can apply for more anytime they want. The last get-together the temple had drawn was a very large crowd. I believe it counted to a little over 300. They did exactly what I said about Niles: noise, traffic, the people parked in front of people's property on the road in front of their homes. This is dangerous. The new plan has expanded the kitchen and bathroom square footage to manage and feed the larger crowds. The kitchen build is larger than my house. 3,100 square feet is my house. This should tell you the plan to have hundreds of people at their celebrations. They know exactly what it will be like. Parking is only 58 paved spaces, and I guarantee they will need 8 times that amount on an average. The selling of food is huge for these temples. They make a lot of money. They make statements like the temple's not a restaurant, but they sell food with coins that the guests buy. I made it perfectly clear that we have 6 churches in French Camp, and I have no complaints if their church is within the same size range. Included with this letter are the signature lists of the people against the temple and for the temple. Please note that the against signature live close to French Camp, but the for signatures, most do not live in our area. Due to the problems with internet, I was unable to email this to Jennifer Jolly and Sonia Serrano. Please take note that I was fair and added the no's and the yes signatures of the people who signed the petitions. These are the original signatures from the first meeting. I could not go door to door with the pandemic. Many of our neighbors are older and won't risk them in any way. Ed and Debbie Cameron moved away into the mountains. They're not on the list. Mr. McNamara was quick to mention that they had moved at the planning meeting. Please note that the majority of the 4 signatures are out of the area, with some in Stockton. Also, there are several with as many as 6 signatures with the same address on the same list. Mr. McNamara is trying to use my experience with the Fremont and Niles temples by saying they are not all the same. The Fremont temple is still listed as belonging to the Kuslakari Corporation, the same corporation as this. Stockton has a large temple, and it's located in a much better location than the one in French Camp. This comment was from the fire chief at the French Camp's fire station. He stated to my neighbor Craig Stevenson and I that during their celebrations, they do tend to go over their people limit, but Stockton PD and fire are there just in case. This is an amazing place to live. I can't even begin to tell you. I mean, it's just a beautiful, quiet neighborhood. There's not a lot of problems there, and I'm sure that the sheriff's department could back us up on that. I mean, at most, you might hear of somebody's or cow getting on the road, which I have helped animal control put bulls back in a pen. The temple in Fremont is noisy. The temple in Niles was noisy. They have a lot of people. It's a very popular thing because the way they do their organization, when I said about the food, when they have a celebration, they do sell food, but what they do to get around what they do is they sell coins so that you can purchase the food with the coins rather than with cash. What that does is it draws thousands of people, not just hundreds, but thousands. They haven't had that kind of celebration yet because they haven't completely built. But once they do, that will be what will happen for us. I have some letters here, and one of the people that made a statement on here said that 90% of all Buddhists were doctors and lawyers and all people educated. And that just kind of slammed me right to the ground because I thought I have an education just like anybody else. I'm not a doctor, but I have worked with a veterinary. I'm a veterinary surgical assistant. But I thought that that was completely irrelevant. That needed to be stated that way. This is our home. I moved in 2007. I don't want to leave. I don't mind if they keep the build to a standard of what's in there. If they want to make it red, I don't even care. But 63 feet in our neighborhood would mean that when I walk out in my backyard, I'm going to see it. I don't want to have to see it. I don't want people to see my neighborhood and have it look. Anyway, if they had a complaint, they would come and tell me and I would take care of it. If my dog barks and somebody complains, I take care of it. But that's not going to happen here. So if you allow this to happen, then it's going to make a lot of people really, really unhappy, for one. And it's going to really just pretty much ruin our area because it will become crazy. And then it's probably going to cost the city a lot of money because you're going to have to expand the road. And then it's going to cause the sheriff a problem because people are going to call and complain about them parking on their front yards, which have already happened. I hope that you'll rethink this, and I hope you won't make a snap decision because it's really important to me that you take a little time and think about it and imagine what it would be like if it was in your yard. If you haven't ever been down this road, you really should be down this road and check it out. And you should see what it looks like right now. And they've been there for, don't want to be perfect, but I'm going to say they've been there probably about 8 years. Yeah, so they've been there 8 years, and the most they've done is plant trees and bushes. But it's not taken care of. It's not, they put up a wall fence in the front. It's not like they've done anything to go, hey, check it out, look what we've done. There's no great improvement that I see at all in the property. So if they can't do something small, just like plant or put something cute or whatever, do something that makes the front of the area look nice. Why would I want to approve something even bigger than that? And I definitely do not want to think that there are 50 people on that property spending the night and staying there even for 5 days. I just don't see any reason. But I ask that you really think about it and consider all of us. Thank you.
Thank you. Is there anybody else that would like to speak on behalf of the appellant?
Excuse me, Vice Chair. There may be speakers on the line.
I understood.
Okay, thank you.
We'll go through in person first.
Just wanted to make this simple for you. I went through all the letters that were sent to you to so that they would, sorry, I'm not very good. But anyway, these letters, people that wanted the temple, just wanted to let you know where they were from. 4 from Modesto, 8 from Stockton, 1 from Lathrop, 1 from Hayward, 1 from Sutter Creek, 2 from Livermore, 10 from Fremont, 1 from Elk Grove, 1 from Danville, 2 from Sacramento, 1 for Pleasanton, 1 from Bay Point. There was 1 actually that didn't have an address. The other point I kind of want to make is Priest Road is a local road. And the difference between a local road and a local commercial road is curb, gutter, and sidewalk. This is per Alex Chesney's San Joaquin County Public Works. This is actually what he has stated. Local roads, he also said this, are classified as the lowest level of roads. Priest Road is not just straight. It has 2 dangerous curves in it. When you first get on Priest off of French Camp Road, and then as you go a little bit further, and they're like 15 miles an hour. So it is not just a straight road. Then just imagine sitting in your front yard or your backyard and seeing a pagoda with a steeple 62 feet high with a light on it. I was doing that just a few days ago, and it made me sad to think I cannot enjoy my home, my peace, and my tranquility. Thank you for letting me speak.
Thank you, ma'am. Anybody else present that would like to speak on behalf of the appellant? Seeing none, Madam Clerk, do we have anybody online that would like to speak on behalf of the appeal?
Vice Chair Patty, I do not believe that we have anybody on the line that would like to speak on behalf of the appellant.
Thank you. So I'd like to ask that the project proponent is present and speak in opposition of the appeal. Please step up to the podium.
Thank you for the opportunity once again to speak before you. It's our understanding that our role in this appeal is to respond to those issues raised in the written appeal of the appellants. Before doing so, we just want to briefly address the use and some of the issues that have been brought up today. Our application is for a neighbourhood religious assembly, which is permitted in the AU zone with a use permit. The centrepiece of the proposal is meditation retreats, which are non-sectarian and include 4 10-day retreats and 4 3-day retreats each year. Participants agreed to remain on site for the entirety of the retreat. Participants further agreed to maintain silence for all but the final day of their retreats. During retreats, participants are given daily instructions and they meditate all day. That's what happens. Strict segregation of men and women is practiced during the retreat. 5 retreat accommodations are planned for. Each will contain 9 or 10 people. Outside of retreats, the facility will operate as a monastery with visitors coming for an hour of prayer or meditation, or to volunteer their time assisting the monks in caring for the facility. Like many other religious assemblies, Sundays will see the most visitors, when 40 to 60 people can be expected on site. Weekdays and Saturdays will average about 16 people per day. 4 major holidays will be observed each year, just 4, when a maximum of 185 people can be expected. In 2019, the property owners pulled 4 special event permits and held these special events, and with no complaints from neighbours. No neighbours even seemed to notice that they happened. No alcohol or drugs are permitted on site. Food and beverages will never be sold there, ever. All of this illustrates that the facility will be very, very quiet, with all parking confined to the property, no off-street parking, no blocking neighbours' driveways. Events will be held indoors. Increases in daily traffic will be minimal, if even noticeable, and disturbances to neighbours should be non-existent. An application for a similar use as now being proposed was brought before and considered by the county between 2012 and 2014. It was rejected by the Board of Supervisors in February 2014. It should be said that the current team wasn't part of that. The team at the time had no experience in this kind of project, and it really showed. The quality of representation was really bad. The architect at the time, when he was presenting the project in front of the board, had had his license revoked and was hiding that fact from his clients. It was so badly presented, we can't even be 100% certain what they were proposing. It's worth noting that we often say internally that if we were on the board and it had come before us, we also would have denied it. This team came on board in 2016, 2 years after the last application had been denied, work exclusively on these kinds of projects, and have over 40 years' experience between us. We examined the neighbours' concerns and made changes to the site plan in response to those concerns. Some of those changes included the removal of 27 retreat cabins, which were replaced by 5 retreat accommodations. These 5 buildings will be designed to look more like the neighbouring homes. The height of the pagoda and steeple was reduced by 22.5% from 80 to 62 feet. A prior festival area has been removed. Size and frequency of holiday observances have been reduced. A proposed 1,500 square foot toilet block has been deleted. We will preserve or reconstruct the facade of an existing wooden barn in respect to the agricultural history of French Camp. Parking was reduced by 30% from 100 spaces to 67. That also involved a reduction of paved roads and grading by 20%. The number of meditation retreats per year has been reduced. Another change that has been made has been the addition of a kitchen and dining room because there wasn't one in the previous application. At a neighbour's request, the exit was moved to the southern gateway in order to prevent the headlights of exiting cars disturbing that neighbour across the street. In all, we spent many hours meeting with neighbours since 2016. We sent out more than 300 letters, those within the 1,400-foot notification zone. We also canvassed the neighbourhood on foot and received 19 notes from French Camp alone. There's 36 letters from within the 1,400-foot zone of support within the record. This 1,400-foot zone was provided to us by the Planning Department. There was a lot more opposition in 2014. Only the 2 appellants' household remain in opposition in the record. Sadly, despite numerous attempts to engage in dialogue directly with the appellants, we never found them willing to have a conversation. It's unfortunate that we were never able to dialogue with them. We feel a lot of time and effort could have been saved if we had. It certainly was not for the lack of trying. And it's not too late. We're still willing to do it. They stated on June 18th that they didn't want to talk to me because they knew it was bad. It's an unfortunate position to take, because if they took the time to talk to us, eventually they'd understand the Burmese want the same thing that they do. They want quiet, peaceful French camp. It's essential to the running of a meditation center. Worth noting that for many years French camp was considered a rural community, and with the adoption of the 2035 general plan has been changed to an urban community. General plan is also clear that French camp and areas like it should be developed with infill development so that agricultural lands on either side can be preserved. So we think it's in the appellant's interest to encourage quiet, peaceful uses like this, if that's what they want to do in the future. Next, I'd just like to briefly address some of the statements made in the appeal. We broke out the 2 paragraphs into 9 different statements. I'll deal with 3, and then my colleagues will deal with the others. The first one is, and I quote, the 2014 staff report said road was too narrowed and denied use permit. End quote. That's simply not true. No staff report claimed that the road was too narrow. Staff reports that were generated, of which there were several, each found that the project would not result in significant impact and went on to recommend approval of the project. Second statement I'd like to address is, I quote, "They propose 195 people at their events," end quote. This statement ignores the fact that this is the maximum on-site number, and most importantly, it only applies to no more than 4 days per year. The property owners held 4 permitted special events last year, as I said, with these numbers in attendance, but no neighbours complained or even seemed to notice. The last statement I'll address is, they propose 50 people on all weekends to stay in individual room, end quote. This is simply not true. Again, no such proposal has been made. Overnight retreats happen only 8 times per year. So that means 44 weekends per year. It's not going to change from what's been happening since 2012, when the property owners bought the property. 3 or 4 months will be on site. This concludes my part of the presentation. Unless you have questions, I'll hand it over to our architect.
Questions at this moment? Nope. Please proceed. Anybody else from?
Yes, I did want to just.
Sure.
clarify.
Supervisor Elliott, thank you.
So tell me again now, how many retreat buildings are there going to be?
Five.
Okay, so
five
now.
residents where they stay, right?
Right, okay. 5, and then how many people will stay in each one?
So there'll be 9 or 10 private rooms in each building. So for a maximum of 50.
Okay, so 50 people can stay there each retreat.
That's right.
Okay, and they'll be staying overnight.
That's right. For 4 10-day periods and a maximum of 4 10-day periods and a maximum of 4 3-day retreats each year.
Right. And then there seemed to be some concern about the sewage treatment, et cetera. So how many toilets are there actually going to be out there?
Well, there's going to be a lot of private rooms because they're silent retreats. You know, they try to minimize interactions between people. So we do have our septic person on the line, and she's going to address that question specifically. She's more qualified than I am.
Okay. And then for parking, so there was a concern stated earlier about parking alongside the road, et cetera, in front of people's houses.
Yeah, so the parking has been looked at by Public Works, it's been looked at by the Planning Department, and there's enough on-site parking to address the need.
Okay, assuming that there's only 50 people, there's enough parking. Is that right?
Well, there's 67 spots, so even if there's more than that, but you know, for example, that 185 special events, you know, they'll bring buses on, you know, and park them on site if people come from, you know, the Bay Area or whatever. But you know, for all but 4 days of the year, most of the parking spaces will be empty, most of them, for all but 4 days of the year.
Okay, thank you.
Anybody else like to speak on behalf of the opposition?
Hello, Supervisors. My name is Stephen Cho. I'm the architect, licensed in the state of California. Thank you for letting me address the board. I just wanted to address a couple of the points that were made in the appeal. One of the main points that seems to be a point of contention is the steeple. Just wanted to emphasize that the steeple is on top of a single-story building, right? Single-story building with a steeple that rises up to a point. It is not going to be lighted. I think it was mentioned a couple of times that they were concerned about a light shining down from the top of the steeple. There will be no light on top of the steeple. Just the whole point of a steeple is it's not a tower. It rises to a point so that it disappears up. It's meant to evoke a certain architectural style for this particular culture, and it has great significance, but it's not meant to be obtrusive in any way. As stated by the staff report, there is no height limit for these steeples. We are presenting it as part of the development plan, just to make sure that everyone is clear about what's going to go on. But technically, it's not really driven by the codes in terms of the height. The other issue, I think, was the square footage. There was a comment in the appeal about there being 27,000 square feet of building. There's currently about 80 some hundred existing on site that's going to get redeveloped, including the single-family house, which is not part of the application. So in total, it's going to be about 18,000 square feet of new building with some modifications to the existing buildings. And then it's stated in the report, but if you look at the actual area in relation to the overall property, there is no limit in terms of the floor area for this particular zone. But even if you take the most restrictive number, which I think is about 35%, this current project floor area winds up being about 11%. So it's significantly less than even the most restrictive floor area restriction that's in any of the zones. So it's very minimized. Finally, in terms of, personally, I am appointed member of a design control board down in LA County myself, and I think one of the things that is, I'm aware of is that the Board of Supervisors is the final appeal body, and so I do appreciate that. But one of the things that is important to remember is that, we've had 30 agencies that looked at this project, looked at the application. The staff has looked it over rigorously, and they've recommended approval. It was approved by the Planning Commission, also looked at rigorously, and so hopefully you guys can look at the application and deny the appeal, and give faith to the staff members and the Planning Commission who ruled in this matter. Thank you.
Hold just a moment in case any questions. Supervisor Wynn.
There was a picture of a shade structure, like talked about that being enclosed. How is that going to happen? Is it going to be torn down and rebuilt, or is it going to be just put up walls?
Pretty much just infill walls. It's a structural steel agricultural building. I'm not familiar with those particular types of building myself, but I believe it is, when it was permitted as an agricultural building, even though it is open. And so it is self-supporting, it's load-bearing, so it'll just be infilled and constituted.
And these 5 structures that you're building for accommodation for the guests, will they look like houses?
Yeah, so the original application back in 2012, they had 27 individual cabins spread throughout the property, and I think that was a point of contention. So to minimize the number of development that happens in the area, we consolidated it into 5 buildings with individual rooms to minimize the spread throughout the property. And so there's 5 buildings with 9 to 10 rooms, individual rooms each, with I think 3 of the buildings have ensuite bathrooms, and 2 of the buildings have shared bathrooms. So it's going to be addressed a little bit with the septic engineer. But one thing to remember is the number of bathrooms, the number of toilets was determined by the programmatic requirements to keep people separated, so that there's not interaction. It doesn't mean that there's going to be more flushes. I mean, if you have 50 people, they're only going to flush the toilet. Whether it's 1 toilet or 50 toilets, it's all going to be the same number of flushes. And so it's not going to increase the impact on the septic system. It's just the fact that, there's going to be increased costs in terms of building the individual bathrooms, but it doesn't really increase the actual usage of the system. That's driven by the number of people, and that's restricted by the restrictions that we put forth.
There's a landscaping plan that is included. Is the wall that we saw in the pictures, is that going to remain?
The wall in front of the property?
Yes.
I believe so. There's going to be some landscaping in front of that to cover up that wall. I believe one of the appellants was having some comments about the fact that there was not a lot of work that was being done on the property. I believe that the property has been cleaned up. Also, I think it's very understandable that if you're looking forward to doing work on the property, you want to do it all at once. And so you're not going to do a bunch of work that you're going to get torn out and redo again. So kind of looking forward to the development to put forth the effort to actually develop the property. So I think that's, I think it'll be a great addition to the neighborhood. It'll be something that the whole neighborhood probably could be very proud of.
Will the wall be expanded down the property lines on the exterior boundaries of that particular?
Yeah, I believe one of the conditions of approval is that there would be a perimeter wall across the whole property. There would be a 6-foot wall, masonry wall that encloses the property completely. That's a condition of approval from the planning department.
And does that, I read that in the report, but so it will have landscaping on the outside or the inside or both?
Both.
All right, thank you.
Yeah.
Anybody else in favor of speaking on behalf of the opposition to the appeal?
Online.
Correct. That's my next. Clerk of the board, do we have anybody online to speak on behalf of opposition to the appeal?
Thank you, Vice Chair Patty. We do. If they can hear me, I'm going to call on Abby Rako to speak now.
Hi, can you hear me?
Yes, we can.
Hi, my name's Abby. I'm the project manager at Live Oak Geoenvironmental. So I'd like to respond to the comment about the project having 40 toilets. The first point has already been covered to some degree, but the number of toilets isn't going to determine the daily flow through the toilets. So you could have a situation such as a gas station where there's a single toilet being used continuously throughout the day. That creates a very large flow. The opposite is something like this, where you have a larger number of toilets present, but they're going to only be used occasionally. So in this case, they're only going to be used when the buildings are occupied, which is only during the retreats. So potential impacts from a project are considered based on average daily flow throughout the year, which only, for this, it figures in only the days the buildings are being used, and it's averaged out throughout the year with the days that they're empty. So that reduces the amount. Second, I wanted to reiterate that the Environmental Health Department has reviewed our soil suitability and nitrate loading study, where we discussed the septic impacts, and they've also looked at drawings of possible septic system layouts. They concluded that the use of on-site septic tanks and wells will have a less than significant impact with the following mitigation measures. Then they lay out several mitigation measures that they're asking for the project. Third, we should keep in mind that this use permit approval is only the first step for the project. So prior to actual construction permits being issued, the applicant will need to prepare and submit detailed engineer drawings and calculations for the septic system. If the Environmental Health Department isn't satisfied that these mitigations will be effective, they're not going to approve the building permits. Finally, after construction, the Environmental Health Department will require that each of the septic systems be tested quarterly to ensure that the systems are meeting the design standards and performing in a manner that's protective of the groundwater. I'm happy to answer any questions you may have.
Board. Seeing none, anybody else in favor of speaking on behalf of?
Vice Chair Patty, we do have additional speakers online. Alex Georgievich, if you're available, please speak.
Okay, can everyone hear me okay?
Yes.
Thank you. Vice Chair, Supervisors, my name is Alex Georgievich, and I'm a professional engineer representing the project. I am here to address technical points raised by the appellant regarding this application, specifically concerns with the road width and statement that the road is straight. South Priest Road is approximately 24 feet paved in width and striped to approximately 23 feet in width, which yields two 11.5-foot travel lanes. The width is more than adequate and meets standards set forth by the American Association of State Highway and Transportation Officials, also known as AASHTO. Title IX states that a local residential road can carry 2,000 vehicles per day. The current traffic volumes on the road are approximately 700 vehicles per day and will increase by a minimal amount for a total far below the capacity stated in Title IX. Public Works staff supports the adequacy of the road as provided for in the approval findings, as well as a statement made by Alex Chetley during the Planning Commission meeting. Specifically, Alex stated that 11.5-foot lanes are perfectly acceptable, and only when a lane gets down to 10 feet does staff consider widening. He concluded by saying, quote, but 11.5-foot lanes should be plenty wide and does meet industry standards for lane widths. The next point involves a statement I made during the Planning Commission meeting while answering questions about the roadway. I stated that the road section was straight. This statement was made to address the frontage of the property and some distance either side for safety of vehicles entering or exiting the roadway at this location. The road indeed does have curves signed for 15 miles an hour, as already testified this afternoon, located approximately 2,000 feet north of the northerly property line of the subject site, and another curve approximately 1,200 feet past the previously mentioned curve. There is a slight bend in the road approximately 1,500 feet to the south of the southerly property line as well. The curves do not have an impact on the proposed development or traffic analysis provided during the application process. With or without the curves, the project still meets all the requirements, and staff recommends approval of the application. And that concludes my statements. I'm glad to answer any questions you might have.
Any questions at this time? Seeing none, Madam Clerk, do we have any other speakers?
Thank you, Vice Chair. I believe we have one additional speaker, Jim Kahn.
Mr. Kahn?
Okay.
I believe you've already spoke. We've got a lengthy presentation. We've heard plenty of this. There's something new or revolutionary to share. Okay, thank you. So then, moving on, do we have any? Do the appellant wish to rebut any of the comments? Yes, you do.
I have a letter here from Mr. McNamara. I'm sorry, I wasn't expecting. Yeah. It says, Dear Mrs. Ippolito, first, let me thank you for taking the time to speak with me on the phone Friday regarding the new project proposal. We've worked for the past year renewing the voluminous record that has created from 2012 to 2014 submission, paying particular attention to every concern expressed by neighbors. We believe that the new project concepts address each of these concerns. The changes that have been made are significant. I just want to read this because he said that I refused to contact him back, and I can tell you that I did talk to him. Matter of fact, I talked to him twice, and I have talked to the people at the temple. So I didn't want to have him say I didn't make any contact or try to make contact. And everybody knew the only things we wanted is we don't care if the temple's there. We really don't care. What we care is what it looks like and how they present it. And like I said, it's been there for 8 years and there's been no changes. So why should we think we're going to just all of a sudden jump into it? So they are living there. They already own the property. There should be something done. But I did, in fact, contact him back and speak with him. So I just wanted to.
Thank you.
That they said there wasn't going to be any light on the steeple itself, and that might be true because they stated that there were going to be lights shining up the steeple. So that's kind of a tit for tat, I guess. I'm not sure what they classify as lit, but they're going to light up they're going to light up the steeple. Thank you.
Thank you. If there's no further comment, I'm going to close the public hearing and bring it back to the board for any final comments or questions. Supervisor Elliott. Your light is on. Speak as a loud colonel.
There we go. Back in 2014. So I did travel that road back at that time. I've been out there since. I've gotten to know the Stevensons. I've visited their home. And the reason it was denied last time was that the decision was made that this just wasn't a good location for a project like that. Nothing against religious facilities per se. At that time, of course, they were talking about an 80-foot high pagoda steeple. This time it's only 62 feet, but still, that's a pretty dominant structure out there. And there are a lot of residences out there. And there is certainly the potential, as has already been noted. They had one celebration out there with 200 or 300 people, or maybe more. I can't remember the exact number, but considerably more than 185. And that's just a lot of people to be flooding out there into a residential area like that. And it just, I don't think that the conditions have changed significantly in the past 6 years. I agreed last time that it just wasn't a good location for that type of a facility, and I'm still of that opinion this time. Thank you.
Thank you, Supervisor Elliott. Supervisor Wynn.
Thank you, Vice Chair. This isn't my district, but my district covers over half the county, and it's primarily agricultural. So I will tell you that I deal a lot with complaints from my constituents in regards to activities that go on in their neighborhood that are inconsistent with maybe their quality of life. That's been ever since I've been on the board. I appreciate certainly the presentation by the project applicant. It sounds like you've done a lot of work in regards to trying to minimize the impact of this. But I'll be honest with you, in fact, Mr. Kwong and I just had a conversation at the break in regards to a complaint I've got in my district in regards to a large number of unmasked participants in a particular event. And I'm fully aware of, especially in my district, I have 88 wineries, so I have a lot of activities that are going on. But again, I can also tell you that I've sat, as Supervisor Elliott talks about, I've sat in a lot of homes and patios in regards to listening to complaints in regards to activities that are going on that the neighbors have no or little control over. I would agree with Supervisor Elliott. I think this is probably not the appropriate place to have this type of structure or project because it just inevitably turns out to be a project for code development frequently, and I certainly appreciate the willingness. But again, I would just say this: in spite of the regulations we have in our county in regards to events and numbers and all the things, but was mentioned here is, I can't tell you how many complaints I've had over the years in regards to parking in orchards because of the overflow expansion of the activities. So again, I have some concerns about this particular project in this particular location. So thank you, Vice Chair.
Thank you, Supervisor Wynn. Yes, Supervisor Villapudua.
Thank you. You know what? This is my district, and I've been down this road and I've seen the project, and I understand your frustration, but I think they're going to make a good effort to be good neighbors. They're going to, I mean, you said they weren't working on their property. I think they're going to make the best effort they can to make it attractive for their parish, for for their people who show up, and most of the people who go to their events are going to be meditating. So I have no problem with it in my district. I think they're going to be good neighbors. I think they're good people. And I think that I think it's appropriate for this area. I have no problem with it. I think the Eagles will do a good job, and I think eventually you'll be happy with what they're doing. I do support you guys.
Thank you. I have a question for the planners, the architect, some of the project managers. You occupied the land and you're currently using it, and it did not look attractive in spite of the efforts. You got a big cinder block wall. How do we establish that you are a good neighbor? It hasn't been validated at this point.
Thank you, Vice Chair. It's a good question. I'd like to repeat what the architect said, is that, they've been waiting on planning approval to build out the property. So they cleaned it up. They took down all the dirt and everything to have a cinder block wall out there. But until we get planning approval, we couldn't start to do it piecemeal like that. And another important point is that the Planning Commission built in as a condition of approval annual check-ins with the Commission through the Community Development Department for an indeterminate amount of time. So for as many years as the Planning Commission deems it useful to check up on the project and make sure we're doing what they said they were going to do, everybody's happy, we'll engage with the neighbours, we're happy to engage with the neighbours, and moving forward, be a good neighbour. It doesn't work unless we're going to be a good neighbour. It's a meditation centre, it's not a nightclub or whatever, it's a meditation centre, and unless, we're working in the community, it's not going to work for us either. And the Planning Commission have built that in.
So the Planning Commission built that in.
Yes.
Effective back when you started to occupy the property?
Oh, effective from the June 18th approval.
Effective June 18th.
Yeah.
So what I struggle with, though, is that thus far you haven't shown any ability to be a good neighbor and be inconsiderate. You have one of those speaking in favor of denying this said, you're there, but you're not showing any consideration. You're not showing that you're a good neighbor. You're not showing that you be respectful to landscaping and what it looks like to have a cinder block wall to stare at.
Well, the site plan shows an extensive development on the property, and so what could we do without planning permission? Until we get planning permission, we can't develop the property. So we were in a holding pattern.
But you put up a wall.
We put up a cinder block wall, yeah.
Right. And there's no landscaping around your cinder block wall.
There are trees planted in front of it. They haven't fully grown out yet, but there is landscaping in front of it, yeah.
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 Okay. Any further comments from the board? If not, then...
All I can say is it's hard for them to develop it if they have no approval. I mean, they're going to spend money when they don't have any approval, so I understand what they're going through. But you are going to fix it up, correct?
Yeah, and the Planning Commission is going to make sure we do.
Well, it's difficult to revoke what the Planning Commission's approved and what gets approved or denied here if you can't take away your building. If you haven't been a good neighbor and you're not putting up landscaping and making the place look nice, and it's an eyesore, you can't take that all away.
I think that's what the yearly check-ins, they provide a mechanism to hold the Burmese people's feet to the fire to keep on track, or else it'll be a big headache for everybody. Right?
Or what? Can't lose your building.
I don't know.
Okay, understood. Thank you. Yeah. Bringing it back to the board. A motion in any capacity?
I can make a motion to deny the appeal and approve and uphold the Planning Commission's recommendation.
All right, I have a motion to deny the appeal. That motion doesn't carry. We have another motion. Do we need a motion if this doesn't carry to deny the appeal?
No second in the motion.
Okay. Then for now, this motion's dead. We don't need any further motion, do we?
Yes, you do.
Oh, we do? Okay.
Second.
I have a motion and second. Motion carries 3-1. All right, moving on. Last thing we have to discuss is board comments or committee reports. Supervisor Elliott. Nothing to report yet. Good thing you've been electronically disconnected. Supervisor Wynn, anything at this time?
Had a meeting with the San Joaquin Valley Regional Policy Council, which is the 8 Valley counties, and we are all concerned obviously about the impact of COVID-19. We're preparing our virtual trip to Washington, D.C. in September to argue for obviously a lot of projects dealing with transportation and COVID-19 grants. So that's my report. Thank you.
Okay, Supervisor Villapudua.
Nothing to report.
Nothing this time. Okay, then briefly I will share. I'd like to ask our CAO to maybe look into this, but I think we were all notified, but Kitty Roostaller brought to my attention, all of our attention, that the cyanobacteria is found in our local waterways, and I looked in and drove out to a couple of our public waterways, and we saw little paper signs posted, yet we know that people go out in the water, they're fishing, they're taking their dogs in, the dogs are dying because of the ingestion of some water. I'm wondering what more we could do. And I think we might want to look at our public health department to maybe put bigger, large postings and perhaps in more visible areas. The one posting I saw out at the Victory Park, Dad's Point, was just a piece of paper posted on a marquee, a sign out there. You couldn't read it. You wouldn't know what it is. So I'm thinking that in this time of a large bacterial breakout in our water, we need to do more.
Supervisor Patty, in regards to, was it authored by Public Health or Environmental Health or another water board?
Great question. I think it was Environmental Health.
Okay.
But if you could look into that and find out who's posting it and who's responsible, if it's Public Health or Environmental, but there is a health issue out there with that water.
I will follow up. More than likely, it's my natural reaction was Environmental Health, but we will follow up. We may bring it, if we find out sooner, we possibly may not bring it back to the next board. We may just provide a memo to let the board know what action staff is taking as a result of that comment.
As we've talked about signage, I'm a sign guy, so we need something big and bold for caution water, maybe a press release to newspapers, and may even be a notice that we send out through our emergency services, because it is critical. And I know that people's pets can die from ingestion of that water. Also, is there an update on Air Park 599? I know we talked about that recently.
There will be. Our goal is that we may be bringing it to the full board in October, but prior to that time, we'll probably do some individual briefings at that point. We're so close to making a recommendation, we just thought it would be redundant to bring an update, and then we follow up within 30 days, there for approval. So since we've had some good discussion with our master developer and making augmentations to the updated agreement, we will bring that, and like I said, we will schedule probably in mid to late October, so it's ready for the last board meeting in October.
Excellent. Some exciting news, perhaps?
Yes.
Excellent. Thank you very much. Lastly, I just want to share that on national news, we saw it locally, but there was a daring rescue in right here in California, in our neighborhood in Lodi. Wednesday morning of last week, police officer Erica Urea of Lodi Police Department pulled a 66-year-old disabled man that had his wheelchair stuck in the tracks as an oncoming freight train was approaching at full speed. This made national news. We have a champion right here in our San Joaquin County. It was literally, she saved that man from within seconds of being plowed over with that train. While everybody's challenging and yelling about defunding the police, I believe that we have a local hero, and just want to recognize her at this meeting, and I'm sure in the future we can give her maybe even more proper accolades, but just another fine example of a police officer serving in our community. And I know we've got officers from military and former highway patrol officers that serve our community, but here's a shining example. So thank you. That's all I have at this time, and we are going to adjourn to closed session.
Board will meet in closed session on the items listed on the agenda. There may be announcements following closed session.
Okay, thank you. We are adjourned. All right, closed session. County Council, anything to report?
The board has authorized council to file a response in the matter of California Department of Water Resources versus all persons interested in the matter of the validation of Delta revenue bonds. Complaint for validation. That's all we need to report from closed session, Supervisor. We do need to discuss, there was an issue with the last action that the board took on the appeal of the Kusalakari on the public hearing regarding the appeal by Craig and Sue Stevenson and Lorraine and Richard Ippolito, Planning Commission's approval of use permit number PA 1800177 of the Kusalakari Corporation. After we went to closed session, Supervisor Patty, you informed me that you had voted. See, the motion that Supervisor Elliott made was a motion to grant the appeal. And that was a motion that was seconded, I had in my notes, by Supervisor Nguyen.
Correct.
Supervisor Patty, you indicated that you had voted against that motion.
Correct.
But yet it was the vote was reflected as a 3-1. Supervisor Villapudua confirmed that he had also voted against that motion.
Correct.
That's correct. And in looking at minute track, it appears, Vice Chair Patty, that it marked you as the seconder, which made it an automatic yes. Even though it was Supervisor Nguyen who had seconded the motion.
Got it. So we have, okay.
So correcting the record, as it has been represented, it was a 2-2 vote. We've now lost both Supervisor Miller and Supervisor Villapudua. The effect of a 2-2 vote is that it is a no action, because the government code requires that all actions be carried out by a majority of the board. So a 2-2 vote is no action on the appeal. My recommendation to the board is that this matter be continued until September 1st, so that the full board is here, and a subsequent motion can be made at that point. But it's being continued with the matter closed. Yes. Well, it takes yes. So 3 is required in order to have a quorum. So with 3 of you here, yes, a subsequent motion could be made, and the 3 of you could address that issue here. My recommendation, since we did lose Supervisor Villapudua after the closed session discussion, or actually during the closed session discussion, is that the matter be continued over with the public hearing closed to September 1st, so that the board is here in its fuller capacity to vote on it.
I'm not
Yes.
process.
Yes.
Decided to require 3.
It would require a majority of those present. So in this situation, a 2-1 vote would be a successful vote.
At all?
We should have a motion to continue that to September 1st with the public hearing closed.
Okay.
That's correct. That's correct. It will just be a revote. It'll be a discussion amongst the board, but there will be no new testimony. That's correct. Yes, she could.
Somebody make a motion in some capacity. Somebody make a motion. You have that motion? Okay. A motion and a second.
We can do a voice vote if you want. I think.
Please.
Okay. Supervisor Elliott. Supervisor Nguyen. Supervisor Patty.
No. All right, we have a 2-1. That motion carries. County Council, if there's anything else, or I'll adjourn this afternoon session.
Adjourn to September 1st.
We are adjourned till September 1st. Thank you, everybody.
Okay, I'll be right there.